Am I visible, audible to everyone? Can you please confirm? Yeah, I think everything is okay. Can you please confirm in the WhatsApp groups that am I audible, visible? Am I audible, visible? Okay. Good morning, good morning, good morning, everyone. Thank you very much for confirming. Thanks a lot. And let's be active on the WhatsApp group. If you have got any question, query, anything, the WhatsApp group is a wonderful medium to use along with this thing. So let's start this day. So it's 16th of June. We are almost 44 days away from the examination, and let us use this day as a very like productive day, not reproductive day. Unfortunately, it's the time of productivity, not reproductivity. And if you ask me, Rajiv, like you appeared in MRCS or the PG paper and all that, what is the most important part of the cycle of preparation is the last few weeks. Like you're close to the last 6 weeks of the preparation, and this is the time actually which everybody should be super devoted. सबको devoted होके काम करना है अभी, because this is game changer. Believe me, game changer means whatever motivation, so called, whatever we take from other people or whatever reasons we really feel drawn to the books, हमारा पढ़ने का मन करता है. लेकिन you must have felt, tell me in the chat box, yes or no. WhatsApp, when I say chat box, I mean WhatsApp chat box. अब ईमानदारी से मुझे बताना, सोच समझ के, English I'll say, don't you think all of us in the last couple of months when we were preparing seriously for the paper, we had a couple of phases in which for a few days we did not feel like studying. तुम्हें लगता है ऐसा हुआ है कि बीच में लास्ट में जितने मर्जी मोटिवेटेड थे, लेकिन बीच में ऐसा टाइम आया जब 2-3 दिन या किसी दिन या 2-4 दिन हमारा पढ़ने का मन ही नहीं किया और हम थोड़ा सा प्रोडक्टिविटी थोड़ी हमारी कम रही या बिल्कुल जीरो रही. डू यू थिंक दैट इज राइट? ऐसा हुआ कि नहीं हुआ? मतलब बताओ, टेल मी, डिड इट हैपन? Did you feel that in the last couple of months when you were preparing for the paper, कुछ दिन ऐसे आए जब पढ़ने का मन नहीं करता, थोड़ा लो था और अच्छा प्रोडक्ट नहीं आउटपुट निकल पाया, बहुत मतलब फटीग था, आफ्टर द क्लास ड्रेन थे, रिवीजन नहीं हो पाया या 2-3 दिन छुट्टी थी तो भी नहीं पढ़े? डू यू थिंक that happened? Yes or no? Did you think that was? Yeah. Okay. Now hang on for a minute. I'm seeing the chat box simultaneously. Now everybody hear me carefully. Yours is maybe first or second or third paper of FMG. मैंने क्लास में बताया, इट माय 25th पेपर एक्चुअली, एंड मैंने अपने भी बहुत सारे पेपर दिए. इन एनी एग्जाम व्हेन यू प्रिपेयर, कुछ ना कुछ दिन ऐसे होंगे और हुए होंगे जब आपका when your output was not 100%, or zero, maybe zero, couple of days you zero. It's absolutely normal. It's absolutely normal to have this kind of in between breaks of the continuity of preparation, but that does not mean that you're not serious. That does not mean you're not sincere for preparation. That only means that you're a normal human being. All normal human beings would have waxing, waning kind of attitude towards the preparation. But now, when we are entering the last cycle of, I'm glad my class is at 16th of June, when we are close to 6 weeks away from the paper. I would say आज से commitment करते हैं. Commitment to yourself first of all, अपने आप से commitment तुम्हारी, and then commitment to me also as an elder brother, that whatever has happened till now is okay. Whatever subjects I could not do properly due to one or the reason, okay. But in the last 6 weeks now, these 44 days now, I will try to do my 200%, not 100%. Nothing should be left from your side जो आप कर सकते हो और ना कर गुजरो. Maybe some subjects are weaker for you, some topics of the subject are weaker for you, कुछ subject आपने touch भी नहीं किए, after the class was over due to one or other reason, some subject you did not feel like studying, it's not a problem. Believe me, I have seen many people passing the paper in last 24 cycles of the exam who were not prepared. जो 6 हफ्ते पहले बोलते थे कि सर मेरा तो ये रहता है, मेरा वो रहता है, मैंने वो नहीं पढ़ा, I've not studied this much, I've not revised that, I've not done the MCQs of that topic, I've not seen that part at all. But if we step up the game now, if we get more dedicated now, and if you're ready to make a commitment now in the chat box with me, and first of all to yourself, that whatever the result of the exam may be, I would be doing my 200% in the remaining 44 days of preparation. I would not compare my preparation with my friend's preparation. I would not really feel that if some part of the subjects are weak or some subjects are weaker, I'm not having the chance of passing. Let us keep the hope of passing alive within us. That is the main ingredient of success. That पहले तुम्हें अंदर से लगना चाहिए that you should feel that I am very close to passing. But I understand हमारी काफी कमियां रह जाती हैं preparation में. We have certain areas where we're not actually pretty confident about. उस समय लगता है कि नहीं हो पाएगा. But always remember, this exam is about scoring 150 out of 300 without any negative marking. That's a blessing. Believe me, that's a blessing actually. And it means that even the paper setter feels that if you know half of the paper without doing any silly mistakes, we will crack the paper. So let us start this day with the prayer together. Together prayer, whichever God you follow. I have my own religion probably. Whichever religion you follow, whichever God you follow, whichever faith you follow, all of us, please start this day with the prayer in your heart. May I pass. May my friends also pass. May I pass. May my friends also pass. May the hope of passing within me be alive till the last second of exam is over. Very important thing, huh? May I pass. May my friends also pass. And may the hope of passing this exam be alive within me till the last second of exam is over. हिंदी में ऊपर वाला करे मैं पास हो जाऊं, मेरे यार दोस्त भी पास हो जाएं, और मेरे अंदर ये उम्मीद लास्ट सेकंड तक बनी रहे कि मैं पास हो जाऊंगा जब तक ये पेपर खत्म नहीं हो जाता. इस प्रेयर से let us start the day. Let us use these 6 hours to revise the highlights of ENT, and we would definitely be, preparing, like the content like together on the basis of workbook only. No more writing actually. Only go through the content with me along together. That's all about it. So let me share the screen now. This session will be online live, beta, and this would be only for. There's कितना ENT पढ़ना है यार. एक बार रिवाइज करते हैं, इकट्ठे खत्म, कल पेपर करेंगे, and that's all about ENT. फिर आगे चलेंगे. और भी करना है, सब्जेक्ट करने हैं ना, ठीक है? Just let me share the screen with you, beta. Okay. Perfect. Perfect. Chalo. Let us start the first topic with the larynx. Everybody open up the larynx. Are you ready with the larynx workbook, beta? Say yes in the chat box so that I'm sure that you're with me aligned. First topic we'll revise in next an hour. Main points of ENT larynx, beta. Everybody, are you ready? We'll be trying to cover the previous year questions in the same this thing. I'll touch upon that part also. Everybody, are you ready with the larynx, beta? Chalo. Now, larynx. Can we start, beta? Everybody, are you aligned? Okay. Some of you please confirm, because absolutely okay. Great. चलो larynx start करते हैं. चलो बेटा, everybody larynx. चलो अब सब कुछ छोड़ छाड़ के मेरे साथ भूल जाओ. ENT राजीव धवन बैठा हुआ है, कोई भी नहीं बैठा हुआ. Nobody is sitting over there. We are revising content together as if मेरा भी exam है बेटा. If I am an FMG, I'm preparing for the FMG exam of July to 30th 2023. How would I revise the ENT after the class is over for the final preparation before the test is tomorrow? है ना? मैं कैसे पेपर देखूंगा? ये ऐसे करेंगे. चलो शुरू करते हैं. Larynx is made of 6 cartilages. Everybody knows that. and out of 6, 3 are unpaired and 3 are paired बेटा, है ना? ये तो पहली लाइन होती है और इसमें क्वेश्चन आ जाते हैं. Number 1 is unpaired cartilage बेटा. चलो, everybody speak with me. What are unpaired cartilage? Thyroid, cricoid, epiglottis. What are the MCQ बेटा? Thyroid is open book like cartilage. Everybody, open book like cartilage. And the MCQ is cricoid. Cricoid is the MCQ. Everybody, cricoid is MCQ. Cricoid is complete ring like cartilage. Remember, beta? Remember, tracheal rings are not complete rings. They are C-shaped rings, and the defect is covered by which muscle, everybody? And can you tell me what is this muscle? Write down the chat box. What is the muscle, beta? Trachealis muscle. But the cricoid is a complete ring-like structure in the larynx. Complete ring-like structure in the larynx. Okay, fine. Okay. Now, next one is the epiglottis, ring-like structure in the larynx. Complete ring-like structure in the larynx. Okay, fine. Okay. Now, next one is the epiglottis is a leaf-like cartilage. Epiglottis is a leaf-like cartilage. Epiglottis is a leaf-like cartilage. Now, guys, everybody, you know, epiglottis covers vocal cords. Vocal cord is glottis. कभी भी MCQ में word आए glottis, it means vocal cord. Vocal cord, glottic carcinoma, glottic pathology. Glottic मतलब vocal cord की बात हो रही है. Okay? ना MCQ बता. Epiglottis is a soft cartilage. Soft matlab elastic cartilage. Soft matlab elastic cartilage, and it does not ossify with age. Is MCQ beta. MCQ question. It does not ossify with the age. It does not ossify with age. Okay. Don't let us. Cricoid is the complete ring-like cartilage. Epiglottis is elastic cartilage. Epiglottis does not ossify with the age. Beta. Now everybody knows thyroid angle. Angle between the two laminae of the thyroid cartilage. Everybody, what is the angle in males? 90 degree. Female may 120 degree. Beta. Male 90, female 120. Everybody. Prominence of thyroid cartilage in males is called Adam's apple. क्या बोलते हैं बेटा? Adam's apple. Prominence of thyroid cartilage in males is called Adam's apple. ADAM. Okay. Adam's apple. Prominence of thyroid cartilage in males is called Adam's apple. Now let us go to the everybody. 3 unpaired are thyroid, cricoid, epiglottis are unpaired. What are 3 paired beta? Number 1 is corniculate. Number 2, cuneiform. Number 3, arytenoid. Everybody, you know, corniculate, cuneiform are useless, rudimentary cartilages, and arytenoid make posterior 1/3 of vocal cord. Beta. Remember, beta, arytenoids make posterior 1/3 of the vocal cord. If you remember this picture we discussed in the class also. This was the picture we discussed in the class. Okay. Now, this was E. This was E, but what is E? E for epiglottis. Okay. And this is vocal cord. And this is A. What is A, beta? Arytenoid cartilage. Arytenoid make posterior 1/3 of the vocal cord. Beta. Everybody, what is this ring-like cartilage? This ring-like cartilage is cricoid. This ring-like cartilage is cricoid cartilage. Okay. Fine. Now, let us go further. Now, this is go for now. Voice in adults. Voice in adults. Males have low pitch voice. Males have low pitch voice. Okay. Now females have high pitch voice. याद है? मेरी आवाज dull voice है. Male voice dull. Males are dull part of creation. Female are fine part of creation. Female fine voice मतलब sharp voice मतलब high pitch voice. Male मतलब dull voice. Look at my voice. This is dull voice. Is a croaky voice, matlab low pitch voice. Lekin if reverse happens, beta, reverse. Number 1, puberphonia. Remember, if Narendra Modi speaks like Mamata Banerjee, is puberphonia. If a male speaks like a female, puberphonia. And how to remember this patient, beta? High pitch voice in adult male, feminine voice. Okay. लड़कों में low pitch होनी चाहिए. High pitch voice in adult male is puberphonia. It's a young, shy male. Young shy male बेटा. Young shy male. ऐसे क्वेश्चन होगा. एक लड़का है 20-22 साल का, बहुत shy है, doesn't talk to anyone. Treatment is speech therapy. What is the name of exercise, everybody? Can you tell me what the name of exercise? Which maneuver? GUTZMANN. Gutsman's maneuver. Gutsman's maneuver. ओके, गट्समैन मैन्यूवर बोलो, क्या नाम है बेटा, क्या नाम मैन्यूवर का, गट्समैन मैन्यूवर, GUTZMANN, गट्समैन मैन्यूवर. Pull, basically push the thyroid cartilage backward and speak. For how many months, beta? For 6 months. If it fails, then we do what, beta? SX. What is SX, beta? Anybody? What is SX? Surgical treatment. What is SX? Surgical treatment. What is the name of the surgery, beta? Type 3 thyroplasty. Remember for thyroplasty, beta? Type 3 thyroplasty is surgical shortening or loosening of vocal cord. Once again, puberphonia means males having high pitch voice. What is the name of maneuver? Gutsman maneuver. What is the name of surgery? Type 3 thyroplasty. What is type 3 thyroplasty? Surgical shortening or loosening of the vocal cord. Beta. Surgical shortening or loosening of the vocal cord. Okay, fine. Now, androphonia. Androphonia is low pitch voice in a female. Low pitch voice in a female, matlab masculine voice. If a male speak like a female, puberphonia. If a female speak like a male, androphonia. Matlab low pitch voice in a female is androphonic sound. Treatment is surgery. Anybody, what is the name of surgery? Can you tell me? What is the name of surgery? Type 4 thyroplasty. What name of surgery? Type 4 thyroplasty. Type 4 thyroplasty. Okay, type 4 thyroplasty. Okay, so उसमें type 3 था, इसमें type 4. Type 4 thyroplasty. Okay, fine. Now, surgical shortening or loosening of vocal cord, and type 4 is surgical lengthening or tightening of the vocal cord. Surgical lengthening or tightening of the vocal cord. Okay, ये हो गए हमारे 4 MCQs बेटा. Okay, now, so everybody ask yourself, are you clear about these questions of your paper? What is puberphonia? What is puberphonia, beta? Puberphonia is high pitch voice in males. What is the name of maneuver for puberphonia? Gutsman maneuver. What is the name of surgery for puberphonia? Type 3 thyroplasty. It is surgical shortening or loosening of vocal cord. What is androphonia? Low pitch voice in a female. And what is the name of surgery? Type 4 thyroplasty. And the type 4 thyroplasty is the surgical lengthening or tightening of vocal cord. So what are primary treatment of choice is speech therapy. Only if speech therapy fails, then only we do surgery. Beta. Primary treatment is speech therapy. Okay, fine. Now let's go next one. Beta. Membrane of larynx. Beta. Everybody, can you tell me what is this membrane? Beta? Thyroid membrane. What is number 2? Beta? Cricothyroid membrane. Thyroid membrane. Number 2, cricothyroid membrane. Number 1, thyroid membrane. It is pierced by very important nerve. Beta. Internal branch of superior laryngeal nerve. Internal branch of superior laryngeal nerve, also called internal laryngeal nerve. Nobody should forget this nerve, beta. This is the nerve which prevents aspiration. Everybody speak with me. Which nerve prevents aspiration? Internal, other name of internal branch of superior laryngeal nerve. So there's no difference between this. It's same nerve, beta. Internal laryngeal nerve, also called internal branch of superior laryngeal nerve. It is a nerve which prevents the aspiration. Beta. Number 2, superior laryngeal vessels. Beta. And number 3, laryngosele. Don't forget, beta. There are 2 questions in front of you. Internal branch of superior laryngeal nerve, also called internal laryngeal nerve. This is the nerve which prevents what, beta? Aspiration को कौन prevent करता है? Internal laryngeal nerve, beta. और laryngosele कौन सी membrane को pierce करके बाहर आती है? Answer is thyroid membrane. Laryngosele pierces which membrane to come out, beta? Thyroid membrane, beta. Don't forget these 2 questions, beta. Okay, beta, fine. Everybody, okay, fine. All of you, please inform your friends also. If you have a friend in your connection, ask them to attend the session live only. Unfortunately, the session cannot be available. Actually, I'm not allowed to conduct the online session. You know, I have another application which I work with. They don't allow me to conduct any online sessions like this. But because students were asking again and again, that's why I'm doing this session. Otherwise, last session we did only previous recorded session was available actually. It's only for you guys I'm doing this session. But you all are understanding that, you know what, we cannot have these sessions because when the app is recorded somewhere else, you cannot do. But just to, you know, make sure that we have one session like this for all of you, we are doing this online live for all. But inform your friends, please attend online live actually. But okay, fine. Now laryngosele, nobody should forget. But laryngosele is actually the important question. It pairs with which membrane? Thyroid membrane. Now, cricothyroid membrane. Everybody, can you tell me? It is site of surgery called cricothyroidotomy. Remember, beta? Everybody, do you remember, beta? If you make a hole, patient get breathing problem. I'm not getting breathing. I do a hole over here. And what is the name of surgery? Cricothyroidotomy. So cricothyroid membrane is a site of surgery called cricothyroidotomy. It is done in when, beta? Cricothyroidotomy is done in acute airway obstruction. Okay, saas nahi aa raha, and mostly we do tracheostomy. Second option is cricothyroidotomy. Okay, beta, cricothyroidotomy. Now everybody, mucosa of larynx, very important. Tell me, beta, look at this picture. Larynx is lined by ciliated columnar epithelium, except vocal cord. Beta. Look at picture. Beta. Vocal cord are white in color. Vocal cord are lined by stratified squamous epithelium, like skin. Stratified squamous epithelium. Once again, beta, the larynx is lined by ciliated columnar epithelium, except vocal cord lined by stratified squamous epithelium. Beta. And I hope you remember, in some smokers, vocal cord epithelium sheds faster. What is the name of disease, beta? What is the name of disease? Keratosis larynx. Very important topic. Keratosis larynx, beta. Okay. Important thing is it's a pre-malignant disease. Okay. Now, how the patient will come, beta? Smoker with the hoarse voice, beta. When vocal cord kharab, awaz kharab. Simple feeling. Vocal cord kharab, awaz kharab, beta. The vocal cord problem is the voice problem. So smoker with hoarse voice, think about this possibility. Okay. Now treatment is surgery. The surgery is called stripping of vocal cord mucosa. Stripping of vocal cord mucosa. Stripping of vocal cord mucosa. Okay. Mucosa nikal do. Also called decortication. Plus quit smoking. Quit smoking. And I hope remember, other treatment is laser surgery. Which laser, beta? CO2 laser cordectomy. Okay, CO2 laser cordectomy. CO2 laser cordectomy. Okay, fine, bache, fine. So, keratosis larynx matlab vocal cord epithelium sheds faster. Smoker में होता है. Smoke आवाज खराब है. Dysphonia. Phonia मतलब आवाज. Okay. Dysphonia. So smoker with hoarse voice, and treatment is surgery called stripping of vocal cord mucosa, also called as decortication, plus quit smoking, and laser is also to be kept in mind. Okay, beta, fine. Chal. Now let's go further. Three division larynx: supraglottis, subglottis, glottis. Look at me, beta. Vocal cord के ऊपर supraglottis, vocal cord glottis, उसके नीचे subglottis. Supraglottis, glottis, subglottis. Don't forget glottis मतलब vocal cord, beta. Okay, fine. Now, how we differentiate keratosis from the other, Mehran? We do endoscopy. See, dysphagia has got 100 diagnoses. Hoarse voice has got 100 diagnoses. How we do diagnosis? We do endoscopy first. Then we take a biopsy. Then we prove. You are very right. Mehran, very intelligent question. Is hoarse voice in smoker only one diagnosis? No. Think about dysphagia. It can have 100 diagnoses, beta. Hai na? Same over there. Mehran, did you get my point, beta? Very intelligent question, but very good, very good. Supraglottis, beta. It has got 5 parts, beta. 5 parts. Everybody, number 1, epiglottis. Number 1 is epiglottis, beta. Number 2, epiglottic fold. Everybody, what is this, beta? Everybody, what is this E? What is E, beta? Epiglottis. What is A, beta? Arytenoid. And what is this fold? Epiglottic fold, beta. Vocal cord, glottis. But false vocal cord are part of supraglottis, beta. Pink one, false vocal cord, also called ventricular bands. Ventricular bands, beta. Okay, fine. And between the false cord and true cord, we have a space called ventricle, beta. You know ventricle? You see what is ventricle, beta? Ventricle is a hidden space between false cord and true cord, beta. Okay, and don't forget the word saccule, beta. MCQ. Saccule is outpouching from the ventricle, beta. Okay, fine. Let's revise, beta. 5 parts of supraglottis, beta. Number 1, epiglottis. Number 2, epiglottic fold. Number 3, false vocal cord is equal to, look at notes, beta, ventricular bands. False means rudimentary. What is rudimentary, beta? What is rudimentary? Useless. What is rudimentary, beta? Useless, beta. Rudimentary means Useless. Rudimentary matlab useless. Okay, fine. What is ventricle? Ventricle is space between false cord and true cord. And MCQ beta, saccule is a mucosal outpouching from ventricle. It is also called what anybody? Oil can of larynx. Oil can of larynx. Fine. Oil can of larynx. Okay. These two are, look at your note, beta, hidden areas. Ye dono kya hai? Hidden areas. Beta. Hidden areas. Na? Dikhte nahi hai. Now, everybody, what is the other name of false vocal cord? Ventricular band. Guys, they are rudimentary. If some patient starts speaking from a false vocal cord, what is the name of disease? Dysphonia plica ventricularis. Dysphonia plica ventricularis. Dysphonia plica ventricularis. Okay, define dysphonia plica ventricularis. So, everybody look at me, beta. We speak from true vocal cord. If a patient starts speaking from false vocal cord, other name is ventricular band. Ventricular band मतलब plica. Dysphonia plica ventricularis एक disease है जिसमें patient starts speaking from false vocal cord. मेरे साथ बोलो बेटा, everybody speak with me. Nobody should be sitting quiet in the room बेटा. ऐसा नहीं कि inert सा day बिताना है. मेरे साथ बोलो everybody. सबने बोलना है. शर्माना नहीं, कोई सुन रहा है. That's not none of business बेटा. Speak with me, everybody. If a patient produces sound using false vocal cord, what's the name of disease, beta? The answer is dysphonia plica ventricular. Dysphonia plica ventricularis. Now star question, beta. Laryngoscele. Yaad hai, beta? Everybody, laryngoscele is a abnormally dilated saccule, beta. Remember, trumpet blower with neck swelling is 100% laryngoscele, beta. Trumpet blower, saxophone blower, bagpiper blower, any wind instrument blower, and he present with the neck swelling, I know the answer, it's laryngoscele, beta. Don't forget, beta, everybody. Please see, anybody, what is H, beta? Hyoid. What is T, beta? Thyroid. What is this membrane called? Anybody? Thyroid membrane. Everybody, laryngoscele pierces which membrane to come out? Thyroid membrane. Beta. Laryngoscele pierces which membrane come out? Thyroid membrane. Beta. Don't forget one. Trumpet blower with the neck swelling, I'm 100% sure it's laryngoscele, and it pierces which membrane to come out? Thyroid membrane. When you press it, beta, when you press it, the air leak is heard. The sound is heard, beta. What is the name of sign, beta? What is the name of sign? Bryce's sign. What is the name of sign? Bryce's sign. Not the Boyce's sign. Boyce's sign is in Zenker diverticulum surgery topic. Boyce's Zenker diverticulum surgery topic. Bryce's laryngoscele, beta. Laryngoscele, everybody. Okay, fine, very good. Now, everybody, Bryce's sign. Don't forget, X-ray is done with what, beta? X-ray is done with what? Anybody? X-ray is done with the Valsalva. You know Valsalva? Like this, beta. Valsalva. Okay, treatment is surgery, beta. Treatment is surgery, everybody. Okay, very good. Perfect. So laryngoscele nahi bolna hai, beta, hai na? Kal paper hai. Everybody hear me carefully now. Tomorrow paper will be having some, question which some question which you think about the question, then you answer it. Don't do silly mistakes. Kal 100 question aayenge. Tomorrow paper will have 100 question. I have myself made that paper in a systematic manner so that you get the real experience of ENT in the exam. Don't expect any question. There may be some changes in the question. Don't expect, oh, ye question class mein discuss hua tha. That may be a different question or looking similar, beta. Please read till the last line. There will be some surprises in the paper. I'm telling you already. Like the surprises in the real exam also. Kal sirf ENT ka paper nahi. Kal 100 minute leke pura 100 question karo beta. हम लोग 40 मिनट में 100 क्वेश्चन करते हैं, गलती होती जल्दी आता है नंबर आना चाहिए, कल नंबर भी आने चाहिए बेटा. कल एक चैलेंज है आपके लिए. टुमारो यू हैव अ चैलेंज. प्लीज डू नॉट फिनिश पेपर बिफोर टाइम बेटा. आराम से पढ़ो बेटा, आदत डालो. लेट अस नॉट डू ईएनटी. मैं हमेशा बोलता हूं ईएनटी तक बहाना है, हमें पास भी कराना है भाई. ईएनटी इज जस्ट एन एक्सक्यूज यार. ईएनटी तो जस्ट एक्सक्यूज है. मुझे सिर्फ एक मैसेज चाहिए तुम लोगों से कि राजीव पेपर पास हो गया, खत्म. मुझे ईएनटी उसमें कितना कंट्रीब्यूट करती है भगवान जाने बेटा, वो तो ऊपर वाला जानता है. मतलब मैं तो हमेशा क्लास में बोलता हूँ, मेरा पढ़ाया वो समझ आए, पढ़ाई में से क्वेश्चन आए, वो ऊपर वाला डिसाइड करता है. मेरे को वो सब नहीं पता. मेरे को इतना पता है ईएनटी एक महान है, हमें आपको पास होते हुए देखना है बेटा. एक मैसेज की दरकार है. वन मैसेज इज नीडेड फ्रॉम यू गाइस. राजीव, आई पास द एग्जाम. दैट इज द होल थिंग अबाउट दिस होल थिंग एक्चुअली यार। तो उसके लिए सिली मिस्टेक्स पे कमी करनी है। कल के पेपर में सबको एक इंस्ट्रक्शन है, डोंट बी फास्ट इन द पेपर। आराम से पढ़ के ये ओह अच्छा ये वही क्वेश्चन आ गया, नहीं नहीं ऐसा नहीं, थिंक अबाउट द क्वेश्चन। ओह कुछ का कुछ नहीं पढ़ना, देयर विल बी सम स्मार्ट थिंग्स इन द पेपर, ध्यान से पेपर पढ़ के करना है ना। तो कल जल्दी नहीं है, कल हड़बड़ाहट नहीं, पढ़ के पेपर करना है। ओके फाइन एवरीबडी, आर यू क्लियर अबाउट दिस वन? ओके नाउ लेट्स गो फर्दर बेटा। सबग्लॉटिस, आई टोल्ड यू सबग्लॉटिस बहुत सिंपल है। इफ कंप्लीट रिंग लाइक कार्टिलेज cricoid, complete ring like cartilage cricoid. अगर cricoid ring है, the empty space in the ring is called subglottis beta. Now glottis is the main thing beta. True vocal cord. What is the length of male vocal cord? 18 to 23 millimeter. Female 16 to 17 millimeter beta. Males have got longer vocal cord. Female have got shorter vocal cord beta. Okay, fine. Now look at the picture in your note beta. There are two muscles here, TA and IA beta. Pyroretinoid and interretinoid beta. Okay, fine. Can you see two muscle? Can you see anterior commissure is covered by epiglottis beta? You cannot see anterior commissure easily. Why? Anterior commissure is covered by what beta? Epiglottis, which is unpaired muscle. Look at right in the chat box beta, everybody. Which is unpaired muscle in the larynx beta. Interretinoid is unpaired muscle. It's in the midline beta. Can you see the midline muscle beta? What is the unpaired muscle or midline muscle? It is the interarytenoid muscle. Now please read your note beta. TA and IA are adductor muscles. If they are weak, the disease is called phonesthenia. Phonesthenia like myasthenia. Nobody should leave myasthenia gravis in medicine beta. आपने नहीं पढ़ा न्यूरोलॉजी, मैं फिर बोलता हूं, मेरा बोलना बनता नहीं है, लेकिन मेडिसिन में अगर कुछ टॉपिक रह गया, आपका सीएनएस रह गया, डोंट लीव Guillain-Barré syndrome, don't leave myasthenia gravis, don't leave Parkinsonism, don't leave Alzheimer's disease, don't leave epilepsy, stroke, multiple sclerosis बेटा। ये क्यों छोड़ के जाना जब पता है इसमें क्वेश्चन आ रहे हैं? डोंट लीव myasthenia gravis। लास्ट टाइम 3 क्वेश्चन बेटा, यू नेवर नो, इस बार 1 या 2 आ जाए, क्यों छोड़ने ना। इसलिए लास्ट के आपने आज कमिटमेंट किया अपने आप से, विद मी ऑल्सो, दैट यू विल बी 200% डेडिकेटेड। मैं हमेशा बोलता हूँ, रोज सुबह उठ के बोलना अपने आप को, मैं हमेशा यही बोलता हूँ, रोज सुबह भी और रात को सोने से पहले भी, होना नहीं होना तेरे हाथ में, मैं अपनी पूरी कोशिश करूंगा। होना नहीं होना तेरे हाथ में है, चलो ठीक, ऊपर वाले के हाथ में है, लेकिन मैं ईमानदारी से पूरी कोशिश करूंगा अपनी, जो मैं कर सकता हूँ। तुम्हें भी वही करना है बेटा, है ना। तो खेल को आखिर में लोग संभालते हैं, हम भी संभालेंगे। फोनेस्थीनिया, फोनेस्थीनिया बेटा, ओके, फोनेस्थीनिया। एंड दिस शोज व्हिच ग्लॉट बेटा? की होल ग्लॉटिस। क्या बोलते बेटा? की होल ग्लॉटिस। की होल ग्लॉटिस बेटा, की होल ग्लॉटिस, वेरी गुड बेटा। वोकल कॉर्ड डू नॉट हैव लिम्फेटिक्स, ये याद रखना बेटा। वोकल कॉर्ड में क्या नहीं होता? लिम्फेटिक्स नहीं होते। दैट्स व्हाई वोकल कॉर्ड ग्लॉटिक कैंसर हैव गॉट वंडरफुल प्रोग्नोसिस बेटा, बिकॉज वोकल कॉर्ड कैंसर्स डू नॉट स्प्रेड बेटा। पूरा अटेंशन मेरी तरफ बेटा, कुछ भी और नहीं सोचना, एक ही चीज दिमाग में जाने दो, ताकि कल के पेपर में लेट अस ट्राई टू स्कोर एज मेनी मार्क्स एज पॉसिबल बेटा। नंबर 1 वोकल कॉर्ड डिसऑर्डर, स्टार क्वेश्चन लास्ट टाइम, रिंग के एडीमा, नॉट रिंकू भाभी बेटा, नो रिंकू भाभी थिंग बिफोर 30 जुलाई इज ओवर बेटा। आज शाम को 5 बजे के बाद जो मर्जी करो यार, 30 जुलाई को, 30 जुलाई। रिंग के एडीमा, आई होप रिमेंबर, रिंग के स्पेस इज सब एपिथेलियल loose connective tissue in the vocal cord. Subepithelial loose connective tissue in the vocal cord. Subepithelial loose connective tissue in the vocal cord. Okay, fine. Now, edema of the space is called ring edema. Ring edema. Is it unilateral, bilateral, beta? Is unilateral, bilateral? Unilateral, bilateral. It is bilateral diffuse swelling of vocal cord. What is the most common cause? Smoking beta, है ना? Again, what is the chief complaint? Dysphonia, hoarse voice beta. Dysphonia, hoarse voice beta. Okay, hoarse voice. Everybody, dysphonia. Now, dysphonia. Smoker with hoarse voice, dysphonia beta. Okay, now. Treatment is, second cause is vocal abuse. Treatment is, everybody, what is the name of surgery? Stripping of vocal cord mucosa. Treatment is the name of surgery, stripping of vocal cord mucosa. Okay, treatment is surgery. What is the surgery called? Stripping. इसका मतलब stripping word. As for smoking, as for stripping, this topic is coming in two problems. एक तो रिंके एडिमा, एक केराटोसिल लैरिंग. Smoking, stripping, these two things are coming in two disorder of the larynx, रिंके एडिमा and पहले आया था केराटोसिल लैरिंग्स में. Now vocal nodule पिछली बार भी आया हुआ. Vocal nodule last time भी आया था, रिंके एडिमा last time भी आया था. Vocal nodules are also called teacher's nodule. Teacher with hoarse voice is vocal nodule. Screamer nodule or singer's nodule. Singer's nodule. Singer's nodule. Are they unilateral, bilateral, beta? They are unilateral, bilateral, beta. They are bilateral, and they are seen at the junction of anterior 1/3 with posterior 2/3, beta. They are seen at the junction of anterior 1/3 with the posterior 2/3 of vocal cord, beta. Again, chief complaint is hoarse voice. मतलब hoarse voice जगह जगह आएगा बेटा. Okay, fine. Okay, fine. Okay. Now, treatment is, don't forget बेटा, other causes laryngopharyngeal reflux. LPR. What is LPR full form? Laryngopharyngeal reflux बेटा. First cause is vocal abuse. ज्यादा बोलना मेरी तरह. Number two, LPR, like GR, LPR, what is LPR? Laryngopharyngeal reflux बेटा. Treatment is the star question बेटा. Don't mark surgery बेटा. The best answer is speech therapy. Look at note, speech therapy or voice rest. Plus what beta? PPI. What is PPI beta? Proton pump inhibitor. What is PPI beta? Proton pump inhibitor beta. Okay. That's this topic. किसी ने vocal nodule नहीं बोलना? Ringedema important beta. Okay, fine. Vocal poly पे question नहीं आता beta. What is the focal length of ENT microscope? ENT 234 beta. Ear surgery 200, nose 300, larynx 400. ENT 234 beta. Okay beta, fine. Ear is MCQ beta. मान लो 250 लिखा हो तो भी ईयर की बात की जाएगी बेटा, है ना. थोड़ा बहुत पेपर में चेंजेस होंगे. कल के पेपर में भी ईएनटी में भी थोड़े बहुत लैंग्वेज चेंज, थोड़े चॉइसेस का नया नाम. लेट अस प्ले अराउंड विद द क्वेश्चन बेटा. कल का हमारा लक्ष्य है, एम ऑफ टुमारो एग्जाम इज लेस सिली मिस्टेक, वेरी लेस सिली मिस्टेक. मतलब जीरो पे लेके आने की कोशिश करेंगे. एक दो फिर भी होंगी, चलो कोई बात नहीं, लेकिन नो ऐसा नहीं ओ मैंने एक्सेप्ट नहीं पढ़ा, अरे मैंने मिडलाइजेशन को लेटलाइजेशन पढ़ लिया, अरे मैंने लास्ट तक नहीं पढ़ा, उसने तो कुछ और पूछा था मैंने कुछ और सोच लिया. यू नो दोस थिंग्स टू बी अवॉइडेड. कल हम प्रैक्टिस करेंगे कि हम ओवरऑल मार्क्स कैसे इंप्रूव करेंगे अपने बेटा. ओके बेटा, फाइन. चलो, वेरी गुड बेटा. नाउ इंट्यूबेशन एडेनोमा, एनी सर्जरी डन अंडर जनरल एनेस्थीसिया और पेशेंट फ्रॉम आईसीयू बेटा. दो लोग इंट्यूबेट होते हैं बेटा, जनरल एनेस्थीसिया सर्जरी और आईसीयू पेशेंट आर वेंटिलेटेड थ्रू एंडोट्रेकियल ट्यूब बेटा. They develop intubation adenoma. This is also bilateral. The difference is it is at the junction of anterior 2/3, posterior 1/3. Let's revise beta. Vocal nodule is also bilateral. That is junction of anterior 1/3, posterior 2/3. Intubation adenoma, which is at the junction of anterior 2/3 and posterior 1/3. The story will be patient underwent surgery under general anesthesia or patient is from ICU background. Now, juvenile papilloma is not asked much in your topic. It's like a little this topic. Okay, fine. Juvenile papilloma. Okay, fine. Now, only remember, this is caused by which virus? Human papilloma virus 6 and 11. HPV 6 and 11. HPV 6 and 11. Okay, chalo. This is caused by HPV 6 and 11, है ना? 6 and 11. Yes, HPV is a very important virus for microbiology also. Now, Dr. Daman, मेरा micro weak है. Please don't leave virology बेटा. पूरा सब्जेक्ट छोड़ के जाना गलत बात है. मैंने लास्ट टाइम भी इंस्टा पे एक वीडियो किया था इसीलिए बोलने के लिए. Please develop a medium path for it बेटा. Okay, मेरी पूरी microbiology weak है. Not a good idea. At least do virology, do the MCQs, PYQs of the mycology और पैरासिटोलॉजी. पूरा छोड़ के जाना डिजास्टर्स होता है. नहीं करेंगे, 6 हफ्ते हैं, उससे ज्यादा ही 2 दिन एक्स्ट्रा हैं. एंड लेट मी टेल यू, अपना 200% कोशिश करो. ऊपर वाले ने चाहा हम इस पूरी चीज से निकल जाएंगे बाहर और हमारा लाइसेंस के लिए इंटर्नशिप स्टार्ट हो जाएगा बेटा. दैट इज द विश, नॉट जस्ट फॉर your sake, but your families are attached to you. Your parents are having hope. I know pressure भी होता है हमारे ऊपर बेटा. ऐसा नहीं कि pressure नहीं है हमारे ऊपर. Last time नहीं हुआ, last time नहीं हुआ. That's enormous pressure बेटा. उसको भूल के ना बेटा, एक ईमानदारी से पूरी कोशिश लास्ट के पार्ट में हमें डेफिनेटली हेल्प करने वाली है. और ये होता है बेटा, ऐसा नहीं ना, क्योंकि मतलब कुछ चीजें ऐसी होती हैं कि जो हम लोग देखते हैं 24 एग्जाम 25 एग्जाम पता लगता है कि यार ऐसा नहीं कि जो लोग पास होते हैं ऊपर से उतरते हैं. जो लोग पास होते हैं लास्ट में अच्छा पढ़ाई करते हैं. ये बात पक्की है बेटा. यू हैव टू चॉइसेस. थोड़ा रिलैक्स हो जाओ, पढ़ने का मन नहीं कर रहा, या फिर स्ट्रिक्ट हो जाओ कि पढ़ना है बैठ. यू हैव द चॉइस. विच चॉइस यू वांट टू टेक बाय द वे. यू वांट टू you want to take choice number 1. थोड़ा बहुत रिलैक्स होके पढ़ेंगे, मन नहीं कर रहा पढ़ने का, या स्ट्रिक्ट होंगे. स्ट्रिक्ट मतलब फोर्स करेंगे कि नहीं पढ़ना है भाई बैठ. ऑप्शन बी और ऑप्शन ए बेटा. थिंक अबाउट इट. ओके फाइन एवरीबॉडी. CO2 laser is the most commonly used laser in laryngeal surgery beta. Next page. Everybody, its wavelength is 10,600 nanometer beta. 10,600 nanometer beta. 10,600 nanometer beta. Okay. We cannot cover all the topic in 6 hours, you understand, but this is a high yield revision. How will we revise the topic which actually are important? अगर मैं FMG होता तो कैसे पढ़ता है ना क्या? Position बेटा, this is always asked बेटा. Don't forget position. बच्चों में C2 C3, adult में C3 C6 बेटा. C2 C3 C3 C6 बेटा. Everybody fine. Now everybody remember this question of your paper बेटा. This vertebra question बेटा. C1 C2 C3 पे. C3 पे था upper border of thyroid cartilage, and the cricoid cartilage lower border is C6 beta. C6 beta. Okay, fine. So this was the question: which anatomical level is seen at this vertebra beta? The vertebra is C1, C2, C3. At the C3 is upper border of thyroid cartilage, and the adult larynx is C3 to C6 beta. So cricoid finishes at C6 beta. C6 beta. Everybody. So if you remember in the class also, in the notes also, we make this diagram like that. You see over here, we said this is C3 and this is C6. C3 to C6 beta. C3 to C6 beta. Okay, very good. C3 to C6. Now, next one beta. Narrowest part, subglottis beta. ये नहीं भूलना बेटा, narrow part subglottis. Narrow part subglottis beta. IL beta, indirect laryngoscopy. जो मुंह में मिरर डालते हैं वार्म करके. दिस इज MCQ. IL does not show anterior commissure of vocal cord. This is important. Look at me. Anterior commissure मतलब it is covered by epiglottis. Look at my hand. Mirror on the roof beta. Remember epiglottis. Can you see the lower undersurface? No. Number 2, laryngeal surface or undersurface of the epiglottis. Ventricle saccular hidden areas, and undersurface of vocal cord is also hidden area beta. Undersurface of vocal cord is also hidden area. Okay, beta, fine. Now, stridor is noisy breathing, beta. Whenever there is airway obstruction, there is stridor. There is respiratory distress, stridor are two linked word, beta. अलग-अलग नहीं है. Nausea, vomiting, linked word है ना. Nausea, vomiting. ऐसे ही respiratory distress जब ENT में आता है, pediatric में आता है, तो stridor साथ में लिखा होता है. ज़्यादा भाव नहीं देना उसको. Yes, but MCQ is inspiratory stridor is due to blockage of pharynx and supraglottis. Pharynx and supraglottis. Everybody, supraglottic problem cause which stridor? Inspiratory stridor. Everybody, supraglottic problem cause which stridor? Inspiratory stridor. Now, below beta, glottis, subglottis, cervical trachea, biphasic, thoracic trachea, bronchi, expiratory. Okay. What is the primary function of larynx? Is protection of lungs or lower airway. I told you vocal cord is automatic gate. Vocal cord decide what will go in the lungs, what will not go in the lungs. Okay, so protection of the lower airway or lungs. And number 2 is phonation. जब भी phonation आए, dysphonia. जब भी PHON word आए बेटा, phone, PHON is what beta? Phone मतलब आवाज की problem बेटा. Dysphonia. Okay, fine. Dysphonia. Okay, fine. Now, whenever you see the word acousis, it is about hearing. Paracusis, diplecusis, presbycusis, hearing problem. Whenever you word about phone, is about the sound problem, dysphonia. Okay, fine. Whenever you word to see opia, it's about vision, myopia, hypermetropia, presbyopia. Opia मतलब vision problem, cusis मतलब hearing problem, phone मतलब आवाज problem. है ना? Fine. Okay, fine. Chalo. Now, I hope you remember that we produce sound from true vocal cord in adducted position in expiration. Remember, हम खुले कॉर्ड से सांस लेते हैं, बंद कॉर्ड से बोलते हैं. Everybody, look at your notes, बेटा. There is a word called written golden rule, बेटा. Can you see the word golden rule? Golden rule is what? Golden rule is what? We speak with the closed vocal cord. We breathe with open vocal cord. Once again, we speak with closed vocal cord. We breathe with open vocal cord. Everybody start golden rule. जैसे क्लास खत्म होगा बेटा, कल पेपर है, कल टेस्ट है, लेट अस रिवाइज द ईएनटी फर्दर बेटा. ऐसा नहीं है कि ये 6 घंटे में हमने जो ईएनटी इसमें हम रन थ्रू कर रहे हैं, ये हाई यील्ड पॉइंट ऑफ ईएनटी कर रहे हैं. उसके बाद फिर से एक बार नोट्स लेके बैठना है, फिर से रिवीजन करना है, पीवाईक्यू देखना है, फिर टेस्ट देना है, तो ईएनटी अपना रिवीजन खत्म हो जाएगा. नाउ मसल ऑफ लैरिंग, हमेशा क्वेश्चन आता है. ओनली एबडक्टर इज, बोलो बेटा एवरीबॉडी, दिस स्टार क्वेश्चन. ओनली एबडक्टर इज posterior cricoarytenoid is the only abductor of the vocal cord. Posterior cricoarytenoid is the only abductor of the vocal cord. Okay, beta, fine. There are 4 adductor beta: TA, arytenoid; IA, interretinoid; lateral cricoarytenoid is the adductor muscle beta, and cricothyroid is also adductor. Now tensor, MCQ. Cricothyroid is the main tensor beta. And number 2, vocalis muscle. And important thing is, tensor give us quality of the voice. Tensor give us quality of the voice. Okay, fine. Tensor give us quality of the voice. Okay. Now, this table is star table. मैं फिर कह रहा हूं, ऐसा नहीं क्लास खत्म 3 बजे तो सरना, उसके बाद फिर से सारी चीजें रिपीट करनी है बेटा. एक बार हम इकट्ठे रिवाइज कर रहे हैं, फिर दोबारा रिवीजन करना है. One more revision after class over. आपकी you will do it. Okay. Now, don't forget the posterior cricoarytenoid is the only abductor. Let's not forget, beta, cricothyroid is doing 2 functions, beta. Cricothyroid is the adductor and main tensor also. And tensor give you quality of voice, beta. Now, everybody, all muscle lie inside larynx except cricothyroid. है ना? याद है cricothyroid outside बड़ी होती है, बाहर होती है cricothyroid. Cricothyroid. All muscle lines except cricothyroid. Okay. Now, motor supply of the larynx. Motor supply. Let's speak with me, everybody. All muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, जो कि बाहर है, which is outside. Cricothyroid is supplied by external branch of superior laryngeal nerve. Okay. Also called ELN. What is ELN? External laryngeal nerve. Okay. Now, once again, all muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external branch of superior laryngeal nerve, also called external laryngeal nerve. External laryngeal nerve. Okay, fine. Now, sensory supply. Now, this is star question. Don't forget the supraglottis is by internal branch of SLN. Beta. What is SLN? Superior laryngeal nerve. It's also called internal laryngeal nerve. ILN, internal laryngeal nerve. Internal laryngeal nerve. Internal laryngeal nerve. Okay, beta, fine. Now, everybody, this nerve prevents what, beta? Aspiration. Ago मैंने पहले बोला, this is a NEETPG question. This nerve prevents aspiration. This nerve is important, beta, everybody. Subglottis by recurrent laryngeal nerve, glottis by both these nerves. That this sensory supply, motor supply is important topic. Am I clear, beta? Fine. Are you getting, beta? Everybody? Are you getting? Everybody, are you aligned with me? Are you aligned with me in the revision, beta? Are you understanding? It's a high yield revision, fast paced revision together. No class here, beta. Rajiv Dhawan is also appearing in FMG paper. How he would see the notes one time quickly so that high yield points are covered, beta. Vagus is the mother now, beta. Vagus is the mother now. 2 branches, RLN, SLN. SLN gives 2 branches, beta. ILN, ELN, beta. What is ILN, beta? Internal laryngeal nerve. What is ELN? External laryngeal nerve. I told you, if vagus is cut, larynx is dead, beta. Okay, now, vocal cord palsy. Vocal cord palsy, please look at it, beta. Left side vocal cord palsy is 4 times more common than the right side, beta. Okay, I hope you remember. This is because of the longer course of the left RLN. There's right turnaround, subclavian artery. Left RLN takes a turnaround, arch of aorta. Left RLN एक लंबी nerve है, more chance of damage, बेटा. Right RLN takes a turn around subclavian artery. Left RLN takes a turn around arch of aorta. Arch of aorta, beta. Don't forget this picture for surgery, ENT both, beta. At the upper pole of thyroid gland, we have got a superior laryngeal nerve. At the lower pole is recurrent laryngeal nerve, beta. Okay, beta, fine. Now, MCQ, beta. Most common cause of unilateral cord palsy और vocal palsy is idiopathic, beta. अगर idiopathic choice में नहीं है तो carcinoma bronchus, beta. Carcinoma bronchus. Bronchogenic carcinoma is important cause, beta. लेकिन bilateral cord palsy is with, beta, thyroid surgery, beta. I think thyroid is very easy to understand. Both RLN got cut. Okay. Now, Ortner syndrome or cardiovocal syndrome. I told you left RLN takes a turnaround arch of aorta. If left atriomegaly presses the left recurrent laryngeal nerve, that syndrome is called Ortner syndrome. Syndrome is called Ortner syndrome. ORTNER, Ortner syndrome. Okay. Once again, बोलो बेटा, मुंह से बोल रहे हो, पहले सब लोग ग्रुप में वेट करो, मैं सब लोग एक जगह पे आ जाओ बेटा, कुछ लोग पीछे चल रहे हैं. Go fast and go to the end of the जहां हम स्टार्ट कर रहे हैं बेटा, ताकि व्हाट्सएप चैट रेलेवेंट रहती है ना. एवरीबडी रीच, मैं वेट करता हूँ 1 मिनट के लिए वहां पे. एवरीबडी कम टू दिस पॉइंट नाउ. यहाँ से शुरू करते हैं, सब लोग यहाँ पहुंच जाओ, तो यहाँ पहुंचे शुरू करते हैं. मैं वेट कर रहा हूँ, सब लोग यहाँ पे जब यहाँ पहुंच जाएंगे फिर स्टार्ट कर देंगे. यहाँ पे एक टाइम लैग नहीं रहेगा ना व्हाट्सएप चैट में और इसमें. सब लोग यहाँ आ जाओ, एवरीबडी कम फास्ट. तो यहाँ पे आ जाओ, यहाँ पे पहुंच जाओ. वेट करो, यहाँ पे वेट करो. ओके फाइन. थैंक यू बच्चे, थैंक यू नितेश फॉर दिस पिक्चर. या ब्यूटीफुल पिक्चर. यस, चलो. नाउ गाइस, एवरीबडी आर यू स्पीकिंग विद मी? मैं फिर कह रहा हूँ बेटा, इनर्ट होकर लाइफ नहीं जी जाती बेटा. लाइफ इज नॉट लाइक कॉन्स्टिपेशन बेटा. मैं हमेशा क्लास में बोलता हूँ, कॉन्स्टिपेशन नहीं है लिटिल बिट समटाइम इनर्ट वे में ना. लाइफ इज लाइक डायरिया बेटा, फुल फ्लो. एक ही बार लाइफ में पास कर रहे हैं, फुल फ्लो. और अभी तो पीक पे फ्लो बेटा, अभी तो पीक परफॉर्मेंस का टाइम है बेटा. जोश से, होश में भी और जोश में भी बेटा. होश में भी यस, यानी गलतियां करनी है. जोश में भी मतलब थोड़ा इंथुजियास्टिकली पढ़ना चाहिए, है ना. उससे ऊपर वाला देखता है कि भाई ये बड़ा खुश प्राणी है, इसको और खुशी दो. निराश प्राणी को और निराशा मिलती है. ये पता नहीं लॉ है बेटा. तो मुझे ज्यादा किताबें नहीं पढ़ी, लेकिन जो मुझे अपने एक्सपीरियंस समझ आया, अगर आप निराश हो, दुखी हो, सैड हो, नेगेटिव सोच रहे हो, नेगेटिव आउटकम की रोज थॉट दिमाग में जीते चले जा रहे हो रोज 24 घंटे, कुदरत सोचती है इसने पहले प्रिपेयर किया अपने आप को, छोड़ो ना इसको भाई. जो लोग उत्साहित होकर जीते हैं, इंथुजियास्टिकली रिवाइज करते हैं, इंथुजियास्टिकली पढ़ते हैं, लाइफ को इंथुजियाज्म से जीते हैं, नेचर गिव्स मोर हैप्पीनेस टू देम, है ना. तो थोड़ी बहुत चीजें सीख लो भाई, है ना. मैंने ऐसा नहीं कि मैं ऐसे पैदा हुआ था. आई लर्नड ऑल दीज थिंग्स विद माय ओन मिस्टेक्स व्हिच आई डिड फॉर इयर्स. देन आई रियलाइज नहीं भाई, सोचना है तो एटलीस्ट न्यूट्रल तो रह जाओ. अच्छा, पॉजिटिव नहीं भी सोचना है ना. बट फाइन. नाउ नेक्स्ट वन, ऑर्टनर सिंड्रोम और कार्डियो वो. अच्छा, लाइब्रेरी में बैठ के पढ़ रहे हो भाई. नहीं, लाइब्रेरी में डिस्टर्ब मत करो. अगर अपने कमरे में हो तो बोल के पढ़. फाइन, वेरी गुड. ऑर्टनर सिंड्रोम. चलो अब सब लोग यहाँ आ जाओ, एवरीबॉडी. हाँ, ये है ना, जाट भास्कर ने सही लिखा. देखने तो तुझे क्या लगे. नहीं भाई, उनका भी सोच लो. We will be connected now continuously in the remaining time, either on Instagram live or maybe कुछ ना कुछ करते रहेंगे तब पेपर तक, है ना. Now, Ortner syndrome is cardiovocal syndrome, left atriomegaly causing left vocal cord palsy. Okay, unilateral vocal palsy बेटा. मैं पे क्वेश्चन बताया था, if single side cord palsy question come, treatment is conservative बेटा. Conservative मतलब wait and watch. Okay, wait and watch लिखा हुआ ऑप्शन में, आपके नोट्स में देखो लिखा हुआ है. If diphtheria patient develops unilateral vocal cord palsy, what is your plan of management? Treatment is wait and watch. Single side cord palsy में कुछ नहीं करना होता बेटा. कल सिली मिस्टेक नहीं बेटा. कल सिली diphtheria can also cause unilateral cord palsy. Diphtheria can also cause unilateral cord palsy बेटा. Wait and watch. Okay, now bilateral cord palsy बेटा. 2 types. दोबारा बेटा ध्यान से. बायलैटरल एबडक्टर पाल्सी. लुक एट योर नोट बेटा. एबडक्टर मतलब एबडक्शन एब्सेंट, मतलब वोकल कॉर्ड क्लोज्ड बेटा. पहले तो उल्टा पुल्टा नहीं करना. वोकल कॉर्ड क्लोज्ड मतलब एबडक्टर पाल्सी. बायलैटरल RLN इंजरी थॉराइड. ध्यान दो बेटा. इफ बोथ RLN आर डैमेज्ड बाय सर्जन, you and me, which muscle is left? Only cricothyroid left, and that is adductor. Both vocal cord come in which position? Median or paramedian position, matlab closed position. Now this is a airway emergency. Remember, अगर दोनों R L N कट जाएं तो वोकल कॉर्ड बंद हो जाएंगे. ये एयरवे इमरजेंसी है बेटा, एयरवे इमरजेंसी बेटा. ओके फाइन, एयरवे इमरजेंसी बेटा. नाउ next one is the symptom, the respiratory difficulty, stridor. Stridor, I told you, is दोनों वर्ड मिले हुए यहाँ पर, nausea, vomiting की तरह, with normal voice बेटा, है ना. We speak with closed vocal cord. They're permanently closed vocal cord. If both R, L, N are damaged, you will have only one muscle working, cricothyroid, and that is adductor muscle, which brings both vocal cord in the midline. And with the closed vocal cord, there's a breathing problem. It's airway emergency, but voice is normal. Now, guys, biggest mistake people do is sometimes they ask immediate treatment, sometimes they ask a definitive treatment. Please don't make mistake बेटा. पूरा क्वेश्चन पढ़ के आंसर करना, वरना उल्टा पुल्टा नीट पीजी में आता है और लोग उल्टा पुल्ट करके आ जाते हैं. इमीडिएट ट्रीटमेंट इज ट्रेकियोस्टमी, जान बचाओ पहले. प्लीज रीड एनी क्वेश्चन ऑफ सर्जरी, ऑर्थोपेडिक और ENT, pediatric. If airway problem is there, first of all, airway to be given to the patient, then only think of antibiotic and something else better. Don't think of the main problem. First of all, you think about the saving the patient. Okay, but fine, saving the patient. Now, next one. Immediate treatment is tracheostomy. Definitive treatment after 6 months is which thyroplasty? Beta? Type 2 thyroplasty. Type 2 thyroplasty is which? Beta? Lateralization of vocal cord. Vocal cord को खींच के बाहर लेके आना. Type 2 thyroplasty is lateralization of vocal cord. But I would not do mistake. Immediate treatment versus definite treatment बेटा, फर्क है. Okay, other treatment is CO2 laser cordectomy. Now, reverse बेटा, bilateral adductor palsy बेटा. Adductor मतलब the vocal cord are open बेटा. Adduction absent, vocal cord open. उसका उल्टा है बिल्कुल. Basically, it's vagus palsy. I told you, vagus is cut, larynx is dead. Vocal cord come in which position beta? Cadaveric position. Cadaveric death matlab open position. Now the breathing is not a problem, but problem is loss of voice. आवाज आएगी नहीं बेटा, हम बंद कॉर्ड से बोलते हैं, है ना. आवाज ऐसे आएगी like this. There's no voice beta, only air is there. Aphonia, and problem is aspiration beta. Pneumonia. So aphonia and aspiration pneumonia. In this treatment is the surgery called Type 1 thyroplasty. Everybody revise thyroplasties with, when you revise yourself, revise all thyroplasty. Type 1 thyroplasty. Okay. Okay. Okay, which is fine. Okay, fine. Type 1 thyroplasty is medialization of vocal cord. They'll all, Shrenik, they will always ask immediate treatment or definitive treatment. Okay. If they tell you patient is dying, breathing is a problem, then please see tracheostomy immediate. Always read. आज commitment करना बेटा. Read all 4 choices बेटा. अपने पेपर पे लिखो बेटा. मैं 4 चॉइस पढ़े बिना आंसर नहीं लगाऊंगा. लिखो साइड पे, हिंदी में लिखो, तेलुगु में, तमिल में, कन्नड़ा में, whichever language, or maybe Malayalam, whichever language you are. Please make sure that you should always read all the 4 choices. Always do 4 choices. Now, other treatment is Teflon or fat injection in the vocal cord. Teflon or fat injection in the vocal cord. Now, if SLN is injured in thyroid surgery, beta, which muscle is paralyzed? Cricothyroid muscle is paralyzed. Which muscle is paralyzed? Cricothyroid muscle is paralyzed. Cricothyroid muscle is paralyzed. Cricothyroid muscle is paralyzed. Okay. It is the main tensor of the vocal cord, and tensor gives us quality of the voice. So chief complaint is poor quality of voice. अब यहाँ पे लोग गलती करते हैं. People RLN को SLN पढ़ लेंगे. If SLN is damaged, think about carefully. Only which muscle gone, beta? Cricothyroid, and that's the main tensor. Tensor major problem. You and me may not have much problem, beta. You and me may not have much problem, okay? But singer would have a major problem, beta. Singers. Why? Singers need a lot of quality of voice, beta. So think the question carefully, beta. And think beyond notes also. So examination shows bowed down vocal cord. Bowed down vocal cord. कल के एग्जाम में I'll practice how to decrease silly mistake. मैं RLN को SLN नहीं पढ़ूंगा, मैं सोच के आंसर लगाऊंगा, मैं चारों आंसर पढ़ के आंसर लगाऊंगा, मैं पूरा स्टेटमेंट पढ़ के ही आंसर लगाऊंगा, मैं इज्यूम नहीं करूंगा, आई विल नॉट इज्यूम अच्छा ये तो वो क्वेश्चन आ गया, अरे क्या मजा आ गया, मजा तो आ गया, नंबर नहीं आए, है ना। कल ये गलतियां नहीं करनी, कल ये वाली गलतियां नहीं करनी, वी विल नॉट डू दिस मिस्टेक बेटा। ओके बेटा, फाइन एवरीबॉडी, चलो नाउ laryngomalacia. Laryngomalacia is the most common congenital anomaly of larynx. One second. One second, देख रहा हूँ। Yeah, laryngomalacia. One second, बेटा। वो थोड़ी देर लैग हुआ बीच में, अब ठीक। ओके फाइन, चलो दोबारा देखते हैं। चलो बेटा, एवरीबॉडी कम टू laryngomalacia। लैग में फायदा होता है, सब लोग एक जगह पे आ जाएंगे बेटा। laryngomalacia, इट इज द मोस्ट, पहले तो बात स्टार टॉपिक है। laryngomalacia is important topic. Malacia mean weakness. It is the most common congenital anomaly of larynx. It is also called congenital laryngeal stridor. जन्म से ही स्ट्राइडर है। The most common cause is laryngomalacia. It is the most common cause of neonatal stridor. न्यूनेटल स्ट्राइडर, कभी क्वेश्चन है पैदा होते ही बच्चे को स्ट्राइडर शुरू हो जाए, व्हाट इज द मोस्ट कॉमन कॉज? लैरिंगोमलेशिया। इन इंग्लिश, मोस्ट कॉमन कॉज ऑफ स्ट्राइडर एट बर्थ इज लैरिंगोमलेशिया। इट इज वीकनेस ऑफ सुप्राग्लॉटिस। रीड योर नोट बेटा, सुप्राग्लॉटिस बेटा। एंड चीफ मेड इज स्ट्राइडर। एनीबडी सुप्राग्लॉटिक प्रॉब्लम का व्हाट टाइप ऑफ स्ट्राइडर? इंस्पिरेटरी स्ट्राइडर। 4 पॉइंट स्ट्राइडर के बेटा, रिवाइज करो स्ट्राइडर के 4 पॉइंट। स्ट्राइडर, इंस्पिरेटरी, सुप्राग्लॉटिक प्रॉब्लम का इंस्पिरेटरी स्ट्राइडर। स्ट्राइडर स्टार्ट इन फर्स्ट वीक ऑफ लाइफ। स्ट्राइडर इज इंक्रीजिंग ऑन क्राइंग, बट स्ट्राइडर इज inspiratory. It appears in first week of life. It increases on crying. It decreases in the prone position. But the cry sound is normal, is the MCQ बेटा। बच्चे की रोने की आवाज बिल्कुल ठीक है बेटा। Cry sound is normal because vocal cords are normal. Cry sound is normal because vocal cords are normal बेटा। Okay, fine, fine. Now, examination बेटा। Examination shows which type of omega shaped epiglottis. Omega shaped epiglottis. And remember, there's no cyanosis, no hypoxia. बच्चा मरने वाला नहीं है. Only stridor is there, beta. So treatment is conservative, beta. Treatment is conservative. Please dial again, conservative, beta. Unilateral cord palsy, treatment is conservative. Laryngomalacia, treatment is conservative, beta. Treatment is conservative. Treatment is conservative. Okay, fine. Treatment is conservative. Okay, fine. Reassure mother, it is self-limiting condition. Reassure mother, it is self-limiting condition. Okay, so laryngomalacia, please revise properly, beta. It's an important topic. Congenital laryngeal web, beta. Congenital laryngeal web. Most common site of laryngeal web. Most common site of laryngeal web is the glottic web. Beta. Most common site is glottic web. Most common site is glottic web. Most common site is glottic web. Most common, मैं वेट करो बेटा, Most common site of laryngeal web is glottic web. Beta, yaad rakhna hai. Most common site is glottic web. So vocal cord webs are the commonest site of webs in the laryngeal web, and that's the only question which came but one time. Okay, fine, done. Okay, fine. Now, so most common site of laryngeal web is glottic web. Glottic web. Now come the important topic. Hamesha aata pediatric laryngeal infection. Please read the first word. They call edema of the larynx, therefore airway obstruction. Everybody, there are two topics and both are coming in NEETPG, FMG paper. Beta. Pediatric also, ENT also. Acute epiglottitis and acute laryngotracheobronchitis. Let's say beta, acute epiglottitis, matlab upper part infection. It is bacterial infection of supraglottis. First line beta. Most common bacteria is a very common, confusion in the books also nowadays. Nowadays, most common bacteria is Streptococcus pneumoniae. And the second common is Haemophilus influenzae B, beta. Second common is Haemophilus influenzae B. Okay, fine. Now, age is 2 to 7 years, beta. Now, first important thing is it's a very sick child. Patient is in the emergency, beta. It's a very sick child. There's a respiratory difficulty which is severe, beta. ये बच्चा मरने वाला है बेटा. This patient is dying. Severe respiratory difficulty. Severe respiratory difficulty. And what type of stridor? Inspiratory stridor, beta. High fever, drooling of saliva, hot potato voice or plummy voice. Child sits bending forward. This is called which sign, beta? Tripod sign. Tripod sign, beta. X-ray neck shows which sign, beta? Don't forget this X-ray, beta. What is the name of sign, beta? Thumb sign. What is the name of sign? Thumb sign. Guys, sometimes they write thumb sign, sometimes they write thumb print sign, beta. थोड़ा बहुत चलता है बेटा. Don't अपने दिमाग को जरा चेंज, मतलब थोड़ा बहुत वर्ड को इधर उधर कर देते हैं. Thumb sign, thumb print sign. It's okay. ज्यादा सोचना नहीं है बेटा. Europeans, Americans, they are different people. कुछ लिख देते हैं. Thumb sign, thumb print sign. थोड़ा बहुत. If the main theme of my question is matching my concept, I will stick to the answer. I will not change my answer because of one or two little different word written over there. Okay, fine. Treatment. First treatment is airway management. बोलना नहीं है बेटा. कभी भी बच्चा आए एपिग्लोटाइटिस का, सबसे पहले airway by intubation. Urgently intubate. But put the intubation tube and start the ventilator. Beta. Then comes steroid, then come antibiotic. Beta. Please read one line of pediatric question. Do not do repeated laryngoscopy. Avoid repeated laryngoscopy. Beta. Why? Because laryngoscopy will increase the edema. Laryngoscopy will increase the edema. Beta. Okay, fine. Now, second topic, beta. Acute laryngotracheobronchitis, also called croup, beta. Croup. C-R-O-U-P. This can come in pediatrics also. ALTB. Acute laryngotracheobronchitis or croup, beta. It is viral. Udar bacterial. This is viral, beta. Viral. Okay. Of the complete airway. But subglottis is most affected part. Which virus is the culprit, beta? Para-influenza virus. It is seen in 3 months to 3 years. Udar kya hai, 2 to 7 years. That is very sick baby. It's a less sick baby. There is a respiratory difficulty, mild. Udar kya hai, severe. Mild, udar severe. Stridor biphasic. Udar the inspiratory stridor. Either low fever, udar high fever. Barking cough. That's the main thing. There was no cough there. There is an acute laryngotracheobronchitis. Bronchitis will cause what? The bronchospasm will lead to barking cough. Beta. X-ray neck. This is a star question. Beta. Steeple sign. Steeple sign is narrowing of the airway. Narrowing of the subglottic area. Beta. Narrowest part of pediatric line subglottis, and narrowing of that is called steeple sign. Beta. Okay, steeple sign. And treatment is humidified oxygen. There is no need of intubation in the baby because there's not that much respiratory difficulty. You must give some bronchodilator steroid. And the last thing is antibiotics. Why? It's a viral infection. We give only antibiotic to prevent the secondary bacterial infection. To prevent the secondary bacterial infection. Secondary bacterial infection. Now, TB larynx, don't forget the word turban epiglottis. Guys, please see. Omega epiglottis is feature of laryngomalacia. Turban epiglottis is feature of turban TB. Okay, omega laryngomalacia and mouse nibbled appearance of vocal cord. Now, This is important question. Anybody who is eating something, getting choking and aphonia, avaz, choking and aphonia, this is laryngeal foreign body. The food part is laryngeal foreign body. And what is the name of the maneuver? Hemorrhage. Bolo beta mere saath. What is likho beta? Sab log choice mein likho beta. Everybody write down in the WhatsApp chat box beta. What is the name of maneuver beta? Hemorrhage maneuver. What is the name of maneuver? Hemorrhage maneuver beta. Okay, hemorrhage maneuver. Hemorrhage maneuver. And pressure given on the epigastrium in backward and upward direction beta. है ना? And that's very important visual question. Hemorrhage airway foreign body में करना है. Not in the esophagus foreign body beta. It's for the airway foreign body. Airway foreign. अगर सांस की दिक्कत हो रही है तब airway foreign body में hemorrhage maneuver करना है. Hemorrhage maneuver. Okay बेटा? Hemorrhage maneuver beta. Don't write esophagus foreign body. No role of hemorrhage maneuver beta. Okay? सांस में breathing difficulty, laryngeal foreign body. Then airway foreign body in larynx beta. तब करना है hemorrhage maneuver. Typical story beta. While eating, you get choking and aphonia. That's the question. Now, so guys, next is granulolia aperta and clausa. Aperta and clausa. Very good, beta. Thank you for the response. Wonderful, beta. That is absolutely great engagement, beta. Very nice. Beta. That's like, that's a type of life I live actually. Excitement, enthusiasm. ठीक है यार, मुश्किल समय है. I agree. This is a very tough time in your life. I understand that. मतलब मैं ये नहीं कहता. Maybe you are repeating the paper. It's a very tough time. बार-बार रोज अपने आप को gear up करना is tough. But do you think it's the last tough time of your life? Not at all. Not at all. Believe me. Right? Believe there are many more things. Please develop an attitude of a fighter. That's very important. Granulolia aperta and clausa. Any palate problem, I told you, palate problem will cause aperta. Hypernasality. P for palate. Cleft palate, submucous cleft palate, palatal palsy, perforation, weakness called velopharyngeal insufficiency. अगर nose closed है तो clausa. Simple बेटा. अगर नाक बंद है तो granulolia clausa. Palate problem है तो aperta. Nasal polyp, adenoid, angiofibroma, sinusitis. All of these cause what beta? They cause nasal blockage. है ना? Simple बात बेटा. अगर palate problem है तो aperta. अगर नाक बंद है, closed है तो clausa. Next, this is the MCQ. Functional aphonia or hysterical aphonia. Functional aphonia or hysterical aphonia. Okay. Now, patient is pretending the symptom of loss of voice. Functional मतलब नाटक करना, acting करना, English acting करना, pretending the symptom of loss of voice, sudden loss of voice, but actually voice is normal. A young female with sudden loss of voice, I know the answer, beta, functional aphonia or the hysterical aphonia, beta. एक young female में patient को आवाज चली गई, beta. That is actually functional aphonia, hysterical aphonia. How to prove diagnosis? Cough sound is normal. Cough sound is normal. Cough sound is normal. The patient can cough, can speak also. Treatment is psychotherapy or psychiatrist consultation. Okay? No role of speech therapy. Psychotherapy. No role of speech therapy. Gala theek hai, dimag kharab hai. It's a dimagi problem. Psychological problem hai ye. Functional aphonia, hysterical aphonia. It's a psychological problem. Young lady with loss of voice is functional aphonia. How to prove diagnosis? Cough sound is normal, beta. Cough sound is normal. Very good. Very good. Cancer larynx, beta. Smoking and alcohol also. Chalo, all of you commit to me. सब लोग बेटा जिन लोगों को पीने की आदत है हो जाती है, कोई बात नहीं. मैं दिल्ली में उस समय मतलब मैं अपने घर में हूँ, मतलब कभी माहौल बन जाता है. I can afford to do that, but can you afford to do that? No, नहीं करना है भाई. मैं ज्ञान नहीं दे रहा यहाँ पे, मैं प्रैक्टिकलिटी बता. अभी कुछ भी नहीं करना है. But honestly, चाय पीनी, कॉफी पीनी, सिगरेट पीनी, पी सकते. That's your wish. मतलब if you are smoker, fine. लेकिन अल्कोहल नहीं बेटा. अल्कोहल makes you dull. Next day hangover होता है ना? Hangover होता है. That's not a good thing बेटा, है ना? और क्यों करना ना भाई? क्यों करना? ये एग्जाम, ये 6 हफ्ते, मतलब सबसे इंपॉर्टेंट है ना यार. इसमें कौन सी मोटिवेशन चाहिए मुझे बताओ जरा. कौन सी मोटिवेशन चाहिए तुम्हें बताओ. विच मोटिवेशन यू नीड बेटा, आस्क, अपने आप से पूछो ना, अंदर से अपने अंदर झांक के देखो कि अगर कोई और मेरे से पूछता जो पेपर दे रहा होता, मैं यही उसको बोलता कि भाई अभी टिक के पढ़ ले, बाद में ये कुछ करना है लाइफ लॉन्ग, है ना? तो अपने आप को क्यों नहीं बोल लेते? व्हाई यू वांट समबडी एल्स टू टेल यू? मोटिवेशन इज द बिगेस्ट फ्रॉड ऑन द प्लैनेट एक्चुअली। मोटिवेशन डजंट वर्क बेटा, बिलीव मी, नहीं काम करता, मैं सच्ची बोल रहा हूँ बेटा। मोटिवेशन कुछ नहीं होती, जो अंदर से फूटे वही असली मोटिवेशन, जो तुम्हारे अंदर से फूटता है, वट एवर कम्स फ्रॉम यू विद इन, दैट्स द रियल मोटिवेशन, दैट्स द रियल मोटिवेशन. So guys, don't really, think that, somebody else should motivate you. Ask yourself, where am I right now? I'm at the most important part of my preparatory cycle, and I should be doing everything possible now to revise as much as I can. I will not compare my preparation with my friend preparation. That's all. उतना ही करना है बेटा. Within that, there is no other scope of doing anything else. और कुछ करने का मतलब दिमाग में आना भी नहीं चाहिए बेटा, क्योंकि ऊपर वाला देखता है. नेचर इज वॉचिंग यू ऑलवेज बेटा, रिमेंबर. और कोई देखे ना देखे, आपको अपना सत्य हमेशा पता होता है. आपने अगर 2-4 दिन वेस्ट किए, आपको लो फील होता है, आप जानते हो. और अगर हम 2-4 दिन अच्छा पढ़ेंगे, वी विल फील पेप्ड अप, पम्प्ड अप. और व्हाई नॉट स्टडी, है ना? दिस गोल्डन चांस एक्चुअली. एफएमजी एग्जाम अगला, कोई फिर क्वेश्चन मार्क लग जाएगा दिसंबर में, होना है नहीं होना पता नहीं. ये तो हो रहा है, नेगेटिव मार्किंग भी नहीं है. लेट अस मेक श्योर, होना नहीं होना तेरे हाथ में. मैं अपनी पूरी कोशिश ईमानदारी से करूंगा. बचे हुए टाइम में 44 डेज में, आई एग्री इन इंग्लिश, द रिजल्ट इज इन द हैंड्स ऑफ Almighty, agreed, but I will do my sincerest hard work in the last 6 weeks, 44 days. I would not do anything stupid, alcohol and all. और I'm from Punjab, so alcohol, हमारे ब्लड में प्लाज्मा कम, अल्कोहल शायद ज्यादा होता होगा, लेकिन अभी नहीं कर सकते, अभी नहीं कर सकते. वी कैन नॉट डू लाइक दिस. अभी सिर्फ पढ़ाई करेंगे, सिर्फ पढ़ाई करेंगे. शाम को 5 बजे 30 जुलाई के बाद तुम्हें जो करना हो, कोई बात, दैट्स ओके. दिल्ली आ जाना, मेरी तरफ आ जाना. यहाँ मोस्ट कॉमन इन मेल्स बेटा. दिस कैंसर हैज 3 टाइप बेटा. दिस कैंसर हैज 3 टाइप. ओके. ग्लॉटिक कैंसर, एमसीक्यू. इट इज द कैंसर ऑफ ट्रू वोकल कॉर्ड. इट इज कैंसर ऑफ ट्रू वोकल कॉर्ड बेटा. ओके. Most common site of laryngeal cancer. Chief complaint beta, hoarse voice. Again beta, hoarse voice, dysphonia. There are no neck node metastases in glottic cancer because vocal cord do not have lymphatics. Therefore, good prognosis. Okay, beta. Vocal cord cancer में सबसे क्वेश्चन आता है बेटा, vocal cord cancer. Okay बेटा, fine. चलो. ये ग्लॉटिक कैंसर की पिक्चर है बेटा. ग्लॉटिक कैंसर बेटा, वोकल कॉर्ड कैंसर इज द कॉमनेस्ट टाइप ऑफ कैंसर ऑफ लैरिंग्स. चीफ कंप्लेंट इज होर्स वॉइस. वंडरफुल प्रोग्नोसिस. व्हाई? वोकल कॉर्ड डू नॉट हैव लिम्फेटिक्स, सो देयर इज नो नेक नोड मेटास्टेसिस बेटा. सुप्राग्लॉटिक कैंसर, अपर पार्ट, एपिग्लॉटिस इज द मोस्ट कॉमन साइट. थ्रोट पेन रेफर टू ईयर. फीलिंग ऑफ लंप इन थ्रोट बेटा, फीलिंग ऑफ लंप इन थ्रोट. डिस्फेजिया. एंड अगेन व्हिच वॉइस बेटा? हॉट पोटैटो वॉइस. हॉट पोटैटो वॉइस बहुत जगह आता है. इट कम्स इन मल्टीपल प्लेसेस, बट क्लासिकली दिस वर्ड इज फॉर क्विंजी. कभी कंफ्यूजन हो जाए, द 2-3 थिंग्स इन योर माइंड. हॉट पोटैटो वॉइस कम्स इन 4-5 थिंग्स बेटा. बट if you have to choose one choice, if the other choice also confusing you, quinsy is the most appropriate answer if you get stuck sometime beta. Okay, fine. Subglottic cancer beta, ध्यान देना बेटा. vocal cord cancer, hoarse voice. supraglottic cancer, hot potato voice. उल्टा पुल्टा नहीं करना. कल के एग्जाम में we will do less silly mistake, as low as possible. कुछ भी assume नहीं करना. पढ़ के शांत मन से मुंह हाथ धो के रियल पेपर की तरह जूते पहन के टेबल कुर्सी पे बैठ के पेपर करेंगे. कल बेड पे लेट के पेपर नहीं करेंगे. कल nobody will lie on the bed and do the paper. Please sit down, table, chair in the exam format. Wear the shoes, wash your face. ऊपर वाले का नाम लेके 100 में से जितने भी क्वेश्चन कर सकते हैं करके let me know, because everybody has to post the result. कल कोई भी पेपर स्किप नहीं करेगा बेटा. प्लीज कमिट टू मी. कल पेपर स्किप नहीं करना. तुम्हारे कम भी नंबर आएंगे, मुझे कोई प्रॉब्लम नहीं है, लेकिन पेपर स्किप नहीं करने का. डोंट स्किप द ENT पेपर टुमारो बेटा. किसी ने नहीं करना स्किप. अपने यारों दोस्तों को बोलो पेपर देना ही देना है. और पेपर जूते पहन के, wear the shoes, sit on the table chair and then appear in the paper. Don't skip the paper. चलो, ट्यूमर स्टेजिंग बेटा, लास्ट टाइम क्वेश्चन बेटा. T1 वन स्ट्रक्चर इन्वॉल्व, याद है बेटा, वोकल कॉर्ड T1A T1B बेटा, T1 में मतलब वन वोकल कॉर्ड इन्वॉल्व, T1B मतलब बोथ वोकल कॉर्ड इन्वॉल्व, बट वोकल कॉर्ड शुड बी मोबाइल। लास्ट टाइम क्वेश्चन बोला T1B, लास्ट टाइम क्वेश्चन, if one vocal cord involved T1A, if both vocal cord involved T1B, okay, and vocal cord should be mobile. T2 मतलब more than one structure involved. T3 is important, vocal cord is fixed or immobile, okay, and T4 is invasion of thyroid cartilage, okay, fine। अगर thyroid cartilage invade हो गया तो T4, vocal cord fixed or immobile T3, T1 vocal cord T1A one cord involved, T1B both cord involved, but vocal cord should be mobile. Okay. Now, next one, beta. Now, treatment, beta. T1, T2 radiotherapy. T1, T2 radiotherapy. But in T1 glottic cancer nowadays, T1 में beta, T1 में, T1 glottic cancer nowadays, treatment is laser is better than radiotherapy. Vocal cord cancer में laser surgery has become #1 treatment for radiotherapy for T1 glottic beta, T1 glottic के लिए, okay। T3, T4 में surgery called total laryngectomy followed by radiotherapy beta। Guys, this is important। आजकल पूरे NEETPG में क्वेश्चन आ रहा है, after total laryngectomy patient has got permanent tracheostomy beta, permanent tracheostomy। After total laryngectomy patient has got permanent tracheostomy beta, permanent मतलब there will be a hole in the neck beta। कभी भी आपको ऐसे होल दिखे बेटा जिसमें ट्यूब नहीं डली हुई, इट कैन नॉट बी स्टैंडर्ड ट्रेकियोस्टमी। स्टैंडर्ड ट्रेकियोस्टमी इज ऑलवेज फॉर व्हाट बेटा, फॉर ऑलवेज फॉर व्हाट, विद द ट्यूब बेटा। लेट मी शो यू स्टैंडर्ड ट्रेकियोस्टमी पिक्चर बेटा। स्टैंडर्ड ट्रेकियोस्टमी विल बी लाइक दिस बेटा, ओह लाइक दिस, ट्यूब डली हुई है ना बेटा, कैन यू सी ट्यूब इज देयर, ओह ट्यूब डली हुई है, दिस इज नॉर्मल स्टैंडर्ड ट्रेकियोस्टमी। बट इफ यू सी अ होल इन द नेक without any tube over there, this is definitely permanent tracheostomy बेटा, permanent tracheostomy। ये कभी भी होल दिखे, permanent tracheostomy। What is the name of surgery बेटा? Total laryngectomy। What is the procedure now here? Permanent tracheostomy has been done after NEETPG last question बेटा। They gave this picture, they asked what surgery has been done in this patient, the answer is total laryngectomy। Second question is this one, what is the name of this hole beta? Is a standard tracheostomy or permanent tracheostomy? Permanent, because there is no tube beta, okay। And if out of this hole they show you a plastic nipple like thing, it is what beta? TEP device। What is TEP device? Tracheoesophageal puncture device, which is used to speak after the surgery beta। And the example of TEP device is Blom-Singer prosthesis beta, Blom-Singer prosthesis beta, okay। This is a very commonly asked topic in INICET NEETPG। ये जो होल है ना नेक में कहीं ना कहीं आ रहा है बेटा, तो इस होल का नाम है परमानेंट ट्रेकियोस्टमी, सर्जरी का नाम है टोटल लारिंजेक्टमी, प्लास्टिक निप्पल लाइक थिंग इज कॉल्ड TEP डिवाइस बेटा, okay। And this one is electrolarynx or artificial larynx। It is a handheld external battery operated mechanical vibrator बेटा, याद रखा बेटा, फाइन। सो बोलने के लिए क्या यूज होता है बेटा, यू नो esophageal voice number 1, this electrolarynx artificial larynx is battery operated external vibrator, एक्सटर्नल वाइब्रेटर है। लेकिन TEP डिवाइस इज इंपॉर्टेंट, ये वाला इट इज Blom-Singer prosthesis, इट्स इंटरनल डिवाइस। गाइस प्लीज 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 ये जो ट्रेकियोस्टमी वाली पिक्चर है ना, तो ध्यान में रखना, NEETPG वाले बहुत पूछ रहे हैं आजकल बेटा ये पिक्चर, ओके बेटा, फाइन। चलो नेक्स्ट वन बेटा, नेक्स्ट वन एवरीबॉडी, लेवल ऑफ नेक नोड बेटा, ये आप रिवाइज कर लेना। एक लेवल 5 इंपॉर्टेंट है, posterior triangle or supraclavicular। Most of the lymph node lie below which muscle beta? Sternocleidomastoid। And which vein around? They are around which vein beta? Internal jugular vein beta। Level 2, level 3, level 4, they lie below which muscle? Sternocleidomastoid। And around which vein beta? Internal jugular vein, okay। Don't forget level 5, level 5 is supraclavicular or posterior triangle lymph node beta, okay। R&D surgery beta, radical neck dissection surgery। Next beta, R&D surgery, radical neck dissection surgery। Now, this surgery is done for metastatic secondary neck node beta। We remove a lot of structure from the neck to clear the neck of cancer cells better. Important is which neck node, 1 to 5, not 6 and 7. Important thing is which two muscle beta. Please look, sternocleidomastoid and omohyoid beta. Don't forget beta these two muscle beta, sternocleidomastoid and omohyoid. Okay, there are only two muscle removed, sternocleidomastoid, omohyoid beta. Which vein is removed? Internal jugular vein. Which nerve is removed? Accessory spinal nerve. And which two glands are removed? Tail of parotid and subsalivary gland. This is a expected question in surgery. In NEETPG is asking. All are removed in R&D except beta. Once again, let's revise beta. Let's revise everybody. Let's revise everybody. Number is the level 1 to level 5 neck node are removed. Which two muscles are removed? Sternocleidomastoid and omohyoid. Omohyoid beta. Okay, fine. Now, next one is which vein is removed? Internal jugular vein. Which nerve is removed? Beta? Accessory spinal nerve and tail of parotid and subsalivary. Okay, चलो. Now ट्रिक्योस्टमी में क्वेश्चन आना ही आना है बेटा. ऐसा पैटर्न चल रहा है आजकल नीट-पीजी में भी और एफएमजी में भी. Why we do tracheostomy beta? Basically for airway management beta. Airway management beta. सांस नहीं आ रहा. Breathing problem. Any breathing problem below the larynx, you know, sorry, above the larynx, above the trachea, any at the level of larynx, any problem is there, you do tracheostomy. So you can clear the lungs also of the secretion also. If the patient got a lot of secretion in the lungs, you can clear the secretion of lungs through the tracheostomy also. Okay, ICU patient need tracheostomy, है ना? So tracheostomy is a popular topic. Most common site of tracheostomy is second and third tracheal ring, and this is called mid tracheostomy. But MCQ is high tracheostomy. High tracheostomy is done in which disease? Cancer, larynx. It is done in first and second ring. कोई नहीं बोलेगा बेटा. High mid tracheostomy is first, second, and third ring बेटा. Most common site. But high tracheostomy is first and second ring, done in cancer larynx. Tracheostomy reduces dead space by 50%. Tracheostomy is temporary procedure except after total laryngectomy. याद है बेटा, after total laryngectomy you get permanent tracheostomy. Next one. Tracheostomy can lead. Which vein is removed? Internal jugular vein. Which nerve is removed? Accessory spinal nerve. And which two glands are removed? Tail of parotid and subsalivary gland. This is a expected question in surgery. In NEETPG is asking. All are removed in R&D except beta. Once again, let's revise beta. Let's revise everybody. Let's revise everybody. Number is the level 1 to level 5 neck node are removed. Which two muscles are removed? Sternocleidomastoid and omohyoid. Omohyoid beta. Okay, fine. Now, next one is which vein is removed? Internal jugular vein. Which nerve is removed? Beta? Accessory spinal nerve and tail of parotid and subsalivary. Okay, चलो. Now tracheostomy में क्वेश्चन आना ही आना है बेटा. ऐसा पैटर्न चल रहा है आजकल नीट-पीजी में भी और एफएमजी में भी. Why we do tracheostomy beta? Basically for airway management beta. Airway management beta. सांस नहीं आ रहा. Breathing problem. Any breathing problem below the larynx, you know, sorry, above the larynx, above the trachea, any at the level of larynx, any problem is there, you do tracheostomy. So you can clear the lungs also of the secretion also. If the patient got a lot of secretion in the lungs, you can clear the secretion of lungs through the tracheostomy also. Okay, ICU patient need tracheostomy, है ना? So tracheostomy is a popular topic. Most common site of tracheostomy is second and third tracheal ring, and this is called mid tracheostomy. But MCQ is high tracheostomy. High tracheostomy is done in which disease? Cancer, larynx. It is done in first and second ring. कोई नहीं बोलेगा बेटा. High mid tracheostomy is first, second, and third ring बेटा. Most common site. But high tracheostomy is first and second ring, done in cancer larynx. Tracheostomy reduces dead space by 50%. Tracheostomy is temporary procedure except after total laryngectomy. याद है बेटा, after total laryngectomy you get permanent tracheostomy. Next one. Tracheostomy can lead to apnea due to CO2 washout. Body से CO2 leak हो जाती है. Surgical emphysema is a star question again. सर्जिकल एम्फिजेमा इज एयर इन सबक्यूटेनियस प्लेन, स्किन के नीचे एयर इकट्ठा हो गया, कलेक्शन ऑफ एयर बिलो द स्किन, एयर इन सबक्यूटेनियस प्लेन, एंड दिस इज ड्यू टू टाइट स्किन सूचर्स. टाइट स्किन सूचर्स, टाइट स्किन सूचर्स. एमसीक्यू, एमसीक्यू. ट्रिकोस्मी क्वेश्चन आने ही आने बेटा. Tracheostomy tube बेटा. The best tracheostomy tube is PVC, cuffed, vortex tracheostomy tube. Look at your note better. Best tracheostomy tube in general, or best tracheostomy tube for ICU patient. Best tracheostomy tube is, कोई भी क्वेश्चन बेस्ट tracheostomy tube is, आंसर इज vortex PVC cuffed tracheostomy tube. कफ होना चाहिए बेटा, cuffed. Okay. Cough will decrease what beta? Aspiration. Beta. Cough decreases aspiration. Beta. Cough decreases aspiration. Beta. Fine. Now, metallic tube, please keep Chevalier Jackson tube beta. Now, MCQ beta. अगर tube block हो जाए, it is airway emergency. Tube block हो जाना disaster है beta. Tube block हो गई. Airway emergency beta. Airway emergency. Everybody, what the answer beta? Everybody, I'm waiting for your answer. What is the answer? Remove the tube immediately. Remove the tube immediately. Remove the tube immediately. Remove the tube immediately, beta. Remove the tube immediately. Okay. Test tracheostomy is important. Yes. After this is the collective revision between not Rajiv Dhawan and it is Rajiv Dhawan is also appearing in the paper of FMG. He is also scanning the notes, keeping in mind what faculty told. This is important. What MCQs told, it is important. What PYQ told is important. It's a high yield revision, but after this is over, again, you have to revise ENT before the test tomorrow. Next one. Can we start, beta? Very good, beta. Remove the tube and put the new tube. Remove the tube is the answer, beta. Remove the tube is the answer. Yes, yes. Very good, beta. Chalo, beta. Can we start firings, beta? Everybody come here, beta. I'm waiting for 1 minute. Everybody come here. Just give me 1 minute also. Everybody, some students running behind actually. Finish this much of video. Come to firing, beta. We are taking 1 minute pause here so that everybody comes over here. कोई भी last का part miss नहीं करे ना फिर. चलो. In the meantime, please inform your friends also. Firing starting join from now. अगर by chance कोई नहीं join कर पाया अभी तक तो है ना. ठीक है. Revise कर लेते हैं. इकट्ठे revision हमको बोलो revision हो रही है इकट्ठे. High yield points. Yes, can we start now, pharynx? Everybody here now? All of you are there with pharynx? Okay. Chalo. Let's start pharynx. A smaller topic, but scoring topic. है ना? Chalo. Pharynx, आपने notes देखो बेटा, everybody. Pharynx is from skull base to C6 vertebra. Everybody, C6 vertebra. C6 vertebra is important, beta. C6 vertebra is important. Why? At C6, trachea and pharynx convert to esophagus. Esophagus. Okay. C6 important vertebra. C6 पे larynx finishes, trachea starts. C6 पे pharynx finishes, esophagus start. Beta. Now pharynx is a fibromuscular tube, the three muscle, superior constrictor, middle and inferior. Beta. SCMCIC. Beta. Superior constrictor, middle constrictor, inferior constrictor muscle. Beta. Okay. Now inferior is important. Beta. Inferior got two fiber, oblique fiber called thyropharyngeus, circular is called cricopharyngeus. Oblique fiber called thyropharyngeus, circular is called cricopharyngeus. Beta. Cricopharyngeus. Okay. Now everybody don't forget the word Killian. Note, beta. Killian dehiscence has no muscle. Beta. First of all, dehiscence means weakness. No muscle. Now MCQ. It is in the fiber of inferior constrictor muscle between the fibers of TP and CP, thyropharyngeus and cricopharyngeus. Beta. Between the fiber of thyropharyngeus and cricopharyngeus. Beta. Now, this area lacks muscular support. Therefore, it is site of formation of Zenker diverticulum or pharyngeal pouch. Beta. Therefore, it is site of formation of Zenker diverticulum or pharyngeal pouch. Nobody should forget. Killian dehiscence is important. Killian dehiscence belongs to which muscle? Inferior constrictor muscle between the fiber of thyropharyngeus and cricopharyngeus, and it is site of formation of Zenker diverticulum. Yes, beta. Bryce's sign was laryngocele. Boyce's sign, surgery topic, is Zenker diverticulum. Beta. Okay, chalo. Now, everybody, next page, beta. Guys, everybody, please don't forget to revise that coin story. Beta. Coin story is very important. Let me show you a picture again, but I'm sure you know it. पर एक बार रिवाइज कर लेते हैं. कॉइन पे क्वेश्चन हर बार नीट पीजी में, एमसीआई के क्वेश्चन में भी आ जाता है बेटा, आ जाता है. ओके, एक बार ये देख लेते हैं दोबारा से बेटा. इफ यू सी द फुल कॉइन इन फ्रंट, फुल कॉइन इन द फ्रंट, दिस इज बेटा, ध्यान देना बेटा, दिस इज व्हाट बेटा, ओ फॉर ईसोफेगस, है ना, ईसोफेगस ना. अगर सामने ओ दिख रहा है तो ओ फॉर ईसोफेगस बेटा, ईसोफेगस, ओ फॉर ईसोफेगस बेटा. ओके फाइन. और अगर साइड वाले में ये दिख रहा है तो भी ईसोफेगस. साइड वाले में क्या दिख रहा है बेटा, ये वाला, तो ईसोफेगस. फ्रंट पे अगर पूरा कॉइन देखे, ओ फॉर ईसो, यार 3F रूल बेटा. रिमेंबर 3F रूल. इफ 3F रूल बेटा, इफ फुल कॉइन इज विजिबल ऑन द फ्रंट एक्सरे, देन द कॉइन इन द फूड पाइप बेटा. और क्या करना है इस पे, ईसोफेगोस्कोपी, रिजिड ईसोफेगोस्कोपी एंड रिमूवल बेटा. रिजिड ईसोफेगोस्कोपी एंड रिमूवल. ओके फाइन. नाउ ये वाला कॉइन इन ट्रेकिया बेटा. ट्रेकिया में उल्टा कर दो बेटा. ट्रेकिया में अगर फ्रंट में ऐसे दिख रहा है, अगर लाइन दिख रही है, तो एक ऐसे टी बना लो बेटा. देखो टी बन गई, टी फॉर ट्रेकिया, टी फॉर ट्रेकिया. बहुत सिंपल है बेटा. अगर फ्रंट वाले में ओ दिख रहा है तो ओ फॉर ईसोफेगस. अगर फ्रंट में लाइन दिख रही है, लाइन के ऊपर एक और लाइन बना लो बेटा, दिमाग में लाइन बना लो, तो क्या बन गया बेटा, ट्रेकिया नहीं बन गया, है ना. दिस इज सीरियस, दिस इज सीरियस फॉरेन बॉडी, है ना गाइस. इसमें आपको ब्रोंकोस्कोपी करके निकालना पड़ेगा. हेमलिच मैन्यूवर is for laryngeal foreign body. Laryngeal foreign body, you hemorrhage maneuver. Esophagus foreign body, you do esophagoscopy. Okay, esophagoscopy बेटा. और अगर बैटरी वाला क्वेश्चन आया, बैटरी वाला तो अर्जेंट esophagoscopy and removal बेटा. अर्जेंट esophagoscopy and removal बेटा. ये सारे क्वेश्चन याद रखना बेटा. Pharynx के साइनस ऑफ मॉर्गैग्नी बेटा, SOM, it is It is space between skull base and upper border of superior constrictor muscle. What is SOM? Sinomonogagny. It is space between skull base and upper border of superior constrictor muscle. MCQ beta. Which muscle pass use taken tube, and its muscle called tensor villi palatini muscle passes through sinus of Morgagni. Everybody, which two muscle pass through it? Which two thing pass through it? Use taken tube, and its muscle called sinus is muscle called tensor villi palatini muscle passes through sinus of Morgagni. Pharynx the तीन part है बेटा, nasopharynx, oropharynx, laryngopharynx. Nasopharynx, oropharynx, larynx. Laryngopharynx also called hypopharynx. Larynx के आगे पीछे ये वाला, this is larynx बेटा, and this is the laryngopharynx. Laryngopharynx. This is larynx. Can you see larynx बेटा? Can you see this yellow thing? Laryngopharynx. It has a three part: piriform sinus right, piriform sinus left बेटा. This is PCA. But what is PCA? Post-cricoid area, and the mucosa is called posterior pharyngeal wall. Posterior pharyngeal wall. Once again, what is the other name of laryngopharynx? Hypopharynx. It is got three parts. Number one, piriform sinus right and left. Number two, post-cricoid area, and number three, posterior pharyngeal wall. That's piriform sinus also called piriform fossa. एक ही बात है बेटा. Sinus को fossa बोलते हैं. Piriform तो है ना बेटा. छोटे छोटे वर्ड्स चेंज के लिए आंसर नहीं चेंज करना यार. ना दो तरह के लिटरेचर है, यूरोपियन अमेरिकन. तो कोई कुछ बोलता है, कोई कुछ, लेकिन इफ मेन थीम ऑफ क्वेश्चन इज मैचिंग माय कांसेप्ट, डोंट चेंज द आंसर बेटा, है ना? फाइन, ओके. नाउ दिस इज अ विजुअल क्वेश्चन बेटा. इफ यू एवर सी एरो ऑन द साइड ऑफ द लैरिंग्स, it is called piriform. It is piriform sinus. If you ever see arrow on the side of larynx, it's called piriform sinus. Piriform sinus. Piriform sinus. Okay. Now, Akash, your question is for surgery people. Please ask Dr. Vineet about it. It's an abdominal foreign body. Please ask Dr. Vineet about it. Okay. So I'll be happy to reply to that, query. But it's an abdominal foreign body. Okay. Now, most common site of hypopharyngeal cancer is piriform sinus, beta. Piriform sinus. Now, again, beta, ये now important है beta. ILN, internal laryngeal nerve. It gives sensory supply to supraglottis and piriform sinus, beta. So please see, this is your supraglottis, and this nerve is coming internal laryngeal nerve, also called internal branch of superior laryngeal nerve. It gives sensory supply to supraglottis, and it gives sensory supply to piriform sinus also. This now prevents aspiration, and is a very famous NEETPG question nowadays. Internal laryngeal nerve. Okay, beta. Question yaad hai beta? While removing the fish bone, surgeon damaged internal laryngeal nerve. Which area foreign body is stuck? Piriform sinus. Fine. Get ready for the little indirect questioning also. Laryngeal crepitus, as the karke dekho ye na crepitus, it's a clicking sensation felt when larynx moved to the vertebra. It is after which cancer, beta? Post-cricoid carcinoma. If there's a cancer behind the larynx, this crepitus is absent, and the absence of crepitus is called which sign, beta? Moore's sign. क्या बोलते हैं? Moore's sign, beta. क्या बोलते हैं? MOURE. Which sign, beta? Moore's sign, beta. MOURE. Moore's sign, beta. Yes, don't forget this picture, beta. Piriform sinus. Don't forget the story of the internal laryngeal nerve also, beta. ये PG का question है बेटा, है ना? Fine. Nasopharynx. Why 100 question in ENT बेटा? Reason is फिर हम TND टेस्ट एंड डिस्कशन करेंगे तो वो 100 पॉइंट पर दोबारा डिस्कस हो जाएंगे, है ना बेटा? When we do the TND, there will be 100 question. We'll discuss 100 points also बेटा, है ना? तो एक बार TND में भी हो जाए, डिस्कशन हो जाएगा, है ना? Fine. चलो. Nasopharynx, behind the nose nasopharynx, and I hope you know there are two things. Number one is adenoid, and number two, eustachian tube opening. I told you, if anything which blocks the eustachian tube, there will be which problem in the ear? Answer is glue ear. Glue ear will lead to CHL. What is CHL? Conductive hearing loss. Conductive hearing loss. ये line बहुत important है. Eustachian tube connects middle ear to nasopharynx. Therefore, nasopharyngeal diseases can lead to middle ear diseases. For example, glue ear, also called serous otitis media, which lead to CHL. What is CHL? Conductive hearing loss. तीन टॉपिक हैं, एडेनॉइड, एंजियोफाइब्रोमा, एनपीसी. तीनों में एमसीक्यू आते हैं आपके पेपर में. पहले एडेनॉइड. Adenoid, behind the nose, lymphoid tissue is there, and it has no capsule, no crypt, no definite blood supply, है ना? it is there at birth, it finishes by 20 years of age, beta, है ना? Okay, but more than normal enlargement is called hypertrophy. Adenoid hypertrophy is a disease of school age children. मैंने पहले बताया था, mouth breathing child is adenoid hypertrophy question. Mouth breathing child is adenoid hypertrophy question. The look of the child is called adenoid face. Look at your note, beta. Adenoid face has got open mouth, pinch nose, high palate, and malocclusion of teeth. Open mouth, mouth breathing child, pinch nose, high palate, and malocclusion of teeth, beta. Number 2, beta, don't forget CHL. Hearing loss, conductive hearing loss. I told you glue ear and adenoid question are married to each other, beta. है ना? Mostly bilateral glue ear, beta. है ना? Failure to thrive, बच्चा बढ़ता नहीं है, OSA, obstructive sleep apnea. Please, MCQ, beta, clear cut question. Mouth breathing child plus hearing loss. This is a question of adenoid hypertrophy plus glue ear, beta. ध्यान दो बेटा. Mouth breathing child मतलब adenoid hypertrophy question. With hearing loss मतलब glue ear. So treatment will be adenoidectomy surgery plus myringotomy and grommet insertion. है ना बेटा? For adenoid you do the adenoidectomy. For hearing loss you do the myringotomy and grommet. You know glue needs grommet, बेटा. है ना? ये तो क्वेश्चन आ रहे बार बार है ना बेटा? फाइन. ओके, ये क्वेश्चन तो नीट पीजी का INICET में भी आया इस बार बेटा. माउथ ब्रीदिंग चाइल्ड with hearing loss is adenoid hypertrophy with glue ear, and you need adenoidectomy with myringotomy with grommet insertion. Treatment is surgery called adenoidectomy. And what is the position name, but everybody? Write down the chat box, but are you alive? Are you with me, but everybody? All of you answer this question. Whosoever is in the WhatsApp chat box, answer this question so I should know how many people are hearing me. मुझे कैसे पता लगेगा कितने लोग हैं? You can see me, I cannot see you. Everybody, please answer this question. What is the name of position, beta? What is the name of position? Everybody, both groups, beta. Okay, rose position about neck extension, neck extension. Same position used for tonsillectomy also. Tonsillectomy also, very good. Rose position, very good. But don't do over neck extension, but over neck extension. Don't do over neck extension. It will lead to Atlanto. Very good, very good. Wow, very good. That's the only way I can virtually imagine you guys. Fine. Okay. Fine. Atlanto axial subluxation. C1, C2 subluxation. And this is called very good. Grissel syndrome. क्या बोलते हैं बेटा? Grissel syndrome. याद है बेटा? Grissel syndrome. साइकिल की स्टोरी याद है? मेरा साइकिल बेटा याद है? ग्रीस ओवर ग्रीस लगाने से चेन जो सी एक्सल से सबलक्सेट कर जाती थी. ओवर करने से ओवर ग्रीस लगाने से चेन एक्सल से सबलक्सेट कर जाती थी. सो ओवर एक्सटेंशन ऑफ नेक कैन लीड टू अटलांटो एक्सिल सबलक्सेशन. दिस सिंड्रोम एमसीक्यू बेटा. ग्रिसल सिंड्रोम बेटा. ग्रिसल सिंड्रोम. वेरी गुड. परफेक्ट. ये बस बेटा यही एनर्जी चाहिए बेटा. दिस इज द एनर्जी रिक्वायर्ड. मतलब जो हमें मतलब जो इस समय होना चाहिए, मेंटल स्टेट होना चाहिए, एंथुजियाज्म बेटा. एंथुजियाज्म बहुत इंपॉर्टेंट है लाइफ में. Even in the most struggling situation, you can be at least, trying your level best, बेटा. वो तो करना ही चाहिए ना बेटा, है ना? Fine. Very good. Tonsillectomy also. Method of surgery is curettage. An instrument is called St. Clair Thompson adenoid curette, बेटा. Okay, fine. Guys, कोई भी ये मत भूलना बेटा. Mouth breathing child with the hearing loss, adenoid hypertrophy with glue ear, and the treatment is adenoidectomy with myringotomy, grommet insertion. Okay, fine. Do not do over neck extension, better, है ना? Fine. बिश्नोई, अगर एडेनोइड फेस के साथ कंडक्टिव हेयरिंग लॉस है तो वो ग्लू ईयर ही है. बिश्नोई, अगर एडेनोइड फेस के साथ हेयरिंग लॉस है तो वो ग्लू ईयर ही है बेटा. ग्लू ईयर ही तो है. वो ग्लू ईयर नहीं लिखेंगे बेटा. दे विल नॉट एड ग्लू ईयर बेटा. वो लिखेंगे माउथ ब्रीदिंग चाइल्ड विद हेयरिंग लॉस. इतना ही बहुत है. माउथ आपको खुद इंटरप्रेट करना है ना. वहां ऐसा नहीं कि प्लेट में रख के क्वेश्चन देने वाले वो लोग बहुत खूंखार लोग हैं, पता है ना तुम्हें. एंजियोफाइब्रोमा, लेकिन कर लेंगे हम लोग. अगर वो खूंखार है ना तो हम दिलदार हैं. अगर वो खूंखार हैं तो हम भी तो दिलदार है भाई, है ना. पढ़ तो रहे हैं, और क्या करना है, ये तो करना है. Angiofibroma, JNA, juvenile nasopharyngeal angiofibroma. It's a benign but locally invasive tumor. Benign, locally invasive tumor. and it's originating from sphenopalatine foramen beta. Okay, fine. It's a highly vascular tumor. It's a highly vascular tumor beta. Angiofibroma. ENT में 2 vascular tumor में ध्यान सुनना बेटा. ENT में 2 vascular tumor है. Young boy question beta. क्या बात है? A lady with something pulsating or bleeding in ear is glomus question. A young boy with nasal mass epistaxis is angiofibroma question beta. Okay, fine. Now, it is seen in adolescent boys. Look at it, beta. Adolescent boys. 12 से 16 साल. अगर 17 साल लिखा हो तो बुरा मत मान जाना बेटा. छोटी छोटी बातों को बुरा नहीं मानते बेटा, है ना बेटा. फाइन. छोटे मोटे इतना थोड़ा बहुत चेंज होंगे, वहां पे चेंज होंगे. 12 to 16 years बेटा. Your examiner has not read your notes बेटा. Examiner is might proptosis बेटा. This is proptosis called frog face deformity. ध्यान देना बेटा. Adenoid में adenoid face, frog face deformity in angiofibroma बेटा. Okay बेटा, fine. Now, next one. Hope, जो भी hope है ना, दोबारा fine. Brain. Okay. Now. Okay, I'll repeat, but I'll repeat. Once again, I'll repeat. I'll repeat, don't worry. Wait, I'll repeat. Once again. We'll repeat. One minute. Is it okay now? Please confirm. I'll repeat my angiofibroma, don't worry. Is it better? Any devices band games. Is it better now? Is it okay? Can we start now? Fine. Okay, चलो दोबारा शुरू करते हैं बेटा. एंजियोफाइब्रोमा से. It's also JNA, juvenile nasopharyngeal angiofibroma. दोबारा स्टार्ट करते हैं. Let's start again. It's a benign but locally invasive tumor, and it is rising from sphenopalatine foramen. The main thing is a highly vascular tumor, and it is seen in young boys 12 to 16 years of age. I was telling there are 2 vascular tumor in ENT. एक लड़कों में, एक लड़कियों में. बराबर बराबर बांट लेते हैं. कोई भी बुरा ना माने, ना लड़कियां बुरा माने, ना हम लोग बुरा माने. हमारे हिस्से में आया एंजियोफाइब्रोमा. Female get glomus better. A lady with something pulsating or bleeding in the ear is glomus question. A young boy with nasal mass epistaxis is angiofibroma question. A lady with pulsatile tinnitus or bleeding ear mass is the question of glomus. mass epistaxis is angiofibroma question. Okay. I was telling the tumor can go to nose, cheek, orbit, and brain. The orbital part will lead to proptosis, and this is called frog face deformity. MCQ, the frog face deformity is typical of angiofibroma. Frog face deformity. Okay. Now, don't forget, adenoid face is adenoid hypertrophy. Frog face deformity, angiofibroma. आँख का बाहर आ जाना. Frog adenoid face is open mouth, beta, brain. 12 to 16-year-old boy with nasal mass, with profuse epistaxis, with cheek swelling, with hearing loss, जो मर्जी लिखाओ, with dull voice, कुछ भी, anything written. Young boy है, nasal mass है, bleeding from nose है, think of angiofibroma. Biopsy is contraindicated, and MCQ radiology, we do CECT, beta. And not CT, beta, not CT. We don't do CT, we do CECT, and that shows Hallman-Miller sign, and it is anterior bowing of posterior wall of maxilla. Tumor maxilla को धक्का मार के आगे भेजता है. Anterior bowing of posterior wall of maxilla, and we also do angiography in this patient. And he was ENT, two tumor, glomus tumor and angiofibroma. Both are vascular, both are benign, both are locally invasive. In both we need angiography. In we both biopsy is contraindicated. Treatment is surgery. Treatment is surgery. Treatment is surgery. चलो बेटा, can you start with NPC, beta, nasopharyngeal carcinoma? It's more common in China, beta. It's more common in China, and etiology Chinese cancer. What is the etiology? Virus, beta. अगर cancer Chinese है, तो etiology virus होगी, beta. Which virus? Epstein-Barr virus, EB virus, beta. Site of origin, fossa of Rosenmuller is a famous question. अभी आया बेटा, अभी आया, अभी एग्जाम में आया बेटा, है ना, NEETPG में अभी आया, इसलिए आने के चांस है. कभी any arrow above the eustachian tube opening is fossa of Rosenmuller. This is eustachian tube opening, and this is nasopharynx, beta. In the nasopharynx, if they put an arrow above the eustachian tube opening, the answer is fossa of Rosenmuller, beta. And I am sure you know this cancer is a hidden cancer. It will cover the eustachian tube opening, and it will cause what, beta? Unilateral glue ear. But this will be adult patient, beta. Adenoid was young child, beta. School going child, adult, 50 to 60 year, beta. Can nasopharyngeal carcinoma patient question will be 50, 60-year-old adult, beta. It will be unilateral conductive hearing loss, and that's the main thing, beta. Okay. Don't forget fossa Rosenmuller. Don't forget the glue ear story, unilateral. Don't forget the adult, beta. Adenoid was school age child. NPC is adult, beta, adult. Now this is a very important question. हमेशा लोग गलत करके आते हैं. NPC is a hidden cancer or occult primary. So most common manifestation of NPC is metastatic cervical lymphadenopathy is equal to secondary neck node. Secondary neck node. Guys, मैं हमेशा बोलता हूँ NPC में पहला आंसर दिमाग में आता है कंडक्टिव हेयरिंग लॉस लगा दो. मोस्ट कॉमन इज नॉट कंडक्टिव हेयरिंग लॉस बेटा. मोस्ट कॉमन इज NPC, N फॉर नेक बेटा. नेक पहला सिम्टम कहाँ आएगा? NPC का फर्स्ट वर्ड क्या है? N. पहला सिम्टम है नेक में बेटा. फर्स्ट सिम्टम नेक में. सो गाइस डोंट मार्क कंडक्टिव हेयरिंग लॉस बेटा. इट इज सेकेंडरी नेक नोड और द मेटास्टैटिक सर्वाइकल लिम्फेडेनोपैथी बेटा. मेटास्टैटिक सर्वाइकल लिम्फेडेनोपैथी. फाइन बच्चे, फाइन. Very good. Okay. What is the name of triad? Trotter's triad of NPC. Mnemonic is NPC. Revise to NPC. Nasopharyngeal carcinoma, NPC, Trotter's triad, NPC. And for neuralgia in temporoparietal area due to fifth nerve involvement. P for palatal palsy due to 10th nerve involvement. Okay. And C for conductive hearing loss. C for conductive hearing loss. Okay, fine. Conductive hearing loss. Neuralgia in temporoparietal area due to fifth nerve involvement. P for palatal palsy due to 10th nerve involvement. C for conductive hearing loss due to glue ear. All are unilateral. Treatment में सबसे बड़ी गलती, एक गलती यहाँ होती है बेटा. एक तो हिडन कैंसर, ये मोस्ट कॉमन मैनिफेस्टेशन में गलती हो रही है लोगों से. लोग कंडक्टिव हेयरिंग लॉस लगाते हैं. नो, इट इज सेकेंडरी नेक नोड और मेटास्टैटिक आना ही आना है, कहीं ना कहीं फंस जाते क्वेश्चन। ट्रीटेड और ट्रीटमेंट, लोग इट इज कीमो रेडिएशन, बेटर आंसर बेटा। अगर वो चॉइस में नहीं है तो प्लीज मार्क रेडियोथेरेपी। लोग कीमोथेरेपी लगा, कीमो वर्ड पहले दिखता है, कीमोथेरेपी लगा देते हैं। नो नो, कीमोथेरेपी एज अलोन हैज नो रोल, इट्स अ रेडियो सेंसिटिव ट्यूमर बेटा। कीमो रेडिएशन, सेकंड बेस्ट आंसर इज रेडियोथेरेपी, सेकंड बेस्ट आंसर इज रेडियोथेरेपी। चलो, कैन वी स्टार्ट ओरोफैरिंग बेटा एवरीबॉडी? कैन वी स्टार्ट? यहां तो कोई क्वेश्चन बेटा एवरीबॉडी? कैन वी स्टार्ट ओरोफैरिंग्स? ओरोफैरिंग्स बेटा। नाउ ओरल कैविटी, ओरोफैरिंग बेटा। गाइस डोंट से कीमो ओवर रेडियो बेटा, डोंट। अगर फिर कितने कीमो ओवर रेडियो लिखा है बेटा, डोंट अतुल। जो भी है, कीमोथेरेपी का कोई रोल नहीं है, कीमो ओवर रेडियो नहीं बेटा, कीमोथेरेपी विद रेडियोथेरेपी। आई डोंट नो व्हाई दिस मिस्टेक इज बीइंग डन सो कॉमनली, क्योंकि बुक में जो एक एमसीक्यू बुक यूज करते हैं उसमें इसका आंसर थोड़ा गलत लिखा हुआ है, अनफॉर्चुनेटली वहां से गलती हो जाती है बेटा। गाइस मैं फिर कह रहा हूं, ये मार्क्स लूज मत कर देना, कीमोथेरेपी का कोई अकेले रोल नहीं है बेटा। इफ यू मार्क कीमो ओवर रेडियोथेरेपी अगेन, आप ये अगर आप ये सोच रहे हो फिर गलती हो जाएगी बेटा पेपर में। कीमो रेडिएशन का मतलब है कीमोथेरेपी विद रेडियोथेरेपी। इफ दैट इज नॉट द चॉइस देन यू मार्क रेडियोथेरेपी। इज एवरीबडी क्लियर बेटा? हाँ अतुल, ये ठीक है बेटा। अतुल पाठक, कीमो प्लस रेडियो बेटा, कीमो प्लस रेडियो इज द बेस्ट आंसर। अगर वो नहीं है तो फिर ओनली रेडियोथेरेपी। फाइन, चलो नेक्स्ट वन, ओरोफैरिंग बेटा। ओरल कैविटी ओरोफैरिंग्स, you know oropharynx के पार्ट सारे के सारे, ओके। वेलिक्यूला इज इंपॉर्टेंट बेटा। In between teeth is oral cavity, behind that is oropharynx. Vallicula is the part of oropharynx. It is space between the base of tongue and epiglottis. Between base of tongue and epiglottis. Space of tongue, space between base of tongue and epiglottis. Space between base of tongue and epiglottis. ओरोफैरिंग में क्या होता है बेटा? याद है बेटा ओरोफैरिंग में? ये आपको याद हो, ओरोफैरिंग में इट इज the behind the oral cavity is the oropharynx beta. Behind the oral cavity is the oropharynx. And oropharynx में क्या होता है? Soft palate, uvula, anterior and posterior tonsillar pillars. And then we have got what beta? Then we have got the base of tongue, and then we have got the, let me show the picture beta. Base of tongue has got lingual tonsil. Then we have got the ye picture below. Please see this picture. Yes. Okay. Soft palate, uvula, anterior posterior pillar, between two pillars, tonsil called palatine tonsil. Base of tongue has got lingual tonsil, then posterior pharyngeal wall, and then we have got what beta? We have got what? Vallicula beta. Vallicula is a part of oropharynx. Vallicula is the space between base of tongue and epiglottis. चलो ना आगे चलते बेटा एवरीबॉडी, लेट्स गो फर्दर। बेड ऑफ टॉन्सिल, it is made by superior constrictor muscle. Everybody look at me, this is bed of tonsil. Two things are there, styloid process and glossopharyngeal nerve. If styloid process becomes very long and it start pressing the glossopharyngeal nerve, it will lead to which syndrome beta? Look at it, lead to which syndrome? Eagle syndrome. What is the name of syndrome? Eagle syndrome. Long styloid process touching the ninth nerve. It lead to throat pain referred to ear. This is called eagle syndrome or styalgia. क्या बोलते हैं? Eagle syndrome. Eagle से याद आया बेटा? Eagle syndrome or styalgia बेटा. Eagle syndrome or styalgia. Okay बेटा, fine. Eagle syndrome or styalgia बेटा. चलो. Tonsil बेटा. Tonsil has got capsule, crypts, definite blood supply. Deepest crypt is called crypta magna. Crypta is depression in the tonsil. The deepest crypt is called crypta magna. Main source of blood supply is MCQ is tonsillar branch of facial artery. कोई बोलेगा नहीं बेटा इसको. Tonsillar branch of facial artery बेटा. Tonsillar branch of facial artery. Venous drainage is paratonsillar vein. Venous drainage is paratonsillar vein. Put an arrow. This vein is the main source of bleeding during tonsillectomy. This vein is the main source of bleeding during tonsillectomy. There are two questions in front of you, beta. Main source of blood supply is tonsillar branch of facial artery. Venous drainage is paratonsillar vein, and this vein is the main source of bleeding during tonsillectomy. And hemorrhage in tonsillectomy is a favorite topic. Primary hemorrhage is during surgery in operation theatre. Reactionary hemorrhage is within 24 hours in the ward. It is due to slippage of ligature. It is emergency. Severe bleeding is there. R for reactionary, R for re-exploration. Re-exploration. R for re-exploration. Okay, fine. Now, number 3, secondary hemorrhage. Home, ghar pe hua. After 24 hours, mostly after 5th day, causes infection. It's a mild bleeding. Treatment is intravenous antibiotic. Yaad rahega beta, fine. R for reactionary, R for re-exploration, secondary due to infection, mild bleeding, need intravenous antibiotic. Let's revise once again, beta. Primary is during surgery in the operation theatre, reactionary in the ward, secondary from home. Reactionary hemorrhage due to slippage of ligature, R for reactionary, R for re-exploration in the operation theatre, and secondary due to infection, mild bleeding, need intravenous antibiotic. Whitish membrane on tonsil. This is important. Don't forget, beta, whitish. Don't forget Vincent angina. Vincent and all angina are not cardiac, beta. Vincent ka last T for tonsil. Yeah, there are other angina pectoris, heart, chest pain. Ludwig angina, Ludwig, chin swelling. Vincent T for tonsil, beta. T for tonsil wala problem. Tonsil. Okay, fine. Don't forget diphtheria, beta. Diphtheria, everywhere diphtheria is important, beta. Diphtheria, ENT membrane, beta. Diphtheria, this is a true membrane or pseudo membrane. I'm waiting, beta. True membrane or pseudo membrane, beta. Everybody. It's a pseudo membrane and it bleeds on removal and it extends beyond tonsil, beta. Three point to remember, beta. It is a pseudo membrane. It extends beyond tonsil. It bleeds on removal. Once again, 3 point, beta. It's a pseudo membrane. It bleeds on removal. It extends beyond tonsil. Can you see it extending beyond tonsil? Diphtheritic membrane, beta. And the child will be having what? Fever. So will be having what, beta? Fever and bull neck, beta. Don't forget about bull neck is linked to diphtheria, beta. Bull neck, beta, bilateral cervical lymphadenopathy, beta. Bilateral cervical lymphadenopathy. Okay, beta, fine. Okay, bilateral diphtheria kahin na kahin aa jata hai. PSM mein, ENT, pediatric, diphtheritic membrane, beta. Pseudo membrane, bleed on removal, extend beyond tonsil. The child will be sick, febrile, fever, and bull neck, beta. Okay, Walder ring, beta. Ring of the lymphoid tissue in the pharynx having 6 different lymphoid tissue, beta. Adenoid, tubal tonsil, palatine tonsil, lingual tonsil, lateral pharyngeal band, and the lymphoid follicle on the posterior pharyngeal wall. Don't forget the name of ring. Walder ring. Walder ring. है ना? Walder ring. Quinsy anyway is important question, beta. Quinsy, peritonsillar abscess, mostly unilateral, seen in adults. This is important. Visual question. जब भी uvula टेढ़ा हो, uvula is pushed to other side, tonsil is pushed medially. टेढ़ा uvula ho, think of quinsy, beta. Only thing, please understand, there's no outer neck swelling in quinsy, beta. No outer neck swelling in quinsy. Please see examination. Tonsil is pushed medially. Okay, tonsil is pushed medially and uvula is pushed to other side. You can see tonsil is pushed medially, uvula is pushed to other side. Only thing to note is there should be no outer neck swelling in quinsy. Chief complaint, beta. Number 1, trismus, difficulty in opening mouth, beta. Muh nahi khul raha. Due to spasm of which muscle, beta? Medial pterygoid muscle. Which muscle, beta? Medial pterygoid muscle. Which muscle spasm, beta? Medial pterygoid muscle, beta. Medial pterygoid muscle. Okay. And number 2, hot potato. I told you, plummy voice or muffled voice, beta. Avaz muffled, as if you're holding a plum in the mouth, beta. Hot potato voice, plummy voice, muffled voice, एक ही बात है. Hot potato voice काफी जगह आता है, but अगर एक जगह चूज करनी पड़ जाए कभी तो quinsy is the best answer, beta. Guys, trismus, beta. Look at me, beta. मुंह नहीं खुल रहा, मुंह बंद का बंद रह गया. Medial pterygoid, beta. Medial pterygoid spasm. But we discussed the question in class also. If mouth remain open after yawning, आपने उबासी ली, mouth बंद नहीं हो रहा, you are not able to close the mouth. Lateral pterygoid, beta. Lateral pterygoid spasm. Remember, Unable to open the mouth, spasm of middle pterygoid muscle. Unable to close the mouth, the spasm of lateral pterygoid muscle. Okay, beta, fine. And treatment is per oral IND and remove tonsil after 6 weeks. This is called interval tonsillectomy. You are doing it after 6-week interval. It's called tonsillectomy. But if you do the tonsillectomy at the same time, it's an old concept called abscess or hot tonsillectomy. I hope everybody remember quinsy plus outer neck swelling. Quinsy में outer neck swelling नहीं होती. The answer is parapharyngeal abscess. Equation number 1 of ENT. Quinsy has no outer neck swelling. Quinsy plus outer neck swelling is equal to parapharyngeal abscess. Equation number 2. If you remember, atrophic rhinitis MCQ plus hard external nose. Crust formation, bad smell from the nose, atrophic rhinitis question plus hard external nose equal to rhinoscleroma. 2 MCQ में गलती होती है ENT में. NEETPG में भी आते हैं. NEETPG में आते हैं. Quinsy MCQ plus outer neck swelling is equal to parapharyngeal abscess. Atrophic rhinitis MCQ, crust formation in the nose, bad smell from the nose, plus hard external nose, then the answer is rhinoscleroma. Are these two equations clear, beta? Are these two equations clear, everybody? Done, beta. ये सब दोनों equation clear होगी बेटा, everybody? Say yes or no, beta. Are these two questions clear कि इनमें गलती होती है, हम नहीं गलती करेंगे पेपर में? Okay, beta, fine. Okay. Fine. मुंह खुला रह गया, spasm of medial खुला रह गया बेटा. The patient is unable to close the mouth. Which muscle spasm beta? Lateral pterygoid. Patient is unable to open the mouth, trismus, due to spasm of medial pterygoid muscle. Medial pterygoid muscle. Perfect. Chalo. Queen K. Remember the story? Jai Mahal versus Jal Mahal. Jai Mahal, Queen K, QUI. Queen K is different. It is idiopathic edema of uvula. Idiopathic edema of uvula. Once again, let's go. Trismus is difficulty in mouth opening is due to spasm of medial pterygoid muscle. The patient is unable to close the mouth after yawning is spasm of lateral pterygoid muscle. Lateral pterygoid muscle. Okay, beta, fine. Equation is clear, beta. Atrophic rhinitis MCQ. हमने क्लास में बात किया है. Hard external nose equal to rhinoscleroma. Retropharyngeal abscess, beta. This is this topic you write on your own, beta. Retropharyngeal lymph node, also called lymph node of Rouvier. Space of Gillette, beta. Spaces of Gillette, beta. Retropharyngeal space have got 2 halves. The 2 halves have got spaces of Gillette. And the lymph node have got retropharyngeal lymph node called lymph node of Rouvier. An infection of this lymph node lead to acute retropharyngeal abscess. Please keep in mind space of Gillette, beta. Anatomy question, beta. Space of Gillette. Space of Gillette, beta. Okay, beta, fine. Is it clear? This is just like pediatric problem with the airway. Fine, pediatric airway problem. Now, X-ray shows widening of premenstrual shadow. Just keep in mind that this is also respiratory emergency actually, beta. Fine. Just don't worry. We will discuss nose and nose, beta. वो तो मैंने वैसे बताया कि एक और क्वेश्चन वहां पे आइए डिस्कस करेंगे. Don't get panic, beta. Rhinoscleroma will discuss in rhinoscleroma, beta. Don't worry. Okay, वो तो वैसे मैंने बता दिया कि एक जगह पे आ गया ना इसलिए. Okay, चलो. Ludwig angina, not that was Vincent. Vincent was tonsil, T for tonsil. Ludwig is chin swelling, beta. It is infection of floor of mouth, also called which space, beta? Submandibular space, beta. Floor of mouth is made by which muscle? Mylohyoid muscle, beta. Basically, it's a floor of mouth infection, and floor of mouth is also called submandibular space. Floor of mouth is made by which muscle? Mylohyoid muscle, beta. Source of infection is dental caries, beta. Bacteria, Streptococci प्लस एनएरोब्स बेटा। कभी भी डेंटल इंफेक्शन के बाद प्लीज बेटा, दांत में इंफेक्शन हो गया एंड केरीज बेटा, द इंफेक्शन केम दिस वे, दैट चिन स्वेलिंग बेटा. So dental infection causing chin swelling, trismus is a question of Ludwig angina. Finish beta. Dental infection by chin swelling and trismus is Ludwig angina question beta. Okay. And what are the bacteria? Streptococci plus anaerobe. Okay, fine. Streptococci plus anaerobe. Chin swelling, trismus, respiratory distress, and treatment is external IND beta. Plus minus tracheostomy. है ना बेटा? अगर बिल्कुल सांस नहीं आ रहा तो क्या करना पड़ेगा? ट्रेकियोस्टमी करनी पड़ेगी. ट्रेकियोस्टमी. Now, pre-malignant lesion of oral cavity are leukoplakia, erythroplakia. Don't forget the word oral submucous fibrosis. Oral submucous fibrosis. Please see these visuals from your surgery or dermatology. Beta. Important है ये ल्यूकोप्लेकिया, एरिथ्रोप्लेकिया, ये ईएनटी में नहीं है बेटा, ये सर्जरी या डर्मेटोलॉजी में जहां पे भी दिखता है अपनी पिक्चर दिमाग में छाप लेना बेटा, खास करके ओएसएमएफ की पिक्चर. अगर मुंह में व्हाइट पैच हो बेटा, मैं कोशिश करूंगा आपके ग्रुप में डालने की ओएसएमएफ की पिक्चर. इंपॉर्टेंट है बेटा. फॉडिस स्पॉट सबको पता होना चाहिए बेटा, लिप के ऊपर कभी भी व्हाइट स्पॉट हो बेटा. कोई भी अभी ब्रेक लेंगे, किसी को टाइम लगे ना बेटा, इंटरनेट पे जाके और या कहीं से ढूंढ के ओरल सबम्यूकस फाइब्रोसिस और फॉडिस स्पॉट की पिक्चर लेबल करके डाल देना बेटा, मैं चेक कर लूंगा, ग्रुप में डाल देंगे, है ना. रिवर्स स्मोकिंग इज अ रिस्क फैक्टर फॉर हार्ड पैलेट कैंसर. कभी भी लिप पे व्हाइट स्पॉट हो, वो क्या है बेटा, वो क्या है, लिप पे व्हाइट स्पॉट हो, फॉडिस स्पॉट है, वो क्या है, सेबेशियस ग्लैंड्स है बेटा. सेबेशियस ग्लैंड मिकोजा में नहीं होती, बाय चांस सेबेशियस ग्लैंड फॉर्म इन द मिकोजा, इट्स कॉल्ड द फॉडिस स्पॉट बेटा. ओके. रिवर्स स्मोकिंग इज लीड टू विच कैंसर, हार्ट पैलेट कैंसर बेटा. Most common site of oral cavity cancer is lateral border of tongue. जब भी लिखा ना हो in the world, तो वर्ल्ड पढ़ना है बेटा. अगर इंडिया लिखा होगा तो इंडिया पढ़ना है. पीएसएन के क्वेश्चन में इन इंडिया मान के चलना है बेटा. इन्फेंट मोर्टेलिटी रेट अगर ऐसा पूछा है और अगर नहीं लिखा हुआ तो इंडिया की बात कर, पीएसएन क्वेश्चन. लेकिन इन जनरल कैंसर मोस्ट कॉमन, जब तक इंडिया ना बोला जाए तो इंडिया की बात नहीं करनी, वर्ल्ड स्टैटिस्टिक्स की बात करनी है. मोस्ट कॉमन हेड नेक कैंसर इन इंडिया इज ओरल कैविटी कैंसर बेटा. But most common site of oral cavity cancer, please see, most common site of oral cavity cancer in general is lateral border tongue. But in India, answer is buccal mucosa. Buccal mucosa in the bracket gingivo buccal sulcus. Buccal mucosa in the bracket gingivo buccal sulcus. Gingivo buccal sulcus. Reverse smoking means we discussed in the class also, beta, the burning side in the mouth. Beta. Okay. Now. फाइन एवरीबॉडी. हाँ, ये फॉडिस स्पॉट अच्छा डाला है. यस, नितेश ने जो पिक्चर डाली फॉडिस स्पॉट की, वो बिल्कुल ऐसी ही पिक्चर आती है पेपर. कमांडो ऑपरेशन इज फॉर द ओरल कैविटी कैंसर. यू रिमूव द मैंडिबल आल्सो बेटा. कंबाइंड ओरो मैंडिबुलर सेक्शन विद रिकंस्ट्रक्शन. नहीं बेटा, ये ओएसएमएफ नहीं है. रुक जाओ, मैं खुद डालूंगा. डोंट पुट द पिक्चर, आई विल पुट माय सेल्फ माय पिक्चर. लेट मी वेरीफाई द पिक्चर बेटा. ये ओएसएमएफ नहीं है बेटा. जयेश, वेट, मैं खुद डालूंगा, डोंट वरी. Now, open the third topic, beta. Nose, beta. Yes, everybody open the next topic, nose. Can we start the nose, beta? हाँ, ये जो रितेश ने डाला हुआ है, ये this is for this point. मैं डाल दूंगा, डोंट वरी. वेट, मैं डाल दूंगा. कैन यू स्टार्ट द नोज बेटा? एवरीबॉडी से यस इन द ग्रुप. चलो, एवरी कम देयर नोज बेटा, इकट्ठे स्टार्ट करते हैं. लास्ट में पहले पेपर क्वेश्चन बेटा, द डिजाइन ऑफ एक्सटर्नल नोज बेटा. लास्ट में याद है क्वेश्चन आया था, upper 1/3 bony, lower 2/3 cartilage, है ना. So it is made of 4 paired structure. Number 1 nasal bones, number 2 upper lateral cartilage, number 3 lower lateral alar cartilage, number 4 lesser alar or sesamoid cartilage. Lesser alar, sesamoid cartilage. Lesser alar, sesamoid cartilage. Okay, fine. Now, so basically it's upper 1/3 is bone, lower 2/3 is cartilage. This was the last time NEET, the FMG question also. Very simple question they asked बेटा. हम लोग गलत क्या करते हैं, हम लोग रैशनली नहीं सोचते बेटा. वहां पे अपर हाफ लोगों ने कहा दिया, अपर हाफ बोन, लोअर हाफ कार्टिलेज. ये लगता है हाफ है बेटा, ध्यान सोचो बेटा. ये अपने आप देखो बेटा, लोगों ने क्या लगा दिया, अपर हाफ बोन, लोअर हाफ कार्टिलेज, बेटा हाफ तो नहीं है बेटा, दिस इज अपर 1/3 बोन, लोअर 2/3 कार्टिलेज ना, है ना। थोड़ा रैशनली सोचना है, थिंक बियॉन्ड नोट्स, लेकिन डोंट थिंक बी आउट ऑफ कंटेनर ओनली बेटा। ऐसा नहीं कि बिल्कुल ही ताड़ तोड़ फोड़ देना है, थोड़ा सा कॉमन सेंस से मजे मजे मीडियम लाइन पे सोचेंगे तो गलती नहीं होगी बेटा। हमारे पास क्लिनिकल एक्सपीरियंस नहीं है एफएमजी में, क्या वहां पे पेशेंट देखने को नहीं मिलते हैं ना, तो हम कई बार बहुत न्यूरो सर्जन बन जाएंगे, कार्डियोथोरेसिक सर्जन, रूमेटोलॉजिस्ट, एंड्रोलॉजिस्ट, कुछ ऐसा बन के सोचेंगे, फोड़ू सा एकदम, फिर नंबर भी फिर फोड़ू नहीं आता ना। लेकिन प्रॉब्लम ये है क्योंकि वो ज्यादातर मोस्टली कॉमन चीजें पूछते हैं बेटा, और क्या होता है, कॉमन थिंग्स आर आस्क्ड कॉमनली, रेयर थिंग्स आर रेयरली, वी मेक कॉमन थिंग्स रेयर एंड वी लूज द मार्क्स बेटा, है ना। या ये सब बातें याद नहीं पेपर में बेटा, है ना। ये मेरी कोई अपनी लर्निंग नहीं है बेटा, ये जो लास्ट 24 बैचेस जो गए हैं उन्होंने कुछ तो मुझे सिखाया ही हुआ ना बेटा, कैसे लोग पास करते हैं। क्या ऐसे तो है नहीं कि ऊपर से उतरते हैं, तुम्हारे मेरे बीच से तो लोग होते हैं, हम उनसे सीख सकते हैं बेटा, है ना। दैट्स व्हाट। चलो बेटा, वेरी गुड। चलो अब सबको बताया बेटा, नेजल वाल्व पता है, कॉटल्स टेस्ट पता है। कॉटल्स टेस्ट इज डन टू चेक द ब्लॉकेज ऑफ नेजल वाल्व, ये विजुअल क्वेश्चन है बेटा। Cottel's test is done to check the blockage of nasal valve. If they ever keep 2 fingers on the cheek and lift it upward, the breathing is better. It's nasal valve problem. Cottel's test बेटा बोलना नहीं, Cottel's test बेटा। चलो बेटा आगे, सैडल नोज बेटा जाना है, टर्शरी सिफिलिस नहीं बोलना बेटा, डिप्रेशन। सैडल नोज में क्या बेटा, टर्शरी सिफिलिस में नाक बैठ जाता है, सैडल नोज हो जाता है बेटा, है ना, फाइन। पोटैटो नोज नहीं बोलना, विजुअल क्वेश्चन है, ओमपुरी याद है आपको, हैदराबाद से जो लोग जुड़े हुए हैं उनको पता हुआ, केसीआर का नाक भी ऐसे अपना, रिस्पेक्टेड चीफ मिनिस्टर ऑफ तेलंगाना, हिज नोज आल्सो लेटर खुरदरा इरेगुलर नोज, दैट इज राइनोफाइमेटस नोज। पोटैटो नोज, इट्स हाइपरट्रॉफी ऑफ sebaceous glands of the skin of the nose बेटा, है ना। ये विजुअल क्वेश्चन है बेटा, ओके, कभी भी ऐसा नाक हो, है ना, फाइन, ठीक है ना, फाइन। अब मोस्ट कॉमन malignancy मैंने पहले बताया था क्लास में, if any ulcer is shown on the nose or pinna, this is basal cell carcinoma or rodent ulcer बेटा, basal carcinoma और rodent ulcer, ओके फाइन, पीसीसी। और कभी भी नाक पे ऐसे अल्सर बनाओ, पिन्ना पे अल्सर बनाओ, नोज और पिन्ना, द आंसर इज बेसल सेल कार्सिनोमा। राइनोलिथ स्टोन इन द नोज, कोई क्वेश्चन नहीं आता। फॉरेन बॉडी क्वेश्चन बहुत पॉपुलर है बेटा। 7-year-old चाइल्ड, किसी भी छोटे बच्चे के एक तरफ से स्मेल आ रही है, यूनिलैटरल, याद है क्लास की स्टोरी बेटा, अतुल याद है, अतुल आपको बच्चा याद है, नाक में इरेजर डाल के घूमते रहना, है ना, फाइन। 7-year-old चाइल्ड प्रेजेंटिंग विद, अगर 6 ईयर होगा तो बुरा तो नहीं मान जाओगे, सब लोग बोलो, एवरीबॉडी राइट नाउ बेटा। अगर यही क्वेश्चन अगर 8 साल का बच्चा है तो बुरा तो नहीं मान जाओगे, लिखो बेटा, विल यू माइंड इट। आंसर तो नहीं चेंज करोगे वहां पे कि नहीं सर आपने 6 साल बोला था, अरे बच्चे का एक बर्थडे हो गया तो बच्चा बड़ा हो गया, नोट से 1 साल पहले लिखे थे मान लो, वुड यू चेंज द आंसर बेटा, टेल मी। अगर 8 साल का बच्चा है, अगर 7 साल का बच्चा हो जाए तो वुड यू चेंज योर आंसर। ऐसे ऐसे कुछ तो ऐसे रिजिड थॉट से तो नहीं जा रहे पेपर में, है ना बेटा। I hope you are not going to change the answer for small nitties and gritties of the main मूल भावना पे जाना है बेटा। हमारा our country works on the principle of basic, जो हमारे जो concepts है उस पे चल रहे हैं हम लोग भाई, हमारे पास कुछ भी नहीं है और इसके beyond। हम लोग तो बेसिक जो सेंट्रल थीम पे चल रहे हैं लोगों में से, है ना। तो सेंट्रल थीम ऑफ क्वेश्चन इज मैचिंग लिटिल बिट ऑफ दिस वे दैट वे, कोई एक्स्ट्रा वर्ड एक थोड़ा बहुत दाएं बाएं, नो प्रॉब्लम। हाँ अगर मेल में था और फीमेल आ गया तो फिर तो उल्टा हो जाएगा, फिर नहीं, है ना, फाइन, है ना। इतना भावुक भी होना पेपर में बेटा, वेरी गुड। अगर वेरी गुड, क्योंकि देखो क्या है ना कि देखो हम पेपर, हम याद रहे बेटा, हम पास होने के बहुत पास है बेटा, हम पास होने के बहुत पास है। ये डिस्टेंस धीरे धीरे और कम होता जाएगा बेटा, हम पास होने के बहुत पास है, पास ही है बस। लेकिन हमें कुछ चीजें समझनी पड़ेंगी कि बना बनाया खेल हमारे हाथ से निकल ना जाए बेटा, बस। उसमें बेसिक चीजें कल के टेस्ट में, रीड द क्वेश्चन, रीड द चॉइसेस, थिंक आंसर, डोंट चेंज इट अगेन एंड अगेन ऑल्सो बेटा। सिली मिस्टेक भी नहीं करनी, ओवर थिंक करके आंसर भी चेंज नहीं करना। 6 साल है, 7 साल, 8 साल, कोई बात नहीं भाई, है तो फॉरेन बॉडी का मूल भावना, यह सिद्धांत बिल्कुल सही बोला, मूल भावना से चलना है ना। हम पास होने के बहुत पास है, याद रखना बेटा, हम पास होने के बहुत ही पास है। बस इस कड़ी को और जोड़ते जाएं आपस में, और अब पेपर कैसे करना है उस स्किल को भी ध्यान में रखें बेटा। आपने बहुत अच्छी ओबीजीवाई पढ़ी, बहुत अच्छा सर्जरी पढ़ा, बहुत सा पीएसएम पढ़ा, बहुत सा ईएनटी ऑप्था पढ़ा, लेकिन नंबरों में कन्वर्ट करना भी एक अलग आर्ट है बेटा, उस पर भी ध्यान देते रहने साथ साथ। ट्रीटमेंट इज एंड so basically beta, a young child with unilateral foul smelling nasal discharge is foreign body most. To find now अगर डिस्क बैटरी होगी तो अर्जेंट रिमूवल बेटा, अर्जेंट रिमूवल, because battery release alkali beta, alkali which can cause necrosis, which can cause necrosis. Yes. माइस बेटा, मैगेट्स बेटा, नाक में मैगेट मतलब मक्खियों के बच्चे, लार्वे ऑफ द हाउस फ्लाई, मैगेट ऑयल कंटेन्स क्लोरोफॉर्म बेटा, क्लोरोफॉर्म, मैगेट ऑयल कंटेन्स विच बेटा, क्लोरोफॉर्म बेटा, मैगेट ऑयल कंटेन्स क्लोरोफॉर्म बेटा। नेजल बोन फ्रैक्चर, वेरी कॉमनली फ्रैक्चर्ड बोन ऑफ द फेस, मोस्ट कॉमन फ्रैक्चर ऑफ द फेस इज दिस वन। ट्रॉमा के बाद नेजल डिफॉर्मिटी, तो नेजल बोन फ्रैक्चर सोचना है। ट्रॉमा के बाद बाइलैटरल नेजल ब्लॉकेज आ जाए तो सेप्टल हेमेटोमा सोचना। अभी आगे लिखा हुआ है बेटा, वैसे बता रहा हूं, ट्रॉमा के 2 एमसीक्यू बनते हैं। ट्रॉमा के बाद नेजल डिफॉर्मिटी, नाक की शेप खराब हो गई तो नेजल बोन फ्रैक्चर। ट्रॉमा के बाद बाइलैटरल नेजल ब्लॉकेज लिखा हो तो सेप्टल हेमेटोमा क्वेश्चन, सेप्टल हेमेटोमा क्वेश्चन। ओके फाइन। एक्सरे करवाना है बेटा, पढ़ो बेटा, इन्वेस्टिगेशन एक्सरे नेजल बोन राइट एंड लेफ्ट लैटरल व्यू। नेम ऑफ फोर्सेप इज वॉल्शम फोर्सेप बेटा, वॉल्शम, क्या नाम है बेटा, वॉल्शम फोर्सेप। 2 एमसीक्यू है बेटा। इफ नो स्वेलिंग इज गिवन देन इमीडिएट क्लोज रिडक्शन, if no swelling is given then immediate close reduction beta, and if swelling is already there then wait for 7 days and then do the fracture reduction. Once again beta, after trauma there is deformity or crepitus is there beta. अगर swelling नहीं लिखा हुआ तो immediate close reduction. If swelling is given then wait for 7 days for let the edema subside and then do the fracture reduction, and the name of forceps is Walsham forceps. Walsham forceps. Okay. Nasal septum fracture बेटा, septum fracture 2 तरह का होता है, हॉरिजॉन्टल, अगर फ्रंट से फोर्स आए तो हॉरिजॉन्टल कॉल्ड ज़ारज़ा वे, अगर नीचे से फोर्स आए बिलो से तो वर्टिकल कॉल्ड शाबा वे, एंड द नेम ऑफ फोर्सेप इज एश फोर्सेप। क्या नाम है बेटा, एश, ASCH, नेवल एश, ASCH। ज़ाइगोमेटिक फ्रैक्चर और ट्राइपॉड फ्रैक्चर बेटा, ये 3 पॉड है इसके बेटा, फोन के 1 2 3, तभी ट्राइपॉड बोलते हैं। ये सेकंड कॉमन फ्रैक्चर है। एमसीक्यू बेटा ये आता है, इंफ्रा ऑर्बिटल नर्व इंजरी लीड टू चीक एनेस्थीसिया, हमने क्लास में डिस्कस किया था, चीक में एनेस्थीसिया, यहाँ पे एनेस्थीसिया हो गया ड्यू टू इंजरी टू विच नर्व, इंफ्रा ऑर्बिटल नर्व। इंफ्रा ऑर्बिटल नर्व यहाँ पे 3 फ्रैक्चर है, ज़ाइगोमेटिक 3 चीजें, ज़ाइगोमेटिक फ्रैक्चर, मैक्सिलर फ्रैक्चर और कार्सिनोमा ऑफ द मैक्सिलरी साइनस। ज़ाइगोमेटिक फ्रैक्चर, maxillar fracture and carcinoma of the maxillary sinus में due to injury to which nerve, infraorbital nerve. This is a famous question. So cheek anesthesia due to injury to which nerve, infraorbital nerve, is seen in 3 situations: zygomatic fracture, maxillar fracture, carcinoma of the maxillary sinus. Very good. Okay. Now, most common fracture part of mandible is condyle or subcondylar fracture. ओके, कंडाइल बेटा, कंडाइल लगा, कंडाइल वर्ड होना चाहिए बेटा। मैंडिबल में लोग एंगल लगा देते हैं, एंगल नहीं लगाना, कंडाइल बेटा, है ना। मिड फेस फ्रैक्चर, लीफोर्ड फ्रैक्चर, लीफोर्ड 1, लीफोर्ड 2, लीफोर्ड 3। प्लीज सी द पिक्चर बेटा। लीफोर्ड 1 इज ट्रांसवर्स फ्रैक्चर बेटा, इट पासेस अलोंग, रिवाइज करो बेटा, इट पासेस अलोंग पैलेट, इट लीड टू फ्लोटिंग पैलेट, इट लीड टू एक्किमोसियन पैलेट बेटा, इधर देखो, एक्किमोसियन पैलेट, इधर एक्किमोसियन पैलेट, एंड दैट लीड टू विच साइन बेटा, गिरिन साइन, गिरिन साइन। गिरने से होता है बेटा, गिरने से फ्रैक्चर होता है, गिरने से गिरिन साइन बेटा, गिरिन साइन बेटा, GUERIN बेटा, GUERIN, गिरिन साइन। एंड लीफोर्ड 2 पिरामिडल, लीफोर्ड 3 क्रेनियोफेशियल डिसजंक्शन, एंड दे पास थ्रू स्कल बेस, सो देयर इज अ चांस ऑफ CSF राइनोरिया बेटा। बेटा ध्यान देना, एथमॉइड बोन फ्रैक्चर, ये कौन सी बोन है 2 ऑर्बिट के बीच में, कौन सी बोन है, एथमॉइड बोन। एथमॉइड बोन फ्रैक्चर विल लीड टू CSF थ्रू नोज बेटा, CSF राइनोरिया। लेकिन टेम्पोरल बोन फ्रैक्चर, कान वाली बोन बेटा, टेम्पोरल बोन विल लीड टू CSF लीक थ्रू ईयर बेटा, CSF अटोरिया। 2 वर्ड है बेटा, CSF Rhinorrhea CSF is leakage of CSF from nose due to ethmoid bone fracture. And CSF atoria, कहाँ से CSF आना? Is it clear to everybody? CSF rhinorrhea due to ethmoid bone fracture. CSF atoria, कहाँ से CSF आना? Temporal bone fracture. ये वही temporal bone fracture है ना, पढ़ेंगे बाद में. Okay, and this is called traumatic CSF leak, which is blood mixed CSF. Traumatic CSF leak, which is called blood mixed CSF. बेटा क्या बोलते हैं बेटा? Blood mixed CSF. Okay, ये important है बेटा, पता ये important है ना? चलो. Lateral wall of nose, everybody knows that there are three projection on the lateral wall called turbinate beta. Turbinate, the three turbinate ball beta. Number one, inferior turbinate. Number two, middle turbinate. Number three, superior turbinate. याद है बेटा? ये देखो lateral wall of nose पे क्या था बेटा? तीन turbinate थी. Inferior, middle, superior. Every turbinate has a bone in that called concha. Inferior concha, middle concha, superior concha beta. Inferior concha is independent bone, is MCQ beta. लेकिन middle and superior concha are part of which bone? Ethmoid bone. Now this is called meatus. Inferior meatus, middle meatus, superior meatus beta. Meatus is space below the turbinate beta, meatus. And very, my dear friend, this is very, very important. This is called SER, sphenoethmoidal recess. It is area above the superior turbinate beta. Area above the superior turbinate. Okay, just don't forget that inferior concha is independent bone is the MCQ beta, and don't forget SCR, sphenoethmoidal recess. It is area above the superior turbinate beta. Area above the superior turbinate. So anybody, what is concha? Concha is the bony part of turbinate. Ulta nahi kar de raha. Concha is the bony part of the turbinate beta. Okay, to fine. Okay, choana is the posterior opening of nasal cavity. Naak ke piche ki opening choana. Concha nahi. Choana. Choana is not. Choanal atresia is important. बच्चे का नाक बंद है, congenital disorder. Important question बेटा. Bilateral complete choanal atresia is a neonatal airway emergency. बच्चा जन्म से बिल्कुल मरने लगा. Why? Because neonates are obligatory nasal breathers. Neonates are obligatory nasal breathers. Neonates only know one way of breathing is through nose, obligatory nasal breather beta. Okay, first question beta. Now clinical picture beta. Pediatrician is unable to pass suction catheter from the nose beta because nose is blocked from behind. Pediatrician is unable to pass suction catheter through the nose beta. Okay, pediatrician is unable to pass suction catheter through the nose beta. Okay, baby will be having cyanosis at birth beta. Cyanosis at birth beta. Cyanosis at birth beta. Okay, blue baby turns crying a deep inspiration. Blue baby turns pink on crying beta. Blue baby turns pink on crying beta. Blue baby turns pink on crying and blue baby turns pink on crying, and that is crying means deep inspiration. And so to save the baby, you'll have to keep the mouth open beta. You save the baby, keep the mouth open, and you put a wide bore nipple in child's mouth. This is called McGovern's technique beta. क्या बोलते हैं इसको? McGovern's technique beta. This is called McGovern's technique beta. क्या बोलते हैं? McGovern's technique. क्या बोलते हैं? McGovern's technique. MC. ये क्वेश्चन तो नहीं बोलेंगे किसी को बेटा. तीन क्वेश्चन दिख रहे हैं आपको बेटा यहाँ पे. Blue baby turns pink on crying is choanal atresia question. Put wide bore nipple, McGovern technique is the MCQ beta. And then infant neonates are obligated nasal breather is the MCQ beta. ये तीन क्वेश्चन हो गए. Okay. There are four sinuses we have. Largest sinus is maxillary sinus. It's also called antrum beta. Just the word antrum of Highmore. Antrum of Highmore is the other name of the maxillary sinus. And largest sinus, its volume is 15 milliliter, 15 ml. There are frontal sinus, sphenoid sinus, ethmoid sinus beta. And ethmoid sinus got ethmoid air cell, everybody. Look at your note, beta. Ethmoid is a single bone between the two orbit. Have you drawn that picture over there, beta? Everybody, please see. This is your two orbit, and this is your ethmoid bone, and this is your ethmoid air cell, beta. Ethmoid air cell. And this is your brain, everybody, brain. And this is which plate, beta? Anybody, what is this plate called? Cribriform plate, beta. Kya bolte beta? Cribriform plate. Anybody, what passive cribriform plate is? Olfactory neuron, beta. Can you see, beta? That's the thing. If ethmoid bone is fractured, there is CSF rhinorrhea. CSF rhinorrhea, beta. CSF rhinorrhea, beta. CSF rhinorrhea, beta. Okay, fine. Now, so ethmoid air cell, beta. There are anterior cell, posterior cell. Anterior 2 to 8. Posterior 1 to 8, beta. Posterior 1 to 8. Anterior 2 to 8. Posterior 1 to 8, beta. 2 to 8. Two cells are constant, beta. Guys, tell me, what is the name of two cells? Bulla ethmodalis and agar nezai. Bulla ethmodalis and agar nezai. Bulla ethmodalis and agar nezai. Both are MCQ, beta. B for bulla, B for bada, largest. B for bulla, B for bada, bada, beta. Okay, bada. Biggest, largest ethmoid air cell, beta. Okay. So bulla ethmodalis MCQ, beta. Largest ethmoid. B for bulla, largest. B for bada, beta. Agar nezai. जितने भी हर बैच में जितने बुल्ला बने ना उनको याद आया हुआ. Can you mark your attendance, beta? Or bulla ethmodalis, mark your attendance in the groups, beta. In the WhatsApp group, beta. Everybody in every batch will be one bulla ethmodalis for sure, beta. And one agar nezai will also there, please. Agar nezai, bulla ethmodalis, mark your attendance, beta. Agar, beta. Agar, A-double-G-E-R. Agar मतलब आगे, आगे. Anterior most cell, beta. Anterior most cell, beta. Two definition, beta. Okay, fine. Okay, fine. So guys, bulla ethmodalis and agar nezai are constant cell. Everybody has. How to remember? B for bulla, B for biggest, B for bada. Bada, bada. Largest anterior ethmoid air cell. And A for anterior, A aage. Anterior most cell, beta. Agar nezai. Agar nezai. Agar nezai. Very good. Okay, fine. Very good. Next. In some people, ethmoid air cell can grow in unusual location, beta. तीन अनयूजुअल या तो ऑप्टिक नर्व वाला कहता है ON O नो D ON ऑप्टिक नर्व ON ऑप्टिक नर्व हेलर सेल वाला ऑर्बिटल फ्लोर कॉन्का बुल्लोसा मिल्टरबिनेट guys let's see 5 cell question beta 5 cell question bulla ethmodalis largest ethmoid cell agar nezai anterior most cell of ethmoid ONOD optic nerve, ONOD, ON optic nerve, Heller cell orbital floor, middle turbinate inside concha bullosa, concha bullosa, concha bullosa, concha bullosa. Fine. Now we are 5 minutes away from the break. अगर आपको लग रहा है कि चाय कब मिले पियेंगे 5 मिनट बाद 15 मिनट की ब्रेक होगी बहुत लंबी ब्रेक नहीं करेंगे है ना ठीक है ना ईयर का भी मेन पार्ट देखना है हमने ओके स्ट्रक्चर्स ड्रेनिंग इन नेजल कैविटी मेरे पास दो ऑप्शन बेटा या तो ईयर को 4 घंटे दे देता और बाकी को देता 2 घंटे या फिर 1 घंटा 4 ईयर तो बताइए काफी है ना यहाँ एक तरीका होता है कि आप एक काम करो कि नोज लैरिंक्स फारिंग में 80% क्वेश्चन बनते हैं ना बेटा है ना सो नेज़ोलैक्रिमल डक्ट ड्रेन इनटू द इंफीरियर मीएटस बेटा मैग्जिसाइनस फ्रंटस साइनस इंटीरियर ethmoid air cell drain into middle meatus बेटा okay nasolacrimal duct inferior meatus मैग्जिसाइनस frontus sinus, anterior ethmoid air cell drain into middle meatus, posterior ethmoid air cell drain into the superior meatus, and sphenoid sinus drain into sphenoethmoidal recess. 4 question हो गए बेटा. Nasolacrimal duct drain into inferior meatus, maxillary frontal anterior ethmoid drain into middle meatus, posterior ethmoid drain into superior meatus, and sphenoid sinus drain into sphenoethmoidal recess. This is star question बेटा. देखो बेटा 5 सेल इस पेज पे 10 एमसीक्यू है बेटा 5 सेल एमसीक्यू है अभी देखो ये पेज तो रिवाइज करना ही करना है ना क्लास के बाद फिर से ओके देन वी हैव गॉट द ड्रेनेज पॉइंट बेटा लेट्स रिवाइज वंस मोर नेज़ोलैक्रिमल डक्ट इंफीरियर मीएटस मैक्सिलरी फ्रंटल एंटीरियर ethmoid मिडल मीएटस पोस्टीरियर ethmoid air cell is the superior meatus Dizzy in the middle meatus. Okay. चलो. In the middle meatus. एक बार फिर से रिवाइज करो बेटा बोलो. बुल्ला एथमोडालिस, बुल्ला लार्जेस्ट सेल एथमोइड, एगरनेजाई आगे एंटीरियर मोस्ट सेल बेटा, ओनोडी ओएन ऑप्टिक नर्व, हेलर सेल, हेलर ऑर्बिटल फ्लोर, कॉन्का बुल्लोजा, मिड टर्बिनेट बेटा, सेल इन द मिड टर्बिनेट। इंफीरियर मीएटस क्या ड्रेन करता है? नेजोलैक्रिमल। मिडल मीएटस थ्री साइनस, मैक्सिलरी, फ्रंटल, इंटीरियर एथमोइड। Posterior ethmoidal cell drain to superior meatus, but sphenoid MCQ beta, sphenoid cell drain to sphenoethmoidal recess. Middle meatus is the most important area cells drainage. It has got three landmark: bulla ethmoidalis, uncinate process, and infundibulum beta. Bulla और uncinate के बीच में जगह है, उसको बोलते हैं infundibulum beta. Okay? और ये सारी साइनस कहाँ ड्रेन करती है? infundibulum में. इसको बोलते हैं OMC बेटा. What is OMC? Osteomeatal complex. बोलो बेटा OMC. What is OMC full form बेटा? Osteomeatal complex. OMC. What is OMC? Osteomeatal complex बेटा. OMC osteomeatal complex बेटा. ओके फाइन। अगर OMC ब्लॉक हो जाए तो क्या होगा बेटा? साइनस ड्रेनेज ब्लॉक हो गया तो क्या होगा? साइनोसाइटिस। और अगर 3 मंथ से ज्यादा हो तो क्रॉनिक राइनोसाइनोसाइटिस। नाउ हमने किया था नाक में चीफ कंप्लेंट ऑफ साइनोसाइटिस नेजल ब्लॉकेज, डिस्चार्ज, ड्रिप, सेंस ऑफ स्मेल कम हो जाता था। लेकिन हमने किया था 4 पेन करी थी बेटा। देखो नोट्स बेटा 1 2 3 4 पेन बेटा। ऑफिस हेडेक और पीरियोडिक हेडेक इज अ फीचर ऑफ फ्रंटल साइनोसाइटिस। नाउ यू टेल मी एवरीबॉडी, लुक एट नोट्स एंड टेल मी, पेन एट वर्टेक्स और ऑक्सीपुट इज अ फीचर ऑफ। मैं वेट कर रहा हूं बेटा। पेन एट वर्टेक्स और ऑक्सीपुट इज अ फीचर ऑफ। पेन एट वर्टेक्स और ऑक्सीपुट इज अ फीचर ऑफ। आई एम वेटिंग बेटा। Is a feature of sphenoid sinusitis. Very good, beta. Sphenoid sinusitis, beta. Very good. Pain at cheek is a feature of maxillary sinusitis. And pain at medial canthus or bridge of nose, beta. Bridge of nose is a feature of ethmoid sinusitis. Okay, fine. एक बार फिर से रिवाइज करते हैं। Office headache or periodic headache is a feature of frontal sinusitis. Vertex or occiput pain, vertex is the top of the skull, vertex or occiput pain is the sphenoid sinusitis beta. And pain at the cheek, maxillary sinusitis beta. And pain at the medial canthus or bridge of the nose, between the two orbit, which bone is it? Ethmoid sinusitis. Ethmoid sinusitis beta. Ethmoid sinusitis. Ethmoid sinusitis. Let's take a break here beta. Break is a 15-minute break. And we start at 12:55. ओके तो फाइन, चलो ब्रेक लेते हैं बेटा। अगर आपको कोई क्वेश्चन है तो आप उसमें डाल सकते हो, तो ग्रुप में डाल दो तब तक। Am I audible, visible? Can you please confirm? वीडियो चल नहीं, आप देखो। Am I audible, visible? Please confirm. Now yes, okay, yeah. Okay, perfect. Chalo, I think now everybody's there. Now we can go further. Chalo. This is the everybody there on the WhatsApp. This is a link of Telegram and Instagram. The idea is let us be connected in one or the other format till 30th July and after that also, hopefully. Okay, audible, visible. ये भाई लिंक है, QR कोड है इंस्टा का, टेलीग्राम का। आइडिया कि आने टाइम में अब ये जो महीना अपने 6 हफ्ते हैं, इसमें कुछ हर हफ्ते में लेट्स बी कनेक्टेड। मैं बोला आई कीप डूइंग थिंग्स कि मतलब ये अभी 45 डेज रह गए, 1 मंथ बिफोर एग्जाम, लेट्स बी कनेक्टेड ऑन वन और अदर थिंग्स सो दैट वी आर इन्फॉर्म कि क्या चल रहा है ना, कैसे उसको कोप अप करना। चलो अब शुरू करते हैं बेटा, है ना? चलो वेरी गुड। चलो लेट्स गेट बैक टू द जो हम बात कर रहे थे नोज के बारे में, इन्वेस्टिगेशन। इन्वेस्टिगेशन is the endoscopy is the best investigation. I hope you remember with the three passes of endoscope, you pass endoscope at three places. First pass is along inferior turbinate. Second pass above middle turbinate. Third pass inside middle meatus. Third pass inside middle meatus. First pass, second pass, third pass. First pass, second pass, third pass. Okay. Now, best X-ray view for sinuses is Waters view. It shows all sinuses except posterior point. It shows all sinuses except posterior ethmoid. Okay, fine. Now, everybody, there are a couple of things you remember better. This is the most popular radiology question you get in ENT. The name of the view is Waters view. It is the best view for sinuses. It shows all sinuses except posterior ethmoid. It shows maxillary sinus most clearly. Very famous question. What is the name of the sinus below the orbit? Maxillary sinus. It can be done with open mouth. This is the open mouth. This is the open mouth. It can be done with open mouth to include which sinus? Sphenoid sinus in the X-ray. This is sphenoid sinus in X-ray. Now, when done with open mouth, some books also call it plss view. plss view. But in the MCQ, if maxillary sinus is clearly visible, please mark it water view or PRA view, depending on the choices given, whether the mouth is open or closed. बेटा ध्यान देना बेटा, काफी लोग बोलते हैं अगर माउथ बंद है तो वो वाटर व्यू नहीं हो सकता. No, don't look at the mouth open or closed. बेटा look at the whether the you can say the sinus maxillary is clearly visible or not. If maxillary is clearly visible, then the answer is Waters view. बेटा water view with open mouth is called PRA view. All of you scan the choices first. If PRA view is not in the choice, दिमाग से निकाल दो PRA view. बेटा PRA view सिर्फ एक ही बार, only one time PRA view has been asked in NEETPG paper. That's all about it. People get so confused about this thing, they lose the main marks also. So look at the choices. If PRA view is not there, it's water view only यार. भूल जाओ ना PRA view को. PRA view, water view are synonymous of each other. हाँ, अगर open mouth है और water view, PRA view both in the choices है, तो PRA view is the better answer. बेटा water view with open mouth is PRA's view. बेटा once again, the most important view for the sinus is the Waters view. Beta is the Waters view. One second. Yeah. Once again, let's revise. Beta most important view for sinus is water view. Water view shows all sinus except posterior ethmoid. Water view shows which sinus most clearly. The answer is the maxillary sinus. Water view can be done with open mouth to include sphenoid sinus X-ray. If water view is done with open mouth, it's also called as PRS view. But water view can be done without open mouth also. If in any X-ray MCQ, the PRS view in the choice. Can be done without open mouth also. If in any X-ray MCQ, the maxillary is clearly visible, the answer is water view beta or PRA view if PRA view in the choice. Look at the choice. If PRA view is not in the answer, then answer is water view only. Beta. Okay, fine. Now. Is everything going okay? Yes, please confirm. Can someone confirm? Are you able to see me? Is the audio video okay? Please confirm better. Okay, clear now? Okay. Okay. Now, next one, beta. Next, let's go further. CT scan is the best radiological investigation for sinus. CT scan is the best radiological investigation for sinus. CT scan matlab 1 CT is equal to 100 X-ray beta. So CT scan will be the best radiological investigation for sinus. I want to show you one CT scan. घबराना नहीं है. CT X-ray look similar sinus beta. कोई ऐसा different नहीं होता. This is the CT scan. This is the orbit, and this is the maxillary sinus. Between the two orbit, this is the ethmoid sinus. This is the ethmoid sinus. Okay, fine. Am I clear? No. Thank you for making my day. CT scan. Somebody a message. I don't know about handsome or not, but I didn't take a shower since morning. But I thought I'll finish the class and then I'll take it. CT scan. That's the liberty of taking the class from home. I'm in Delhi right now, and I was planning to travel to some other place, but I stayed back so that I finished some work. And CT scan. Now complication beta. Orbital infection is most commonly seen with ethmoid sinusitis. Orbital infection is most commonly seen with ethmoid sinusitis. Mucocele matlab large sinus beta. Expansion of the sinus due to mucus collection, and most commonly it's seen in frontal sinus beta. Mucocele are most common in frontal sinus beta. Frontal sinus. Mucocele are most common in frontal sinus beta. Okay, fine. Now, osteomyelitis frontal bone is called Pott's puffy tumor. Nobody should forget this word. Pott's puffy tumor is not a tumor. It is subperiosteal frontal abscess. 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 Okay, fine. Now, that's important point. Let's revise beta. The eye infection, orbital infection, is most commonly seen with the ethmoid sinusitis. Mucocele, the large expansion of sinus, is most commonly seen in frontal sinus. But the most important question is this swelling beta, painful red forehead swelling due to sinusitis. This is Pott's puffy tumor. It is subperiosteal frontal abscess. Subperiosteal frontal abscess. Okay, now. Development of sinus beta. I hope you remember the sequence is MESF beta. Maxillary, ethmoid, sphenoid, frontal. Now, 4 question beta. First sinus to appear in human is maxillary. Last sinus to appear in human is frontal beta. Okay. The 2 sinuses there at birth are maxillary, ethmoid are there at birth. Ethmoid is most developed sinus at birth. Sphenoid appear at 4 years. And frontal at 6 years. Sphenoid 4. Frontal 6. I told you in the class also, A, B, C, D, E, F. Frontal is the last, F is the 6th alphabet beta. Sphenoid usse pehle aayega, M, E, S, F. Sphenoid at 4 year, frontal, F, 6th alphabet beta. Frontal at 6 years. Most common benign tumor sinus is osteoma, and osteomas are most common in frontal sinus. Most common fungus to cause sinusitis is Aspergillus fumigatus. And most common side of aspergilloma or fungal ball. Beta. Ek hi baat hai. Aspergilloma is called fungal ball, is the maxillary sinus. Okay, maxillary sinus. Okay, fine. Fine, maxillary sinus. Guys, look at me, everybody. Revise beta. Malignancy is most common in maxillary. Aspergilloma or fungal ball is most common in maxillary. Osteoma is most common in frontal. And mucocele is most common in frontal. 4th thing to revise, mucoceles and osteoma are most common in frontal sinus. Malignancy and aspergilloma or fungal balls are most common in maxillary sinus. Okay, fine. Now, polyp, edematous mucosa, and basically polyp looks like pale grayish soft mass, beta. Pale grayish soft mass, na? Pale grayish soft mass like that, which does not bleed to touch. Like lychee, you know, remember lychee की तरह जो lychee की तरह लगे वो polyp बेटा. Lychee याद है बेटा? अंगूर, lychee या अंगूर की तरह जो दिखे, soft हो, bleed ना करे, soft है, smooth surface भी है बेटा, है ना? Two polyp are there बेटा. Enteroconal polyp और Killian's polyp बेटा. Killian's polyp. Enter मतलब maxillosinus. It rises from maxillosinus and grows towards choana. What is choana? Posterior opening nasal cavity बेटा. It's more common in children and due to infection, and it is single and unilateral beta. The ethmoidal polyp is reverse beta. That is in adult due to allergy, multiple, bilateral. Most of the polyp are these polyp beta. Ethmoidal polyp are more common beta. Right now, beta. Ethmoidal polyp, right now, more common. They are the more common type of polyp. Whenever the MCQ use the word nasal polyp, it is ethmoidal polyp. Ethmoidal polyp are the nasal polyp. Ethmoidal polyp is the nasal polyp. Okay, more common. So they are more common adult. They do allergy, multiple, bilateral beta. And treatment of choice is topical corticosteroid nasal spray. Topical corticosteroid nasal spray beta. Okay. Why steroids suppress the allergic inflammation also, fluticasone. Okay, fine. Everybody, let's revise beta. Enteroconal polyp or Killian polyp is less common. Ethmoidal polyp or allergic polyp is more common beta. Enteroconal polyp is more common in children. It is single, unilateral due to infection. Ethmoidal polyp are due to allergy, more common in adult. They're multiple, bilateral beta. But the question comes is Samtus triad beta. Let's write Samtus triad. It's a triad of allergy beta. There is nasal polyp. There is nasal polyp. Number two, asthma. And asthma is intrinsic asthma. And there is allergy to NSAID, particularly aspirin. And there is nasal polyp. This is a star question. Asthma, remember asthma is intrinsic asthma, not extrinsic asthma. Beta. Okay, beta, fine. Everybody, fine. Okay. Next one, beta. Next one. Next one is Samtus triad. Let's see. Samtus triad is the nasal polyp, and it is the allergic triad actually. There are three things. There is asthma, which is intrinsic asthma. There is allergy to aspirin or other NSAIDs, and there is nasal polyp, which is ethmoidal allergic polyp. This should not be forgotten. Now, sinus cancer. Sinus cancer. 1 second. Now, let us do the sinus malignancy. Sinus malignancy. Sinus malignancy. Most common sinus involved is maxillosinus. Risk factor is nickel exposure lead to squamous cell carcinoma of the maxillary sinus, and Carpenter wood dust exposure lead to adenocarcinoma of ethmoid, and that's why it's called woodworker carcinoma. Woodworker carcinoma. Woodworker carcinoma. Once again, beta, sinus cancer are common in maxillary sinus, second common in ethmoid. Risk factor is not cigarette, alcohol. That's why MCQ is possible. Nickel exposure lead to squamous cell carcinoma of the maxillary sinus. In Carpenter, wood dust exposure lead to adenocarcinoma of ethmoid. Therefore, adenocarcinoma of ethmoid is also called as woodworker's carcinoma. Beta. Ongral line is a star question. Beta. It is from medial canthus to the angle of mandible. It is for prognosis, beta, not for surgery. It's for the prognosis assessment of the patient of carcinoma maxillary sinus. Any cancer above this line will have poor prognosis due to early orbital involvement. Once again, what is the name of line? Ongral line. Ongral line is from medial canthus to the angle of mandible. It is not for surgery, it's for prognosis. It is used for the cancer of maxillary sinus. Any cancer above this line will have poor prognosis due to early orbital involvement. Ringett's tumor is a star question. Ringett's tumor is Pott's puffy tumor is subperiosteal frontal abscess. Ringett's tumor is inverted papilloma of the nose. It's really a tumor. It's a benign but locally invasive tumor. It's a benign tumor, papilloma. It's a benign tumor, beta. It's not a cancer. It's a benign but locally invasive tumor. It is mostly rising from lateral wall of the nose. It's growing inward, beta. Therefore called inverted. Why it's called inverted? Because it grows inward, therefore inverted. Therefore, it's a locally invasive tumor, beta. And how does it present, beta? Please see. It presents as reddish, firm, smooth surface mass. Polyp was like lychee, beta. Polyp was like lychee. You know, pale, grayish, smooth surface mass. It is firm, beta, not soft. Firm, reddish, smooth surface, pinkish red, reddish, smooth surface mass, beta. Smooth surface mass. Okay, fine. Mucormycosis, very important question, beta. It is seen in HIV positive patient, immunosuppressive patient, young uncontrolled diabetic patient, patient who are COVID-19 positive, or patient who are using a lot of steroids actually. So 5 patients get it. Immunosuppressed patient, HIV positive patient, COVID-19 positive, or patient who are on the high steroid usage. And they are the cases which will be actually seen with mucormycosis. Orbit and brain, beta. The important thing is it causes ischemic necrosis. It causes ischemic necrosis. Therefore, it reaches the orbit and therefore it causes the blackish appearance, beta. Ischemic causes blackish appearance, beta. Blackish. But black color come after few days, beta. Look at the clinical feature. Early symptoms are red in color, beta. Early are red. Late are black, beta. Look at the note, beta. Late are black. Red matlab redness over the cheek congestion, cheek pain, then loose upper teeth, beta. Eye disturbance, eye swelling, any diplopia, disturbance of visual disturbance, blurring of vision. So those are early symptoms, beta. I repeat, early symptoms are not black in color. Reddish cheek congestion, redness over cheek pain, cheek numbness, eye swelling, the diplopia, blurring of vision, and then loose upper teeth, beta, because upper teeth are part of maxilla. This is full of fungus, beta. And late color are black, blackish nasal mass, and blackish discoloration around the eye, beta. Okay, and the best investigation is MRI with contrast. Please see your note, beta. MRI with contrast shows black turbinate sign, beta. Please see on the note, beta. What is the name of sign? Black turbinate sign, beta. And drug of choice is amphotericin B, beta. Liposomal variety, amphotericin B. What is the drug of choice? Amphotericin B, liposomal variant. Liposomal amphotericin B or amphotericin B is the drug of choice, plus debridement also. Vasomotor rhinitis, VMR. It is basically due to change of temperature. There is parasympathetic overactivity, and the only question is VMR needs vedianectomy. Vedian nerve. Let us cut that nerve, autonomic nerve, beta. Vedian nerve is also called nerve of pterygoid canal. That's the anatomy question, beta. Vedian nerve. Vedian nerve gives autonomic nerve supply to nose, beta. Basically, this is autonomic imbalance in the nose. Let us cut. How to remember the beta, Vedian nerve, beta. So Vedian nerve, vedianectomy is done for which disease? Vasomotor rhinitis, and Vedian nerve is also called nerve of pterygoid canal. This can be standalone anatomy question also, beta. Okay. So I hope everybody remembers. It is due to overuse. It is due to overuse of a prolonged use of topical decongestant drops like xylometazoline, oxymetazoline, and treatment is stop these drops and start steroid spray. So basically, it's a pharma question. They give you history. The patient has been using oxymetazoline or xylometazoline nasal drop for last 2 months. Now he has got persistent nasal blockage. What is the name of entity? Rhinitis medicamentosa. Medicamentosa matlab due to some medicine side effect. Smell. Okay. Olfactory neuron pass through which plate, beta? MCQ. Olfactory neuron pass through which plate? Cribriform plate, beta. Olfactory neuron pass through cribriform which plate, beta? Cribriform plate, beta. Let's wait for our lagging. Let's wait. Let me see. Why it is lagging? My end actually I'm checking the internet speed is very high actually right now here. 1 second. Just check it is right now it's correct. Yeah, I think it's correct now. Now it's correct now. Ritesh, check it now. Siddhant, check it. Now check it. Now okay. नितेश मैं इंडिया में था भाई. नितेश शर्मा मैं इंडिया में था यार. मैं तो बहुत महीनों से इंडिया में हूँ. चलो, can we start now? Olfactory neuron pass through which plate? Cribriform plate, and cribriform plate is a part of which bone? Ethmoid bone. Ethmoid bone. Okay, fine. Chalo. Guys, I hope anosmia, loss of sense of smell, and hyposmia is decreased sense of smell. Okay. Anosmia, hyposmia causes, don't forget COVID-19, that's important. COVID-19, everybody knows COVID-19 causes a lot of smell problem. Okay. And let us not forget Kalman syndrome. It's anosmia with hypogonadism or infertility. Infertility. Guys, this is a star question possible. Please read it from OBGY also. Kalman syndrome is an important question. It is a trending question in NEETPG in OBGY. Anosmia with hypogonadism or infertility is Kalman syndrome. A patient of anosmia can still sense ammonia. Ammonia is not a smell. Ammonia is not a smell. It is an irritant. It is sensed through trigeminal nerve. That's through trigeminal. Oh, yes. Satyansh, yes. Your online batch I took from there. Thank you for reminding me. Yes. Yes, one online batch I took from there actually, I remember. Trigeminal nerve. So guys, let's try a smell question. Cribriform plate is a place from where olfactory neuron pass through and go to the brain. And it's a part of ethmoid bone. So ethmoid bone fracture can lead to CSF rhinorrhea. COVID-19 and anosmia combination should be remembered. COVID-19 cause both anosmia also, hyposmia also. Kalman syndrome is anosmia with hypogonadism or infertility. So question can be like that: infertility issue with the smell problem also, it's Kalman syndrome. Anosmia patient can still sense ammonia because ammonia is not a smell, it's an irritant, it's sensed through trigeminal. Now, nasal septum. Next septum, please revise this anatomy. Nothing to really say. This is mostly this thing. Just can we revise this picture? This is important. Okay. आजकल ऐसे question आ रहे हैं. Picture. The three major parts are: number one, septal cartilage or quadrangular cartilage; number two, perpendicular plate of ethmoid; and number three, vomer. Repeat with me: number one, septal or quadrangular cartilage; from above, perpendicular plate of ethmoid; number three, vomer. So these are three parts: septal cartilage or quadrangular cartilage from the interior part; from above comes the perpendicular plate of ethmoid; and from back comes the vomer. Okay, now. There's Kashish, there's a given wrong over there. Okay. Now, DNS, DNS, what point to remember, DNS can lead to compensatory ITH, What is ITH? Inferior terminal hypertrophy. ITH gives which appearance, Mulberry appearance of nasal mucosa. Mulberry has two questions, Guys, now let's be clear. Mulberry appearance of nasal mucosa is a feature of inferior turbinate hypertrophy. Mulberry-like nasal mass is rhinosporidiosis. Once again, Mulberry-like nasal mucosa or Mulberry appearance of nasal mucosa, no extra mass formation. It's a feature of inferior turbinate hypertrophy. But Mulberry-like mass in the nose is a rhinosporidiosis question. Headache is called Schluder neuralgia. Schluder's neuralgia. Schluder neuralgia is due to contact between DNS and middle turbinate. Why headache happen? The DNS can start touching the middle turbinate, and that touch will lead to the pain. So DNS touching the middle turbinate lead to headache, and that headache called Schluder neuralgia. Now, MCQ most common keyword long-term complication. Long-term is a synecdoche formation. What is synecdoche? Chipak jana, adhesion formation. What is Seneca? Adhesion formation. Can you see Seneca formation here, beta? And which drug is used to prevent it? Answer is mitomycin C, beta. Both question of NEETPG, beta. Both are NEETPG question. What is the most common long-term complication of surgery of the nose is Seneca formation, chipak jana adhesion formation, and which drug can be used to prevent it is the mitomycin C, beta. Mitomycin C, beta. Okay, fine. Next one. Septal hematoma. I told you trauma happened and there is bilateral nasal blockage. After trauma, 2 questions to the nose. Nasal deformity, crepitus after trauma is nasal bone fracture question. Bilateral nasal blockage. But can you see bilateral nasal blockage? And due to trauma is septal hematoma question. Please, there is a history of fall given followed by bilateral nasal blockage. Think of septal hematoma and treatment is I and D, beta. Incident drainage or aspiration will be there. Aspiration. Otherwise, it can lead to septal abscess, septal perforation. Beta. Okay. So I repeat, after trauma of the nose, there is nasal deformity. Think of nasal bone fracture. After trauma of the nose, think of bilateral nasal blockage is there. Think of septal hematoma question. Beta. Septal perforation. One thing to remember is tertiary syphilis cause perforation of bony part. Tertiary syphilis cause perforation bony part, and it also causes saddle nose. Matlab, tertiary syphilis can give 2 questions in the nose. Tertiary syphilis can cause perforation of bony part. The main thing is bony part. And the number 2 is the saddle nose. Saddle nose. Atrophic rhinitis. Ozina. Whenever you see the word atrophic rhinitis, think of ozina. The turbinate get atrophied. It is more common in females. Which bacteria is culprit? Klebsiella ozinae. Okay. Atrophy. So basically there are roomy nasal cavities because turbinate are shrunken and there are crust. Main thing is crust formation. And crust lead to nasal blockage and bad smell from patient. But patient has a anosmia. This is called, very famous question, merciful anosmia. Merciful anosmia is a feature of atrophic rhinitis. Merciful anosmia, thank God anosmia is a feature of atrophic rhinitis. Don't forget Klebsiella ozinae. Ozina word is linked to atrophic rhinitis. It's a female patient, Okay. Now, the treatment, alkaline nasal douching with powder. And the powder contains 3 things, sodium bicarbonate, sodium biborate, and sodium chloride. Revise with me. What are 3 components of alkaline nasal douching powder? Sodium bicarbonate, sodium biborate, and sodium chloride. What are 3 surgeries we do? Young's operation. Main thing is modified Young's operation. It is the permanent partial closure of both nostrils. Look at me, the anterior opening of the nose. Either, अगर आपने यहाँ पे half stitch लगा दिया, and you make the anterior opening of the nose half, it is called the modified Young's operation. It is the permanent partial closure of both nostrils. This is the MCQ. When a modified Young operation is done for which disease, beta? Is done for atrophic rhinitis. Modified Young operation is done for which disease, beta? Okay, modified Young operation is done for which disease, beta? The atrophic rhinitis, and this is permanent partial closure of the both nostrils. Permanent partial closure of the both nostrils. Permanent partial closure of the both nostrils, beta. Okay, now so let us revise. Atrophic rhinitis as ozina is involved. Beta. It's more common in females. Then it is actually the Klebsiella ozinae to be kept in mind. Wide roomy nasal cavity, but crust formation is there. The crust causes bad smell from the patient, but patient cannot smell anything. Anosmia is there. It's called merciful anosmia, and the patient will be having the requirement of washing the nose every now and then, and you need alkaline nasal douching powder for that, and that powder contains sodium bicarbonate, sodium biborate, and sodium chloride. Sodium bicarbonate, sodium biborate, and sodium chloride. Sodium bicarbonate, sodium biborate, and sodium chloride. And 3 surgery beta, Young's operation, modified Young operation, and Luton-Slager operation beta. Modified Young is the permanent partial closure of the both nostrils beta. Permanent partial closure of the both nostrils beta. One second, I'm doing it. I'm doing it. Wait. Yeah. Now, rhinostoma or woody nose. Rhinostoma or woody nose. So basically, rhinostoma, the hard, woody nose. The name of bacteria is Klebsiella rhinoscleromatis, also called fish bacillus. That was Klebsiella ozine. This is Klebsiella rhinoscleromatis or fish bacillus. This patient comes from Uttar Pradesh, Rajasthan. And question bada clear ho jayega. Uttar Pradesh patient with nose problem is rhinostoma. It has got 3 stages beta. The first stage is atrophic stage. Atrophic stage beta. Second is granulomatous stage, and that is hard external nose, and this is called woody nose. Matlab, initial features are similar to atrophic rhinitis. Okay, and third stage of fibrosis. Biopsy shows Miculous cell and Russell bodies. Biopsy shows Russell bodies and Miculous cell. Russell bodies and Miculous cell. Drug of choice is tetracycline plus streptomycin. Tetracycline plus streptomycin. Let's revise beta. Rhinostoma, woody nose. Rhinophyma was potato nose beta. Rhinostoma, woody nose is caused by Klebsiella rhinoscleromatis, more common in Uttar Pradesh, Rajasthan, north of India. 3 stages. The first stage is like atrophic rhinitis. Second stage lead to hard external nose called woody nose, and the third is fibrosis. The biopsy shows, biopsy shows Russell bodies. I told you beta, equation number 2 of ENT. Remember? Equation number 2 of ENT. Atrophic rhinitis MCQ plus a hard external nose is equal to rhinostoma or woody nose. I hope you remember the 2 equation of ENT beta. Quinsy like MCQ plus outer neck swelling close to angle of mandible is parapharyngeal abscess. Atrophic rhinitis MCQ, crusting in the nose, bad smell from the nose, plus hard external nose equal to rhinostoma. Now, very likely question this time, rhinosporidiosis beta. It is just as INICET also beta. Rhinosporidiosis is basically South India patient beta, Tamil Nadu patient, and there's a history of bathing in the ponds or swimming in the pond, and this is caused by Rhinosporidium seabrai, and this is an aquatic protozoa found in the pond being used by cows, buffaloes also beta. The same pond is being used by your cows, buffalo. जहाँ पे तुम्हारी गायें भैंसें नहा रही हैं, वहाँ पे तुम भी नहा रहे हो मिलके, then you get this infection. It's more common in southern part of the country, Tamil Nadu particularly, the coastal parts of Tamil Nadu, and mostly it involves the nose, but the lesion can form the oral cavity, conjunctiva, genital mucosa, because water will touch your mucosa everywhere. Okay, but nose is a very important thing. This is mulberry-like or strawberry-like nasal mass with epistaxis. What is mulberry-like or strawberry-like nasal mass? The mass is reddish, firm, but it has got irregular surface. Try to recall, beta. Inverted papilloma of the nose was firm, reddish, but smooth surface mass. Beta. Tumor, inverted papilloma was smooth surface mass. Beta. This is firm, reddish, and mass with irregular studded surface. Okay, fine. Irregular studded surface. Beta. Now, again, 2 question of mulberry. Beta. Mulberry-like nasal mucosa, inferior turbinate hypertrophy. Mulberry-like nasal mass, rhinosporidiosis. Treatment is surgery followed by Dapsone. Dapsone. Don't make it rhinosporidiosis. Rhinosporidiosis D for Dapsone. Rhinosporidiosis D for Dapsone. Dapsone. But in rhinostoma, it was tetracycline and streptomycin. Don't confuse beta. Tetracycline and streptomycin were used for rhinostoma. Rhinosporidiosis में D आता है, D for Dapsone beta. Dapsone is used for rhinosporidiosis beta. Now CSF leak beta. Most common site of leak is cribriform plate, again ethmoid bone fracture. Cribriform plate. Surgery, traumatic trauma. Traumatic CSF lead to target sign, halo sign, also called double halo sign. कुछ भी बोलते हैं बेटा. Target sign, halo sign is a feature of traumatic CSF leak बेटा. T for trauma, T for okay, fine. Okay, fine. So traumatic CSF leak lead to target sign or halo sign or double halo sign on filter paper बेटा. Filter paper. How differentiate CSF from nasal discharge? Most confident test is beta 2 transferrin estimation. Beta 2 transferrin estimation. Okay. Okay. CSF is like water. You cannot sniff back CSF. But most confirmatory test is beta 2 transferrin estimation. How to find the site of leak? Endoscopy. And before endoscopy, you inject which dye? Fluorescent dye. And this gives green color to CSF. Which color? Green color to CSF. Number 2, CT cysternography beta. CT cysternography. Okay, cysternography. Okay. Number 3, MRI T2 beta. MRI T2. CT cysternography is important word beta. Radiology ke liye. Look at the name. It is invasive radiological investigation in which a contrast is injected into CSF through lumbar puncture, followed by CT of the head. It's a CT only. It's a contrast CT only. But only thing is, we don't put the contrast the blood. We put contrast the CSF via lumbar puncture beta. But best radiological investigation is HRCT skull base. HR is high resolution beta. HR is high resolution. But treatment, MCQ treatment. Don't do immediate surgery. Wait for 7-10 days. Why? It's a fracture, and fracture might heal on its own, and you don't need to do the surgery in that case. Or you give antibiotic to prevent meningitis. Okay. So CSF anuria, please don't forget the target sign or halo sign is a feature of traumatic CSF leak seen on filter paper. Most confirmed test is beta 2 transferrin. Test to find the site of leak, endoscopy with fluorescent dye, MRI T2 images, CT cysternography, but the best radiological investigation is HRCT skull base. Treatment is not urgent surgery, treatment is conservative treatment. Now, blood supply of the nose, two system, 80% supply up to middle terminate comes from the external carotid artery through 3 branches. The 3 branches are number 1, sphenopalatine, greater palatine, and superior labial. Sphenopalatine, greater palatine, superior labial. Sphenopalatine, greater palatine, superior labial. Okay. Above the middle terminate, the blood supply comes from internal carotid artery, ICA, okay, and through 2 artery branches, anterior ethmoidal artery and posterior ethmoidal artery. Do you see, beta? You see, this is external carotid artery. 80% supply come from here, 20% come from here. Very simple, beta. Up to middle terminate is EC area. Above middle terminate, brain side is IC area. From brain, 2 artery, ethmoidal artery, anterior, posterior. And from ECA, 3 artery, beta. Superior labial, greater palatine, sphenopalatine. 3 arteries, 2 arteries, beta. Mostly bleeding occur from sphenopalatine arteries. The artery of epistaxis is sphenopalatine artery. Beta. The little area is the most common area on the septum to bleed. Beta. And this contains which plexus? Kieselbach plexus. Very famous question. Kieselbach plexus is made by 4 arteries. Which artery is not a part of plexus? Posterior ethmoidal artery. Beta. Posterior ethmoidal artery is not a part of Kieselbach plexus. Kieselbach plexus is made by greater palatine, sphenopalatine, superior labial, and anterior ethmoidal artery. Okay, fine. Now, don't forget the hypertension causes posterior epistaxis. Posterior bleeding. Okay, which disease causes posterior bleed? Hypertension. Most common cause, don't forget, fingernail trauma or habit of nose picking. Okay, fine. Which agent is used to control bleeding? Silver nitrate. Cauterization with which agent? Silver nitrate. And MCQ is, if packing failed to control the bleeding, then what is the next management? ESPAL. What is ESPAL? If anterior, posterior, you try to control the bleeding with anterior packing, posterior packing, all packing failed. What is the next management? A very expected question of NEETPG, beta. The endoscopic sphenopalatine artery ligation. Like anybody, what is the artery of epistaxis? Sphenopalatine artery, beta. That's why we ligate. The first artery is the sphenopalatine artery. Endoscopic sphenopalatine artery ligation, beta. And if ECA ligation also fails, then we do ethmoidal artery ligation. I hope you remember that ethmoidal artery is not a part of ECA, beta. Ethmoidal artery is a part of IC, ethmoidal artery ligation. Ethmoidal artery ligation. Ethmoidal artery ligation. Everybody, any question up to larynx, narynx, suppose. Anyone, any doubt, beta? Up till larynx, nose, and pharynx. Can we go to the ear, beta? Everybody, can we go to ear? Any doubts anyone has? Both batches, both groups? Can we start the ear, beta? Let's wait for everyone to reach over there. I think we. Okay, sure. Sure. Let's do the main point of ear, beta. Ear I know is vast, beta. Let's see what we can, what should revise in this one. First of all, everybody open up pinna. Pinna develop from first and second arch, beta. The tragus from first arch, the rest of pinna from second arch, beta. And don't forget the word incisura terminalis. It's a junction of first arch and second arch. Okay, it's a junction of first arch and second arch. There's no cartilage. How many hillocks of these we have? 6, beta. For first 6 elevation form and then they fuse to form pinna. How many hillocks have? 6. And pinna developed by which week? 20th week, beta. 20th week, beta. Okay. And if the fusion is not complete, what's the name of the disease? If you see a hole in front of pinna, what's the name of the disease? Pre-auricular sinus. It is due to incomplete fusion of first and second arch. If it is not symptomatic, no treatment. If it is infected, then you do the excision, beta. Anotia is absence of pinna. Microtia is small pinna. Guys, what is bad ear, beta? Bad ear is absence of antihelix. There are two curvature, helix and antihelix. If antihelix is not there, it's called bad ear. What is bad ear? Absence of antihelix, beta. Absence of antihelix, beta. Okay, fine. Now, the surgery is done at 6 years of age or more than 6 years of age. Let pinna grow fully, beta. MCQ, that tympanic membrane develop from all 3 layers: ectoderm, endoderm, mesoderm. This is the important question of embryology, beta. Tympanic membrane develop from ectoderm, endoderm, mesoderm. Guys, this is visual question, beta. Malleus, incus, stapes, beta. How differentiate malleus from incus, beta? If something has got a round head, it's malleus, beta. Incus has a body. This is the body, beta. Something with a rounded tip like this, it is malleus, beta. With the flat body, it is incus. Don't confuse malleus and incus, beta. Please understand the malleus, incus should not be confused, beta. Malleus, can you see malleus has a head, beta? Something with a head will be malleus. With the flat top will be incus. This is incus. This is incus and malleus, beta. Okay. Malleus, incus develop from first arch, and stapes from second arch. Malleus, incus from first arch, stapes from second arch, beta. Okay. Cochlear development complete by 20th week, beta. 20th week. Okay. Mastoid tip is not there at birth. It develop at 2 years of age, beta. 2 years of age. Okay, beta. Size-wise, malleus is bigger than incus, bigger than stapes, beta. Stapes is smallest bone of the body. Stapes is smallest bone of the body, beta. Stapes is smallest bone of the body. Okay. Guys, please revise these images, beta. When you revise after to now, first of all, revise the ear only, beta. Okay, fine. Always look at the head of the malleus. What is umbo, beta? What is umbo? Tip of the handle of miracle, umbo, beta. Umbo. Incus got a flat body, beta. Okay. Long process, short process, lenticular process. Stapes has got a head and a plate, beta. Cup is called head of development complete by 20th week, beta. 20th week. Okay. Mastoid tip is not there at birth. It develop at 2 years of age, beta. 2 years of age. Okay, beta. Size-wise, malleus is bigger than incus, bigger than stapes, beta. Stapes is smallest bone of the body. Stapes is smallest bone of the body, beta. Stapes is smallest bone of the body. Okay. Guys, please revise these images, beta. When you revise after to now, First of all, revise the ear only, beta. Okay, fine. Always look at the head of the malleus. What is umbo, beta? What is umbo? Tip of the handle of malleus called umbo, beta. Umbo. Inkle got a flat body, beta. Okay, long process, short process, lenticular process. Stapes has got a head and a plate, beta. Cup is called head of stapes. Plate is called foot plate, beta. And foot plate is attached at oval window of the cochlea, beta. And please read your note. Stapes is the end of the middle ear and beginning of the inner ear, beta. Stapes acts like what, beta? Anybody? Piston. Can somebody tell me if stapes is fixed? What is the name of disease, beta? I'm waiting. What is the name of disease, beta? Otosclerosis. Otosclerosis, beta. Otosclerosis, beta. I hope you remember, beta. TM and ossicle work as one unit, beta. They conduct sound energy to the inner ear, beta. Stapes is the end of the middle ear and beginning of inner ear, beta. So basically, ossicle TM conduct sound energy to the inner ear, beta. Okay, and they also amplify sound energy, beta. And the amplification factor is 22:1. Middle ear transformer ratio is 22:1, beta. Okay, so basically, middle ear has two functions: it conducts sound energy and amplifies sound energy, beta. Conduct sound energy and amplify sound energy, and middle ear transformer ratio is 22:1, beta. Pinna is made of which type of cartilage? Yellow elastic cartilage. Yellow elastic cartilage. Okay. Nerve supply of pinna, greater auricular nerve. Greater auricular nerve is the main nerve supply of pinna. Auricular pinna. Greater auricular nerve, look at me, beta. Is the main nerve supply of pinna is greater auricular nerve, and the same nerve supply is the lobule of pinna, beta. Lobule of pinna is supplied by greater auricular nerve. Look at your notes, beta. Parotid gland surgery, beta. This nerve can be injured in parotid gland surgery. Everybody touch your parotid gland, beta. All you touch your parotid gland is below the lobule of pinna, beta. This is parotid gland. Everybody, please remember, if any swelling below the lobule of the pinna is parotid swelling, beta. All of you touch below the lobule of pinna, any swelling in this area, like pleomorphic adenoma of the parotid gland. Where is the parotid gland swelling? Below the lobule of the pinna, beta. Guys, pinna hematoma due to trauma, beta. It's common in boxers and all that. You should drain the hematoma immediately. Why? If you don't drain it, cartilage shape will be destroyed, and that is called boxer ear or cauliflower ear. Look at your notes, beta. Boxer ear or cauliflower ear, it is post-traumatic pinna deformity. What is the answer, beta? What is boxer ear or the cauliflower ear? It is post-traumatic pinna deformity, beta. Okay. Can you see this laddu, beta? This laddu is keloid, beta. People get the piercing done in the helix area, and they get the laddu over here. This laddu is called the keloid, beta. Keloid. Okay. And Darwin tubercle is not a disease. It is only an anatomical variation. It is conical elevation on the helix, beta. If you see a conical elevation like this, it is Darwin's tubercle, beta. Darwin's tubercle. Okay. Now, external aortic canal. Please, let's go over the. Okay. Syringing, beta. Next beta. Syringing. Let's important point of the ear, beta. Syringing, when you put water in the ear to remove X, the direction is posterior superior, and do not use cold water, beta, because that can lead to vertigo, beta. So in syringing, what the direction of water? Posterior superior is MCQ, beta. And do not use cold water because it can stimulate your inner ear and you can get vertigo, beta. Okay, fine. Live insect in the EAC, MCQ, beta. Put oil in the EAC to kill it and then remove it, beta. Don't try to catch it live. Put oil in the EAC to kill it and then remove it, beta. Now, this table has got many MCQ, beta. Nerve supply, beta. Everybody, nerve supply. This has the MCQ, beta, for you. Auriculotemporal nerve is the supply of the anterior wall and roof of the EAC, beta. Anterior wall and the roof of the EAC. Number two, main thing is auricular branch of vagus, also called Arnold's nerve. Please don't forget Arnold nerve. Arnold nerve, don't forget, beta. Don't forget Arnold's nerve, beta. Don't forget Arnold's nerve, beta. Okay, beta, fine. Stimulation of this nerve can lead to, number one, cough, and number two, syncope episode, beta. क्या 3 MCQ आपके सामने बेटा. Cough and syncope. Syncope मतलब unconscious हो जाना, बेहोश हो जाना. You wash the ear and vagus got stimulated and you turned unconscious. Syncopal episode. Guys, कान साफ करते हुए खांसी आना, कान साफ करते हुए बेहोश हो जाना, this is due to Arnold nerve, which is auricular branch of vagus nerve. In English, when you clean the ear or when you play with the ear and there is coughing or patient with an unconscious syncopal episode, it is due to auricular branch of vagus stimulation, which is also called Arnold nerve. And number 3, sensory division of facial nerve. It supplies the posterior superior part of the EAC. Guys, don't forget Arnold nerve. This is something very vital for your paper, beta. Cough, syncopal episode and all that. Ye nahi bholna beta. Arnold nerve, vagus branch, cough, and syncopal episode stories should be remembered. Look at the next page, beta. Malignant otitis externa. Malignant, very risky infection. It is infection of underlying bone of the EAC, beta. Underlying bone of the EAC. And this is typically seen in the old diabetic patient, beta. Old diabetic patient. And it is caused by Pseudomonas. Pseudomonas. Everybody look at me. ENT has 2 questions of diabetes. Young diabetic nose question, black thing in the nose, mucormycosis. Old diabetic ear pain question is malignant otitis externa. ज़्यादा सोचना ही नहीं है बेटा. Old diabetic ear pain question. Old diabetic बोल रहा है वो. पहले बोला old diabetic patient. It is a typical story of malignant otitis externa. Any old diabetic with severe earache is think about the malignant otitis externa. Okay. Facial nerve is most commonly involved. Facial nerve अपने घर की nerve है ना बेटा. Facial nerve passes through a ear. Facial nerve is the most commonly involved now. Okay. It's Pseudomonas beta. So drug of choice is 3rd generation cephalosporin plus aminoglycoside. Okay. The main drug of choice is 3rd generation cephalosporin plus aminoglycoside. Otomycosis, to remember, is wet newspaper appearance. Otomycosis look like wet newspaper, but that's the point to be remembered. And X-osteosis is extra bone formation is sulfur ear. Sulfur, X-osteosis, sulfur ear. It is hyperplasia of the bony EAC. It is more common in sea sports, water sport person. Therefore, it is called sulfur ear. Bat ear is absence of antihelix. Boxer ear or cauliflower ear is the post-trauma pinna deformity. And sulfur ear or X-osteosis is the extra bone formation in the ear. Hyperplasia of the bony EAC. Hyperplasia of the bony EAC. Now, tympanic membrane. Don't forget Seagull speculum. Seagull speculum. Seagull speculum. This is important. Seagulization. What is seagulization? Putting air pressure on tympanic membrane, and this always has got a speculum for magnification. Lens, there is magnification over there. What is seagulization? Putting air pressure, and this instrument is called what? Beta? Seagull speculum. Beta. Seagull. Beta. Okay. TM 4 landmark. Beta. This is the handle of Malleus, later process of Malleus, cone of light, and umbo. Beta. Number 1 is handle of Malleus. Number 2, later process of Malleus. Number 3, umbo, and number 4, cone of light. I hope remember the right ear cone of light is 5 o'clock. Left ulta kar do 7 beta. Left mein 7 o'clock position beta. Left mein 7 o'clock position. Don't forget TM has 2 part beta. The lower part is pars tensa. Upper part is pars flaccida. Weaker part. Pars flaccida is also called Sharpnell's membrane. क्या बोलते हैं? Sharpnell membrane. This is important question. Pars flaccida मतलब weaker part. Upper part is the Sharpnell membrane. Beta. Sharpnell. Okay, Sharpnell's membrane. Now, if Eustachian tube is blocked, you get a retracted TM, then you get a retraction pocket, and retraction pocket ruptures to form what? Beta? Cholestoma. Remember the story, beta? If Eustachian tube is blocked, you get a retracted TM, and then retraction pocket. Too much retraction will form the retraction pocket, and if retraction pocket rupture, it will form the cholestoma one day, beta. Okay, cholestoma one day. Okay, fine. And this type of cholestoma is called primary acquired cholestoma. क्या बोलते हैं बेटा? Primary acquired cholestoma. It is pearly white in color. Anything pearly white in the upper part of tympanic membrane. Anything pearly white in the upper part of tympanic membrane is cholestoma. And which type of cholestoma? Primary acquired cholestoma. Due to retraction pocket. Retraction pocket. I hope remember beta. Traumatic perforation. Beta. कान के पर्दे में छेद हो गया. Trauma perforation. Treatment is conservative. Beta. Conservative treatment. Let us revise 4 MCQs in which you write conservative treatment in ENT. Number 1 is laryngomalacia. cord paralysis. Number 3, CSF rhinorrhea. Number 4 is the traumatic perforation of tympanic membrane. 4 MCQs of MCI, beta, in which you mark conservative treatment or wait and watch, beta, no surgery, is the laryngomalacia, unilateral vocal cord paralysis, number 3, CSF rhinorrhea, and number 4, traumatic perforation of tympanic membrane. You take in tube, beta. Which muscle opens the tube, beta? Tensor villi palatini muscle. That's important question. Tensor villi palatini muscle opens the tube during swallowing. And main function of the tube is middle ear ventilation. Middle ear ventilation. Now come the star topic. Star topic. Glue ear. This topic, let's revise. Everybody, are you with me, beta? Please write in the chat box. Are you with me? मुझे पता नहीं तुम लोग कहाँ हो कि नहीं हो. Are you there? Everybody, are you there with me? All of you mark the attendance one more time, beta. Are you there, beta? Okay, everyone, please. No. Yes. So, perfecto. Now, I hope you remember the story better. Remember normal TM, retracted TM. We still got blocked, retracted TM, retraction pocket, and then we got the cholestoma. Retraction pocket is the mother of cholestoma, and that is called the primary acquired cholestoma. Now, glue ear is very, very important. I told you, glue ear is very important question. Let us see the glue ear picture. Whenever you see the air bubble behind the tympanic membrane, it's glue ear. This photo nahi bhulni beta. This is a typical picture of your paper also, beta. Whenever you see this air bubble behind tympanic membrane, think of glue ear. The glue ear is also called the serous otitis media, also called the secretory otitis media, but the new name is OME. Beta. What is OME? Bolo muh se bolo beta. What is OME? Otitis media with effusion. Beta. Effusion. Everybody, glue ear is the most common cause of hearing loss in children. Beta. Glue ear is the most common cause of hearing loss in children. It is also called serous otitis media, secretory otitis media, and the new name is OME. Beta. What is OME? Otitis media with the effusion. Beta. Most commonly, it is seen in school-age children. Beta. School-age children. Beta. Now, please look at the screen there. Mouth breathing child with the hearing loss is MCQ of adenoid hypertrophy with the glue ear. Adenoid hypertrophy with the glue ear. Okay. Is glue ear painful? No, it's not painful. It only causes heaviness in the ear. And how much loss we have? 10 to 40 decibels CHL. So most commonly it is due to the adenoid problem. बेटा. So mouth breathing child with hearing loss. अगर अभी भी ये क्वेश्चन हमारा छूट जाता है तो गलत बात है बेटा, क्योंकि ये क्वेश्चन आना ही आना है, किसी न किसी फॉर्मेट में पेपर में आ जाता है. Mouth breathing child with hearing loss question is adenoid hypertrophy with glue ear, and the air bubble behind tympanic membrane is the which quadrant? In anterior-inferior quadrant. And what G for glue? G for grommet, beta. After you do grommet, beta. And plus which surgery, beta? Adenoidectomy, beta. For adenoid, you do adenoidectomy. For glue, you do maryngotomy and grommet insertion, beta. Maryngotomy and grommet insertion. Okay. Fine, beta, fine. Done. Now, this is what? Don't forget a rare cause. The rare cause is nasopharyngeal carcinoma, NPC, which is more common in China, but NPC will be adult patient. Adenoid will be a child. NPC will be adult patient. Adenoid will be mostly bilateral glue ear, but unilateral can also be there, beta. NPC will be mostly unilateral, beta. Unilateral glue ear, adenoid will be mostly bilateral glue ear, beta. But don't go for why not unilateral? Why maybe right? adenoid hypertrophy patient with the right side glue here. It's okay, no problem. It is mostly bilateral, mostly bilateral. Na? Again, I remind you, but don't change the answer for some nitty-gritty change over there, because examiner got a vast experience. Maybe he has seen cases with adenoid hypertrophy with unilateral glue here also, okay? So, please understand, books and patient differ, and the question are drafted sometimes out of patient directly, okay? That's why. But don't change the answer for smaller changes in this thing, okay? Now, so myringotomy with grommet insertion with adenodectomy is the treatment plan for this patient. Treatment plan for this patient. Let's wait over here. I think lag is there. Let's wait again. Let me see. Yeah. Can we start now? Okay. Now. Now. Glue year, please write down, must to revise. Every word of glue year should be known to you. Okay? Fine. Now. Guys, middle year, what to revise over here from my side? Don't forget the word attic, beta. Attic. Attic. Epidibenum, also called attic. Arius, there will be a test and discussion after the test is over, beta. Okay, fine. Sensitive fly of middle ear is Jacobson's nerve, beta. Guys, Arnold nerve is auricular branch of vagus. Arnold nerve is auricular branch of vagus nerve. Jacobson's nerve is tympanic branch of glossopharyngeal nerve. Tympanic branch of glossopharyngeal nerve. Tympanic branch of glossopharyngeal nerve. Okay. Chalo beta, fine. Arnold nerve is auricular branch of vagus nerve. Jacobson's nerve is tympanic branch of glossopharyngeal nerve. Why? Okay, this one, Jacobson nerve. Why supraglottic cancer, Parkinson's cancer cause earache via which nerve? 10th nerve beta. This is the Arnold nerve. So guys, this is front of you is actually full of MCQs right now, beta. Arnold nerve is a branch of vagus nerve, and that's the cause of earache being referred from larynx to the ear in supraglottic cancer and pariform sinus cancer. But the MCQ expected is why tonsillitis or tonsillectomy cause earache? The answer is through glossopharyngeal nerve, through its branch called the Jacobson's nerve. Jacobson's nerve. Okay, fine. Now, 6 walls of middle ear, beta. Everybody come over here. Let's revise our concept of the class, beta. Above the roof of the ear is brain, behind the ear is sigmoid sinus, and below the ear is jugular bulb. Above the roof of the ear is brain, behind the ear is the sigmoid sinus, and below the ear is jugular bulb. This is ear, beta, E-A-R. Above the ear is temporal lobe of the brain, behind the ear is sigmoid sinus, below the ear is jugular bulb, and this continues down as IJV, internal jugular. I hope you're reviving the concept in your mind. Okay, fine. Now, the anterior wall has got 2 openings called ET, TT. Eustachian tube and tensor tympani muscle, which is attached to malleus. And tensor tympani is supplied by trigeminal nerve, T, T, T. Posterior wall has a projection called pyramid. Remember in the class, beta, pyramid belong to our past, beta. Pyramid from our past, backside. Pyramid, which muscle comes out? Stapedius. And S for stapedius, S for seventh now, beta, facial now. Facial now. So tensor tympani trigeminal, and S for stapedius, S for seventh now, beta. Seventh now. Okay. Do not confuse pyramid with promontory. Promontory is a projection on the medial wall of middle ear, and it is a projection of basal turn of the cochlea. Please don't confuse pyramid with promontory. Pyramid is our posterior backside, posterior wall. Promontory is on the medial wall. It's a projection of basal turn of the cochlea. And number two, which canal bulge? Lateral semicircular canal bulge. Okay. And two window are oval window and round window. And round window is called by nothing but a membrane called round window membrane, also called secondary tympanic membrane. Okay. Round window membrane also called secondary tympanic membrane. Secondary tympanic membrane. Yes. So let's go to the middle ear cleft, beta. It's a combination of all the spaces. I hope you remember, beta. Antrum is the most constant and largest cell. It's antrum. Please see, antrum is connected to middle ear through a channel called adductus, beta. You know, and everybody has got antrum, the largest mastoid cell, and it is connected to middle ear through a channel called addutus, beta. And petrous apex has got two nerve, beta. Which two nerve? Fifth and sixth nerve, beta. Don't forget, beta. Petrous apex divided, beta. Which two nerve are there? Fifth and sixth nerve, beta. Okay. Disease of middle ear cleft, beta. It can be ASOM, acute suppurative otitis media. Only one question possible is, most common organ is Streptococcus pneumoniae. And second is cartwheel sign, beta. Cartwheel sign is what? Cartwheel sign means the tympanic membrane is red in color with dilated capillaries. So ASOM gives which sign of tympanic membrane? Cartwheel sign, because the capillaries look like the wheel, spokes, actually, like that. Cartwheel sign. Okay. Now, MCQ is, if ASOM patient with bulging TM, beta, bulging TM. TM is bulging. You do myringotomy, beta. Myringotomy, it's done in posterior-inferior quadrant. Posterior-inferior quadrant, beta. Guys, we have discussed all these things in the class, beta. NS, we discussed all these things in the class. I think you are probably attending the class for the first time, probably. All things we discussed in the class, actually, which was, okay. Posterior inferior quadrant. This is just a rapid highlight of the things. Okay, posterior inferior quadrant. Okay, let's remember, beta, in glue ear we do myringotomy in anterior inferior quadrant, and in ASOM we do myringotomy in posterior inferior quadrant. Posterior inferior quadrant. How to remember? P for pus, P for posterior inferior, beta. Okay, P for pus, P for posterior inferior. P for pus, P for posterior inferior. Okay. So in myringotomy, in glue ear, we done in anterior inferior quadrant. ASOM myringotomy done in posterior inferior quadrant. Okay. P for pus, P for posterior inferior. Okay. Now safe CSM. We're doing disease of middle ear cleft, beta. ASOM, and chronic is safe CSM. Tubotympanic CSM is other name, beta. Basically, there is a permanent central perforation in the pars tensa of tympanic membrane. Permanent central perforation in pars tensa of the tympanic membrane. And please see, ear discharge is there. Ear discharge, main thing is not foul smelling. Guys, please remember, foul smelling ear discharge is a feature of unsafe CSM. Foul smelling ear discharge is a foul smelling ear discharge is the feature of the unsafe CSM. There are two types of MCQs possible for ear discharge, beta. Safe CSM is having not foul smelling ear discharge. Unsafe CSM is having the foul smelling ear discharge. Ossicle to be eroded. First ossicle eroded is incus, beta. Incus. Why, beta? Because incus has no muscle. Try to recall, beta. Tensor tympani attaches to malleus. Stapedius attaches to stapes. Incus has no muscle, beta. So therefore, incus has least blood flow. Look at your notes, beta. Incus has least blood supply, beta. Incus has least blood supply. What a treatment is surgery called myringoplasty, beta. Myringoplasty. And most commonly used, which graft is temporalis fascia graft. What is the most commonly used graft? Temporalis fascia graft, beta. Temporalis fascia graft. Okay. And why, which retractor we use, beta? Mollison retractor. This is visual question of NEETPG, beta. Okay, and the incision is called Wild's post-oral incision. Wild post-oral incision. Wild post-oral incision. No, safe CS1 cannot become unsafe CS1, beta. Safe is different. Safe is the perforation, beta. Unsafe is cholestoma. Unsafe is cholestoma, beta. Okay. Now question come, beta. This one, beta. Mollison retractor to be kept in mind, beta. Type 3 tympanoplasty is done in M minus I minus S plus situation. Basically, there's a perforation and malleus incus is eroded, stapes only there. Then you touch the graft with the stapes directly, beta. And this is called columellar tympanoplasty. That's the MCQ, beta. Type 3 tympanoplasty is also called columellar tympanoplasty. It is done in M minus I minus S plus situation, beta. M minus I minus S plus situation. Okay, fine. We get very few questions out of middle year, actually, to be very honest with you. Okay, fine. But you know, mastocytitis is important, beta. Yes. Mastoid cells got infected. To be remembered, beta, there's mastocytitis right now, beta. Just highlight, beta. No headache will be there, beta. No fever will be there. There will be edema on the mastoid, but there's no headache, no fever in this patient. There's a pain behind the pinna, profuse ear discharge. Main thing is the first sign of mastocytitis. The first sign is what, beta? Hardening of mastoid. Hardening of mastoid. Hardening of mastoid. Hardening of mastoid is the first sign, and this is non-pitting edema. Why I'm telling you this, beta? Try to recall. We discussed it multiple times in the class also. Edema on the mastoid can be seen in sigmoid sinus thrombosis also. Okay, okay. Gautam, this is actually just a revision class, beta. It's not mandatory class for you. Anyone, you can just go through your notes yourself. Just to highlight this thing, beta. This we have to just see the main points only, beta. This we done. That's why we did the larynx, pharynx, and nose. This thing. You can revise ear on your own also. The main points of the ear actually, because revision means actually you have to read the notes at a stretch, beta. Okay, fine. Now non-pitting edema of the mastoid. This area has got no pitting edema. There's edema but no pitting. Now try to recall in your mind, beta. Sigmoid sinus thrombosis and mastoiditis both have got edema on the mastoid written. How to differentiate these two questions, beta? We discussed, we put an audio in the group also. If there's a headache, fever, along with the edema on the mastoid, I will think about sigmoid sinus thrombosis. If there's only edema on the mastoid, only no headache, no fever, then I will think about mastoiditis. Mastoiditis. Okay, fine? Okay. Now, let's go further, beta. Yes, everybody look at screen, beta. Don't forget the name of the word called reservoir sign, beta. Reservoir sign and lighthouse sign are feature of sigmoid sinus the feature of mastoiditis, beta. Reservoir sign means the moment you clear the pus fills immediately again. And lighthouse sign means gus keeps moving, beta. So actually 3 or 4 sign, beta. In mastoiditis, remember, there is first sign is hardening of mastoid. Then tenderness is positive if you press it. Then if you clean the pus, it fills immediately again. It's called reservoir sign. And if you see the pus, it's moving continuously. It's called lighthouse sign, beta. And what is the name of surgery, beta? Cortical mastectomy. MCI question, beta. Right number, Schwartz operation. क्या बोलते हैं? Schwartz operation, beta. Schwartz operation. Okay, Schwartz operation. Okay. Now, in mastectomy, first cell to be located is antrum. Because why? Antrum is constant cell, beta. Every cell body has got antrum. Everybody has got antrum. How to find the antrum? Next page, beta. The surgical landmark for antrum is which triangle? McEwen triangle or suprameatal triangle. Antrum, the surgery, this is called McEwen triangle or suprameatal triangle. Suprameatal triangle. Okay, fine. And some people, we can't find antrum. It's a remnant of Petrus comma suture. Petrus comma suture. Petrus comma suture. Okay, now everybody, all of you come to now Petrus item. This is the star question of your paper. Petrositis or Grady-Nigo syndrome. Grady-Nigo syndrome. It's infection of petrous apex hair cell. I'm waiting for everybody to answer. Which two nerve lie at the petrous apex? Everybody, which two nerve lie at the petrous apex? Which two nerve lie at the petrous apex? Everybody answer it. The speed is absolutely okay at my end. I've checked it multiple times. Yes, fifth and sixth number. Fifth and sixth number. Absolutely correct. Everybody, please write down. Everybody write down which two nerve lie at petrous apex. Fifth and sixth number. Now, guys, don't forget the word Grady-Nigo syndrome. What's the name of syndrome? Grady-Nigo syndrome. Now, Grady-Nigo syndrome, 3 GERD, ear discharge, retroorbital pain due to fifth nerve involvement, diplopia due to sixth nerve involvement. Once again, petrositis is also called Grady-Nigo syndrome. What is the name of syndrome? Grady-Nigo syndrome. E for ear discharge, R for retroorbital pain, D for diplopia. Guys, ऐसे क्वेश्चन बिल्कुल नहीं भूलना बेटा. ये क्वेश्चन तो एकदम Grady. Anybody, what is Gressinger's sign बेटा? I'm waiting for everybody to reply. What is Gressinger's sign बेटा? Gressinger's sign. Grady-Nigo, Gressinger confusing. Gressinger's sign is seen in sigmoid sinus thrombosis. Gressinger's sign is seen in sigmoid sinus thrombosis. Beta. Anybody tell me what is Gressinger's sign? Beta? It is pitting edema on the mastoid. Beta. It is pitting edema on the mastoid. Beta. Remember pitting edema on the mastoid? It is pitting edema on the mastoid. I'll refresh the app again if you have any problem. Gressinger's sign is pitting edema on the mastoid. Yes, very good. Everybody, we will not confuse Grady-Nigo syndrome with Gressinger's sign. Grady-Nigo syndrome was the other name of petrositis, and Gressinger's sign is the sign of sigmoid sinus thrombosis. It is pitting edema on the mastoid. It is pitting edema on the mastoid. Pitting edema on the mastoid. Okay. Are these two MCQ clear, beta? Grady-Nigo syndrome and Gressinger's sign? Sure. Now, yes, let's go to the answers here. Anybody? What type of cholestoma is in? What is color of cholestoma? What is color of cholestoma? Answer CS1. Answer C. What is the color of cholestoma? Pearly white. What is the color of cholestoma? Pearly white. And I hope remember, most common cause of cholestoma is the retraction pocket. And this type of cholestoma is called primary acquired cholestoma. Primary acquired cholestoma. Primary acquired cholestoma. What is the color of cholestoma, beta? Color of cholestoma is pearly white. Color of cholestoma is pearly white, beta. Color of cholestoma is pearly white. And most common cause of cholestoma is the retraction pocket. And this type of cholestoma is called primary acquired cholestoma. And a secondary acquired due to marginal perforation, which is very uncommon. And fine. Okay, majority cholestoma look like this, beta. And this is due to retraction pocket. And this is classically called primary acquired cholestoma. And there's the secondary acquired due to marginal perforation, congenital. Please see, pearly white mass behind what, beta? Behind intact TM. Pearly white mass behind intact TM is the congenital cholestoma. Pearly white mass behind intact TM is congenital cholestoma, beta. Congenital cholestoma. Okay, fine. Now, I hope you remember, everybody, ear discharge is foul smelling. ये आपका clue है बेटा. जैसे foul smelling chronic ear discharge लिखा हो, moment you see foul smelling chronic ear discharge, it is a case of unsafe CS. Unsafe CS1. ऐसे तो क्वेश्चन सॉल्व हो गए ना बेटा. Chronic foul smelling ear discharge. Which disease you should think of is the unsafe CS1. Old diabetic, ear pain, ear discharge, I will think about malignant otitis externa. Young boy with nasal bleeding, nasal mass, I'll think of angiofibroma. A lady with pulsatile tinnitus or bleeding mass in the ear, I'll think of glomus question. A 7-year-old child with unilateral foul smelling discharge from the nose is foreign body in the nose. ऐसे तो क्वेश्चन सॉल्व हो जाएंगे बेटा हमारे, है ना? These clinical questions are not that difficult बेटा. Now, the surgery is called MRM, modified radical mastectomy. Now, labyrinthine fistula, it's a fistula of which canal beta? I'm waiting for everybody to answer. It's a fistula of which canal? Lateral semicircular canal. Lateral semicircular canal. And you see fistula sign in that. Okay. And the false positive fistula sign is called Henny-Butt sign. There's no fistula, but test still come positive. It's called Henny-Butt sign. It's in congenital syphilis. Okay, once again, labyrinthine fistula is the erosion of which canal? But a lateral semicircular canal. And what is the name of the what is sign we look for? Fistula sign. And the chief complaint is vertigo in this patient. But some people don't have fistula, but still the test is positive. It's called Henny-Butt sign. Henny-Butt sign. Okay, it's a feature of congenital syphilis. Congenital syphilis. Now, guys, this is important. Brain abscess. Brain abscess. Brain abscess. Everybody, now. Now, just keep looking at your book and just keep looking at me. Now, brain abscess question, beta. Please look at me carefully. Ear discharge patient, developing headache and convulsions. I will think of brain abscess due to CS1. Most commonly, the abscess from the temporal lobe. Please see the CT scan also, temporal lobe abscess there. And treatment is what? Not ENT surgery, neurosurgery. Once again, unsafe CS1 with vertigo. I will think of labyrinthine fistula. Unsafe CS1 with headache and convulsions, I'll think of brain abscess. Unsafe CS1 with pitting edema on the mastoid, fever and headache, I will think about sigmoid sinus thrombosis. And pitting edema is called which sign? Look at note, which sign? Grisinger sign. दोबारा से revise कर. Unsafe CS1 got chronic foul smelling ear discharge. Okay, question कैसे आएगा? Chronic foul smelling ear discharge patient has developed vertigo. What is the diagnosis in your mind? Labyrinthine fistula. Chronic foul smelling ear discharge patient developed headache and convulsions, epilepsy. I'll think about brain abscess. Treatment is neurosurgery. Chronic foul smelling ear discharge patient developed fever, headache, and pitting edema on the mastoid. I will call it, I'll diagnose it as sigmoid sinus thrombosis. Okay, and pitting edema on the mastoid is called which sign? Grisinger sign. Grisinger sign. Okay, now everybody go to the inner ear. Beta. Let us see the inner ear main part. Everybody, please see. Please see your notes. Beta. Everybody, please see your notes. Inner ear. Can you see the first page? Everybody. Now, in the first page, please see. In the first page, please see. Beta. Everybody. There are two types of labyrinth. Beta. Membranous labyrinth and the bony labyrinth. Beta. Membranous labyrinth is the actual inner ear. Bony labyrinth is the bony cover of the inner ear. Can you tell me in the chat box, bony labyrinth is made by which part of temporal bone? Bony labyrinth is made by which part of temporal bone? Everybody answer, beta. Can you answer this question, beta? Bony labyrinth is made by which part of the temporal bone? Arus, AYRUS, Irus, bro, I think you are attending the class for the first time. It's not a first time class, beta. It is actually the revision class. Irus, bro, I think you need to, probably you're done, not attend the class earlier, beta. Unsafe CS1, beta. It's chronic supraotitis media. Very good, beta. Petrus part. This is expected question, beta. Now look at me, beta. If everybody tell me, if ethmoid bone get fractured, what leak you have? CSF rhinorrhea. If the temporal bone, petrous part get fractured, you will get CSF artoria. Are you getting my point, beta? If ethmoid bone get fractured, CSF rhinorrhea. If temporal bone, particularly petrous part get fractured, you get CSF artoria, beta. Very good. And petrous part is the hardest bone of the body. Okay, hardest bone of the body is petrous part. Petrous part. Very good. Perfect. Now, everyone go to next one. Next one, beta. Let's revise, beta. Cochlea has organ of corti for hearing. Utricle saccule has macula for linear balance. And canals have got crista for angular balance. Once again, revise with me, beta. Cochlea has organ of corti for hearing. Utricle saccule has macula for linear balance. And canals have got crista for angular balance, beta. Okay? Okay, beta, fine. Please look at the next one, beta. Fluids of inner ear. Inner ear is filled with endolymph, surrounded by perilymph, beta. First line of endolymph, beta. Revise with me. Endolymph is produced by stria vascularis of cochlea and absorbed by endolymphatic sac. Absorbed by endolymphatic sac. Okay? And if the sac is not absorbing the endolymph properly, what is the name of disease, beta? If the endolymphatic sac does not absorb the endolymph properly, what is the name of disease, everybody? It is Meniere's disease, beta. It is Meniere's disease. Okay, Meniere's. Okay. Okay, I hope you remember the Meniere's means too much of endolymph, beta. Too much endolymph. Okay. Now, guys, next one. Perilymph is nothing but CSF. Perilymph and CSF are interconnected by, look at the note, beta. Perilymph and CSF are interconnected by aqueduct of cochlea. Perilymph and CSF are interconnected by aqueduct of cochlea, beta. Aqueduct of cochlea. Aqueduct of cochlea. Okay, very good. Now, guys, cochlea is important. Beta. Everybody, please mark inner ear. अगर ear में क्या revise करना है बेटा? Okay, तो ear में क्या क्या revise करना है? Number one, inner ear to be revised completely. Inner ear to be revised completely. Number two, tuning fork test. Look beta. What to revise today from in ear note beta? Number one, complete inner ear to be revised. Number two, tuning fork test. Tuning fork test beta. Number three, glue ear. Glue ear beta. Glue ear. Number four, otosclerosis. Number five, acoustic neuroma. Then glomus tumor, glomus jugulare. Meniere's disease. Meniere's disease. Then cochlear implant. छोटे टॉपिक बेटा cochlear implant. अभी हम cochlear implant वगैरह करने वाले हैं. Cochlear implant, bone anchored hearing aid, and brainstem implant. Brainstem implant. आप ईयर को ऐसे पढ़ो बेटा, बताता हूँ ईयर कैसे पढ़ना है. चलो हाँ, पहले इसको खत्म कर लेते. कॉक्लिया को, कॉक्लिया में द बेजल टर्न ऑफ कॉक्लिया इज हेयरिंग विच फ्रीक्वेंसी साउंड बेटा? हाई और लो? हाई और लो बेटा? कैन यू टेल मी बेटा? हाई और लो? बेजल टर्न ऑफ कॉक्लिया सेंस विच फ्रीक्वेंसी साउंड बेटा? हाई और लो बेटा? हाई. एपेक्स सेंसेस लो. ओके. Last one is brainstem implant beta. Brainstem implant. Look at this beta. This is the cochlea beta. At the basal turn, we hear 8,000 hertz. At the apex, 250 hertz. Don't forget beta, apex का other name होता है helicotrema. हमने क्लास में बात की थी. Apex is helicotrema beta. Helicotrema. Can somebody post in the group beta? Ear topics beta. Now please see apex called helicotrema. I hope you remember the cut section of cochlea. Remember cut section of cochlea? Scala vestibuli, scala media, scala tympani. Scala vestibuli, scala media separated by which membrane? Reisner membrane. And scala media, scala tympani by basilar membrane. And it contains what beta? Organ of corti. And organ of corti is covered by which membrane? Tectorial membrane beta. RM, BM, TM. Let's revise beta. Scala vestibuli and scala media are separated by Reisner membrane. Scala media and scala tympani separated by basilar membrane. Organ of corti are lying on basilar membrane, and organ of corti are covered by tectorial membrane. Tectorial membrane. Tectorial membrane. Okay, fine. Tectorial membrane. Now, most question come out of utricle saccule. Inner ear. Last time also, utricle saccule, also called otolithic organ. Put a star. Utricle saccule को क्या बोलते हैं? Revise करो मेरे साथ. Otolithic organ, and they control which balance? Linear balance. They control which balance? Linear balance. Linear balance. Okay. Now, macula is the sensory end organ of utricle and saccule. Macula is the sensory end organ of utricle and saccule. Okay. It is covered by gelatinous layer, which has got calcium carbonate crystals called otolith या otoconia. There's the otolith important है बेटा. Once again, utricle saccule को क्या बोलते हैं? Otolithic organ बेटा. Why? Because they contain otolith. Macula is the sensory end organ of utricle saccule, which is covered by gelatinous layer. Look at next page बेटा. It is a gelatinous layer. This is macula. And that contains calcium carbonate crystal called otolith or otoconia. Beta. Otolith or otoconia. Okay. Now, once again, beta. Utricle saccule control which function? Beta? Linear balance. What is the name of end organ? Beta? Macula. Macula contains what? Beta? Otoliths, calcium carbonate crystal. That's why utricle saccule also called otolithic organ. I hope remember, if otoliths fall into semicircular canal, what's the name of disease, beta? If otolith reach the canal, the disease called BPPV, benign paroxysmal positional vertigo. Star topic, beta. Star topic, beta. BPPV, benign paroxysmal positional vertigo, is a very important topic, beta. Basically, otoconia migrate from utricle saccule to canal. Everybody, can you answer this question, beta? Most commonly involved canal, beta. Most commonly involved canal is, everybody, posterior SCC. She communicates vertigo for a few seconds on changing head position. Diagnostic test is Dix-Hallpike maneuver is diagnostic test. 2 positions. And treatment is Appel maneuver, 5 positions. 5 positions. Is it important? Is it clear? BPPV must be revised. Dix-Hallpike is the diagnostic test of BPPV. Appel maneuver is the treatment of BPPV. Okay, we'll define. Now, there are 3 canal, beta. Same as canal, lateral canal, what's called horizontal. Please, can you see, beta? Can you see? Lateral is same as horizontal. Number 2, posterior. Number 3, superior, beta. The 3 canal. Superior canal, lateral, posterior, superior. Superior canal can have a hole, and that's called superior semi-circular canal dehiscence, beta. Yaad hai MCQ, beta? Superior semi-circular dehiscence. And this contains which phenomenon, beta? Nature gave you 2 windows, oval window, round window. Now the sound energy is leaking from this opening. What is the name of this phenomenon, beta? Anybody? What is the name of this phenomenon, beta? If by chance a hole form in the superior canal, it goes superior semicircular dehiscence, beta. Kya bolte hain? Dehiscence. Superior semicircular dehiscence. So there is a hearing loss in this patient. Hearing loss in the patient due to leakage of energy from this opening. What is the name of this phenomenon, beta? I'm waiting for everyone, beta. What is the name of this phenomenon? Yes, third window phenomenon. Yeah, beta. Third window phenomenon is a feature of superior semi-circular canal dehiscence, and this is the hearing loss due to leakage of sound energy from this dehiscence, and that is called third window phenomenon. So third window phenomenon is a feature of superior semi-circular canal dehiscence. Okay, right. Can we go further, beta? Function of canal is angular balance, beta. Don't forget that. Utricle saccule control which balance? Linear balance. Canal control which balance? Angular balance. What is the name of sensory end organ of canal? Next page, beta. Crista. Crista is the sensory end organ of the canal. It lies in the ampulla of the canal, beta. Ampulla. Ampulla is the dilated end of the canal. And crista, please see, crista is covered by a gelatinous layer. And crista is covered by gelatinous layer. This gelatinous layer is called what, beta? Cupula. क्या बोलते हैं बेटा? Cupula. So cupula is MCQ. Please see, beta. Crista is lying in the ampulla of the canal, and crista is covered by gelatinous layer, which is called cupula. Beta, क्या बोलते हैं इसको? Which is called cupula. Okay, which is called cupula. Once again, beta. Crista is lying in the ampulla of the canal. Beta. Ampulla is the dilated end of the canal. Crista is covered by gelatinous layer, which is called cupula. Beta. Once again, beta. Ampulla is the house of crista. Cupula is the cover of crista. चार word है बेटा, please see. Macula एक अलग. Macula was the sensory end organ of utricle and saccule. Okay, macula खत्म हो गया. Macula is the, please देखो नोट में लिखा हुआ है. Macula is the sensory end organ of utricle saccule. अब आते हैं cupula, crista. Crista is the sensory end organ of the canal. It lies in the dilated end of the canal, which is called ampulla. And crista is covered by gelatinous, which is called cupula, which is called cupula. Cupula. यहां तक कोई भी प्रॉब्लम बेटा? चार वर्ड क्लियर बेटा? मैकुला, क्रिस्टा, क्यूपुला, एम्पुला बेटा. मैकुला अलग है बेटा, मैकुला को अलग कर दो. मैकुला is a sensory end organ of utricle saccule, which is for linear balance. Crista is the sensory end organ of canal. It is covered by gelatinous layer called cupula. And crista lies in the dilated end of the canal, which is called ampulla. Beta. Everybody, till now, everybody is clear? यहाँ तक कोई problem तो नहीं है बेटा? Everybody, are you clear? But up to this point, बेटा? All okay बेटा? All okay यहाँ तक? ठीक है, चले आगे. So cupula नहीं भूलना बेटा, crista नहीं भूलना. Once again I revise with you. Cupula is the cover of crista. Ampulla is the house of crista. Okay beta, fine. All okay up to this point beta? Okay. Now, bithermal calorie test is the test for which canal beta? Lateral canal. One question. कान में पानी डालना comes. Which canal you testing? Lateral canal. With cold water, I move toward opposite side. Cows better. Cold opposite, warm same. Cold opposite and warm same side. Cold opposite, warm same. If you put cold water in the ear, I will move to the opposite side. If you put warm water in the ear, I will move to the same side. Cold opposite, warm same. But which canal you are testing? Only lateral canal. Lateral canal. Now, everybody, let us just put in your mind this visual question of anatomy beta. If they ever show you a hole on the posterior surface of temporal bone, it's internal auditory canal, also called internal auditory meatus. Internal auditory canal, also called internal auditory meatus. Now, Bill's bar is important. Bill's bar is seen in the cut section of the internal auditory canal. ये वाला है, इसी में ही. If you do the cut section of this canal, you see Bill's bar. Bill's bar is a vertical bony septum in the upper part of the internal auditory canal. Bill's bar is a vertical bony septum in the upper part of the internal auditory canal. That's we have to finish by 3 o'clock. It's not a like we have to complete the things again. Either to, we have to finish, then you start your on your own. Okay, fine. I think some people are doing this class for the first time, I guess. Probably they've not attended the previous classes, I guess. That's what I'm getting the feel. Okay. Now, the Bill's bar is a vertical bony septum in the upper part of the internal auditory canal. We discussed the class also. In the internal auditory canal, if you do a cut section, you see a bony septum over there. And this bony septum is called Bill's bar. Bill's bar. Aman, we are anyway finishing with that. No need to discuss everything again and again. Right? Fine. This is just for the revision. Now, everybody, now, after this, see the auditory pathway. Yes, can you tell me what is the mnemonic of auditory pathway? E, coli ma. This is important for your paper. Auditory pathway, discuss in the class also. It in the brainstem area, and it's E. coli ma. What is the mnemonic? E. coli ma, beta. Okay, and like in the brainstem area, beta. Let's revise, beta. E for 8 now. C for cochlear nucleus. Speak with me, beta. O for olivary complex superior. L for lateral lemniscus. I for inferior colliculus. M for medial geniculate body, and A for auditory cortex. A for auditory cortex. A for auditory cortex. E for 8 now. C for cochlear nucleus. O for olivary complex superior. And L for lateral lemniscus. I for M for medial genital body, and A for auditory cortex. Fine. Guys, all of you, quickly come to the last part of this beta, because that I definitely want to make you revise with me beta. Bone anchored hearing aid beta. Everybody come beta. Come to the last page beta. We should do the implants actually together, because there's a new topic and you should not really confuse in this topic beta. Bone anchored hearing aid, everybody. It's a must to revise topic beta. Baha. Bone anchored hearing aid, when you anchor the hearing aid onto the bone beta. This was the question in your paper. Baha, what is the indication of Baha? Main thing is with the hearing loss beta. EAC, atresia with the hearing loss. Number 2, anosmia. Anybody? I'm waiting for you. What is anosmia? What is anosmia beta? What is anosmia? Anosmia is abscess of pinna beta. Remember, anosmia is abscess of pinna beta. Abscess of pinna. Yes, pinna is absent beta. And chronic discharge in the ear beta. You want to forget anything, that's okay, but don't forget these 3 indications beta. Baha. Guys, Baha full form is bone anchored hearing aid beta. One indication, anosmia, EAC atresia, and chronic discharge in the ear or wet ear. Very good. Guys, Baha mat bhul jana. It's already asked question in your paper. What is Baha full form? Bone anchored hearing aid. We put a screw, attach the hearing aid to the screw, and main indication of Baha is anosmia, EAC atresia, chronic discharging ear. Very good. Now let's go back. Idhar chalte beta. Superior canal Dyson syndrome beta. Next page beta. Latest topic कर लेते हैं बेटा, क्योंकि ये भूल ना जाए. Superior canal Dyson में third window phenomenon beta. मैं पहले बताया, the patient will have conductive loss due to leakage of sound energy from this Dyson, and this is called third window phenomenon beta. Third window phenomenon. Okay. Now very important thing beta. Vertigo on hearing loud sound. This is called which phenomenon beta? Tullio's phenomenon. Can we remember 2 phenomenon beta? तेज आवाज सुनने पे चक्कर आ जाता है. Tullio's phenomenon. Vertigo on hearing loud sound is called Tullio's phenomenon. This is also seen in Meniere's beta. When you revise Meniere's, you'll see Meniere's disease also get this beta. Okay, fine. So Tullio's phenomenon is vertigo on hearing loud sound. It's the feature of Meniere's disease beta. Third window phenomenon is leakage of sound energy from the Dysons, and that lead to conductive hearing loss. These 2 are the new style question of a topic called superior semicircular canal Dyson syndrome beta. Why I'm telling you this high level topic? Because this is trending topic on the NEETPG INICET side beta. Okay. Now go back beta. Cochlear implant. This is one topic which can be asked this time. Cochlear implant does direct electrical stimulation of the cochlear nerve ending. So I hope remember we saw the video in the class also. The important thing is 8th nerve should be normal. 8th nerve should be normal on MRI scan. You do the MRI, 8th nerve should be normal, and you should prove that first of all. You should do in totally deaf children beta. Deaf child. दोनों तरफ से bilateral, keyword bilateral, profound SNH. Profound more than 9 decibel loss. Which age you should operate these children? 1 year. 1 year. Okay, beta, fine. 1 year you should operate. Beta. Okay. Now it has got 2 components. Beta. One outside the body, one inside the body. The external component got 4 parts. Number 1, microphone. Number 2, transmitter. Number 3, speech processor. Number 4, battery. So cochlear implant has got two components, external, internal. External got 4 parts: microphone, transmitter, speech processor, and battery. The internal component is called electrode. Now that's the MCQ beta. This is surgical part of this. The electrode is put it into the scala tympani of cochlea. Cochlea has 3 parts: scala vestibuli, scala media, scala tympani, and you put the electrode in scala tympani of cochlea through round window. MCQ, 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 MCQ. Let's revise one more time beta. Cochlear implant is important topic और बहुत सिंपल टॉपिक बेटा. गाइस देखो पहले बोन एंकर्ड हेयरिंग एड बहुत आसान है. यहाँ पे हेयरिंग एड एंकर कर देना. 3 इंडिकेशन दिमाग में रखनी है: EAC, अट्रीजिया, एनोशिया एंड chronic discharge or wet ear beta. That's all. Cochlear implant में it does electrical stimulation of the cochlear nerve ending. So the prerequisite is normal 8th nerve on MRI. अगर 8वीं nerve normal नहीं है, don't do this implant. Okay? It is done for totally deaf children. Bilateral profound SNHL. क्या बोलते हैं? Bilateral. दोनों तरफ से सुनाई नहीं देता उसको. But 8th nerve should be normal. We should do surgery at 1 year or more than 1 year. It has got 2 components: external, internal. External component has 4 parts beta. 4 parts. Microphone, transmitter, speech processor, battery. Internal component is called electrode beta. The electrode is surgically placed into scala tympani of cochlea. Scala tympani of cochlea through which window? Round window. Through round window. Guys, please understand. If 8th nerve is normal, we can use cochlear implant. But look at the other implant beta. Brainstem implant beta. Auditory, brainstem beta. ABI beta. Now, if 8th nerve is not normal, for example, in the case of neurofibroma type 2, it has got bilateral vesicular schwannoma, which is 8th nerve tumor beta. ABI beta. The indication to remember is neurofibroma type 2. Try to recall in the class we discussed acoustic neuroma, which is now called vestibular schwannoma, is mostly unilateral except in neurofibroma type 2 beta. Except in neurofibroma type 2. If you remember, I showed you radiology, MRI also. In MRI brain, if you see bilateral vestibular schwannoma, please see. If you see this tumor, this one. Now, you please see there are 2 8th nerve tumor. The name of tumor is vestibular schwannoma, also called acoustic neuroma. It's a case of neurofibroma type 2. Why? Most of the cases we get unilateral acoustic neuroma, but in neurofibroma type 2, we get bilateral acoustic neuroma, also called vestibular schwannoma beta. So 8th nerve is not working properly. What was the prerequisite of cochlear implant surgery? The answer was normal 8th nerve. इसमें तो दोनों 8वीं nerve खराब है. So in NF2 case, cochlear implant is useless beta. But auditory brainstem implant is very nicely used beta. Okay? And where you put the ABI electrode, we put it in the lateral recess of 4th ventricle. Lateral is the 4th ventricle. Lateral is the 4th ventricle. Lateral is the 4th ventricle. Guys, I have got, now question for all of you. Chalo. Now you tell me, beta, what kind of device would you use in this situation? Choices are hearing aid, cochlear implant, brainstem implant, or bone anchored hearing aid. Everybody should answer beta. आप गलत हो कोई बात नहीं बेटा. What kind of device would you prefer in this case? Hearing aid, cochlear implant, brainstem implant, or bone anchored hearing aid? Absolutely right. It will be BAHA, bone anchored hearing aid. Bone anchored hearing aid. Very good. Not hearing aid, but bone anchored hearing aid. Very good. Okay. What kind of device would you recommend for this situation? What kind of device would you recommend for this situation? Again, you will use a BAHA, bone anchored hearing aid. It's anosmia, EAC, atresia, है ना? There is no canal opening there. There's nausea also there. You go for what, beta? Baha. Very good. What kind of device would you recommend for this particular case? What kind of device would you recommend for this case? Very good. A, B, I. What is ABI, beta? Okay. Auditory, brainstem, implant. Beta. ABI means auditory, brainstem implant. Beta. ABI, auditory, brainstem implant. ABI. Beta. Very good. Perfect. Okay. Very good. I think device हमने सारे cover कर लिए. Canal Dyson नया topic cover कर लिया. Now I want to go to the audiometry. I know you have that mind. Okay. No problem. Let's go to the now back beta. I wanted to cover this myself. 4 टॉपिक आपने खुद पढ़ने बेटा. Everybody please write down. जैसे क्लास खत्म हो 4 टॉपिक रिवाइज करने हैं. ओटोस्क्लोसिस, अकोस्टिनोमा, ग्लोमस जुगले, मीनियर्स. और मैं टेलीग्राम ग्रुप में अपने 1 मिनट का वीडियो डालूंगा. आप उसको 1 मिनट का वीडियो सुनोगे, पूरा 1 मिनट में वो टॉपिक रिवाइज हो जाएगा बेटा. टेलीग्राम में मैं डाल दूंगा. आज रात को 4 वीडियो डाल देंगे, चारों टॉपिक के एक करके बेटा. ओके. ऑडियोग्राम कर रहे हैं बेटा. ऑडियोग्राम कर रहे हैं. Already, let's go to the last part beta. I want to, before I go to that part, I want to tell you the impedance audiometry. Go to page number 155 beta. Tympanometry. Please see impedance audiometry beta. Can you see the other name? Impedance audiometry, also called tympanogram beta. Tympanogram. Okay, fine. Now please see this one beta. Different type of tympanogram. Type A is normal beta. This is star question. Type B, flat tympanogram of seen in glue ear. ये कोई नहीं भूलेगा beta. Flat tympanogram is a feature of glue ear. Type B tympanogram or flat beta. इसको नहीं भूलना beta. AS otosclerosis. AD, D मतलब dislocation, important beta. D one dislocation. D one oscillator dislocated. D one dislocation beta. D one dislocation. Okay. And C is you second to dysfunction. Now there are important question. A normal. B flat curve glue ear. C you second to dysfunction. A S beta. S माने sclerosis, otosclerosis. A D. D माने oscillator dislocation. Okay. एक तो ये हमारा cover हो गया. Type B curve, AS curve, AD curve ये आ सकते हैं बेटा, है ना? फाइन. एक तो ये हो गया. फिर आते हैं बेटा बैरा पे. ब्रेनस्टेम इवोक्ड रिस्पॉन्स ऑडियोमेट्री पे. ये ऑब्जेक्टिव टेस्ट है बिकॉज बच्चा आराम से सो रहा है. ऑब्जेक्टिव टेस्ट है. यू रिकॉर्ड, यू गिव साउंड टू द ईयर, यू रिकॉर्ड करंट फ्रॉम द ब्रेन. एवरीबॉडी कैन टेल मी व्हाट इज द मोस्ट इंपॉर्टेंट वेव ऑफ बैरा. व्हाट इज द मोस्ट इंपॉर्टेंट वेव ऑफ बैरा? व्हाट इज द आंसर बेटा? वेव 5 बेटा. And it's produced by E. coli. What is L beta? Lateral lemniscus. It is produced by wave 5 is produced by lateral lemniscus beta. Bara का full form क्या है बेटा? Brainstem evoked response audiometry. Bara का full form क्या है? Brainstem evoked response audiometry. It's objective test. मतलब बच्चा, subject is not involved बेटा. You record, you give sound to ear, you record electrical activity from brain. How many waves we have? 7 waves. What the most important wave is? Wave 5 and produced by lateral lemniscus beta. Okay. Now please keep in mind, Bara is also called ABR beta. याद रखना बेटा, ABR और Bara एक ही बात है. Bara आजकल क्वेश्चन में ABR लिखा होता है. ABR is auditory brainstem response. Auditory brainstem response beta. Auditory brainstem response beta. Very good. Auditory brainstem response beta. Auditory brainstem response. Very good. Okay, fine. Now, इसके अगला टॉपिक था ओटो अकूस्टिक एमिशन. इको आती कॉक्लिया से. एक क्वेश्चन बेटा, आउटर हेयर सेल ऑफ कॉक्लिया प्रोड्यूस ओटो अकूस्टिक एमिशन बेटा. याद है O for O बेटा. Emission means echoes बेटा. Cochlea give echo back to you. Which part of cochlea echo back to you? Outer hair cell give auto acoustic emission. O for O beta. O for O. है ना बेटा? Fine. If you cochlea, you give echo and echo. You give sound to cochlea, echo come back. Though echo are called auto acoustic emission. What is the source of auto acoustic emission? Outer hair cell beta. O for O beta. Auto. Now, let's go back beta. Let's do the audiometry thing, beta. Now, everybody come over, beta. Audiometry thing. So everybody is scared. Don't get scared. Audiometry kuch mushkil nahi hai, beta. It's a subjective test, beta. Subject is telling you. And you are checking air conduction also, bone conduction also, beta. And you check 250 to 8,000 hertz. 8,000 hertz. You know? Fine. AC also, BC. You check both the hearing level of the patient for both all these frequencies. In air conduction also, bone conduction also, beta. Now, please see. This is your normal audiogram, beta. If your hearing is coming in this zone, this, you know, this result is coming in this zone is normal hearing. And if your hearing is coming in this zone, you have got hearing loss. Simple. Your hearing result should be about between 0 and 25 decibel. Beta. So up to 25 is normal. Beta. Clear okay, beta? Fine. Now, symbols, beta. Very simple, simple. Circle and cross are for AC. Open mouth symbol are BC, beta. मुंह खुले वाले सिंबल बेटा, जिनके मुंह खुले रहते हैं वो बीसी होते हैं बेटा, जिनके मुंह खुले ही रहते हैं वो बीसी होते हैं. ओके भाई, फाइन. ओके ओके. नाउ सर्कल इज एसी ऑफ लेफ्ट ईयर, क्रॉस इज एसी ऑफ राइट ईयर. सर्कल इज एसी ऑफ लेफ्ट ईयर, क्रॉस इज एसी, सॉरी, सर्कल इज एसी फॉर द राइट ईयर बेटा, है ना, राइट ईयर. सर्कल राउंड ना, आर फॉर राउंड, आर फॉर राइट. सर्कल एसी फॉर राइट ईयर, क्रॉस एसी ऑफ द लेफ्ट ईयर बेटा. When you see the open mouth symbol, you will see what beta? Bone conduction. Bone conduction. है ना? So B for bracket, B for bone conduction. Now, guys, up to 25 is normal. Beta. Please see. Very simple beta. कुछ घबराने की बात ही नहीं है. In normal people, both AC, BC are within 25 decibel range. No problem. Both AC, BC are within 25 decibel range. In conductive hearing loss, please see. Look at me, beta. So guys, if you remember class, beta, bone conduction goes to cochlea directly. In conductive hearing loss, look at me. If you wax in the ear, beta, can you hear the air conduction properly, beta? Can you hear the air conduction properly? Tell me, yes or no, beta? Can you hear the air conduction properly, beta? No, na? Fine. So please see, beta. If you can't hear the air conduction properly, AC will be poor, beta. BC will be normal. दोबारा आराम से सोचो, beta, आराम से. Bone conduction sound directly goes to cochlea. Okay. So in conductive hearing loss, cochlea is normal. In conductive hearing loss, cochlea is normal. So BC is normal, beta. Once again, BC is a test of cochlea. Choda likho beta. BC is a test of cochlea, beta. Okay. So in bone conduction sound directly goes to cochlea. In conductive hearing loss, cochlea is normal. So BC is normal. What about AC, beta? They are the air conduction. If your ear is full of wax, can sound go through air conduction normally, beta? No. So AC is poor, beta. And AB gap. Guys, whenever you see AB gap, it is conductive hearing loss. Beta. AB gap means conductive hearing loss. Beta. AB gap का मतलब है conductive hearing loss. Okay? In SNH, beta. ध्यान दो बेटा. Cochlea is not working properly. SNH मतलब cochlea is not proper, beta, working. Now, if cochlea is not working properly, if you go through air conduction, again poor. Why? Air conduction goes where, beta? Cochlea. Bone conduction goes directly where, beta? Cochlea. If your cochlea is not working properly, you go through air conduction or go into bone conduction, both AC, BC will be poor, beta. Both AC, BC will be poor. So both AC, BC are poor, beta. Both AC and BC are poor, beta. Are you getting my point, beta? Both AC and BC are poor, beta, in SNH. Okay, fine. Okay. Now, look at screen, everybody. Let me show you these three audiograms. No problem. You'll be confident, don't worry about it. You'll be confident about it. Okay, fine. Now, please see the screen. This is the normal audiogram. You know? You see, up to what is normal? 25 is normal. Up to above this is normal. This is both lines. Please see, upper line is of always bone conduction. Please see, this is bone conduction. This is air conduction. Cross is for, remember, beta? Please see, cross is AC of the left ear, and this is BC, beta, of the left ear. Okay. So if both lines are coming above 25, it's normal audiogram, beta. Okay. Now what about this, beta? Please see. What is this line, beta? What is this line, everybody? This line is what, beta? BC. एक बात बताऊं बेटा, ऊपर की लाइन हमेशा BC की होती है बेटा. Jugaad, beta. I told in the class also that Jugaad, you know, remember the Jugaad? Upper line is always a bone conduction, beta, and lower line is always of air conduction. Okay. Now BC is normal, AC is poor, below 25 is poor now, and this gap is called AB gap. AB gap means what, beta? Conductive hearing loss. AB gap means what, beta? Conductive hearing loss. Beta. AB gap means conductive hearing loss. Beta. Okay. In SNHL, beta. In SNHL, both AC, BC are poor. Beta. In SNHL, both AC, BC are poor. Can you see? Both lines are below 25. Beta. Both are below 25. It's SNHL, beta. Okay. Please fill the screen, beta, once again. In normal people, both lines are about 25. Okay. In SNHL, both are below 25. Okay. In conductive hearing loss, there is AB gap. In conductive hearing loss, there is AB gap. Anybody will tell me any problem beta? दोबारा देखो बेटा. Normal बंदे में दोनों लाइनें 25 के ऊपर है. 20 about 25. Your normal zone of hearing is till 25. In normal people, AC, BC both lines are above 25 beta. If both lines are below 25, matlab both AC, BC are poor, it's SNHL. And if there is AB gap visible, it's conductive hearing loss. Conductive hearing loss. Okay, fine. So once again, both line below 25 is SNHL. AB gap is there, it's conductive hearing loss. Conductive hearing loss. And in the end, beta, two dips in audiogram. Beta. Two dips in audiogram. You see, otosclerosis dip is called Carhart's notch. क्या बोलते हैं उसको? Carhart's notch. It's a dip at 2000 Hz in bone conduction curve. Can you see it over there? This is the Carhart's notch. This is a bone conduction curve. It's 2000 Hz. And Carhart's notch is a dip at 2000 Hz in bone conduction curve. It's a feature of otosclerosis. Now, this is the audiogram which is asked in the paper. Whenever you see AB gap, it's conductive hearing loss. Otosclerosis will have conductive hearing loss. And what is the name of dip? The name of dip is Carhart's notch. It's dip at 2000 Hz in bone conduction curve. Okay, fine, bone conduction curve. And then noise-induced hearing loss. Dip is called acoustic dip or Boiler's notch. Acoustic dip or Boiler's notch. It's a dip at 4000 Hz in AC, BC. This one. Can you see? At 4000 Hz is a dip. Let's revise comfortably. There are two things to be kept. This is a very important audiogram, by the way. Otosclerosis audiogram is important. In otosclerosis, you will get conductive hearing loss. And let me rub it and show you again. Imagine this question come in the paper. These two audiograms. How to solve this query? Now please see. The upper line is always of bone conduction. Lower is always of air conduction. AB gap is there. AB gap means conductive hearing loss. Otosclerosis is at conductive hearing loss due to stapes fixation. And 2000 Hz is a dip. And this dip is called Carhart's notch. Tell that Carhart's notch. Everybody. Now, the other one is noise-induced hearing loss. It's acoustic dip. 4000 Hz dip at 4000 Hz in AC/BC. AC/BC, both lines, BC, AC, both lines. So dip at 4000 Hz in AC/BC, it's called acoustic dip or Boiler's notch. It is noise-induced hearing loss. Everybody, are you clear about the audiometry now? People who are saying, let's revise the audiometry, are you clear, beta? If both lines are above 25, it's normal. If both AC/BC come below 25, it is SNHL. If there is AB gap, I will think of conductive hearing loss. Upper line is always a bone conduction, beta. If you get confused ever in the paper. Carhart's notch is a dip at 2000 Hz in BC. It's a feature of otosclerosis. And acoustic dip or Boiler notch is a dip at 4000 Hz in AC/BC, both, beta. Anybody, any problem? Beta? Are you okay, beta? People who said, sir, please revise audiometry. Are you getting this, beta? I'm getting some people from, Trivandrum and Chennai. They are doing this for the first time, probably. Yes, I got the idea now. Yes. And let us go to the tuning fork also. Tuning fork. Let's do the tuning fork also. Tuning fork. Very good. Okay. Tuning fork, beta. Rene is very, very important, beta. The Rene test. Rene is comparison of air conduction and bone conduction beta. There's किसी को नहीं बोलना. Bone conduction checks cochlea only. Air conduction checks complete ear beta. बहुत simple है beta. Bone conduction checks cochlea only because bone conduction sound. Look at me. Bone conduction sound directly goes to cochlea. BC is the test of cochlea. AC is the complete test of the ear beta. Now please see. In our normal way of hearing is air conduction. In normal people, AC is better than BC beta. Okay. In normal people, AC is better than BC. What about the conductive hearing loss beta? Look at me beta. Your ear has a wax. Your ear has a wax beta. Now look at this remote beta. Your ear has a wax. This is a tuning fork beta. Your ear has a wax beta. If I give this sound to your ear from ear conduction, can you hear properly beta? No. Your ear has a wax. Can you hear this sound? No. But if I put the sound on the bone conduction, yes. Why? Because BC goes to cochlea directly beta. So in conductive hearing loss, BC better than AC. Rene negative beta. This is very important line beta. Rene negative means conductive hearing loss beta. मतलब देखो BC is better than AC beta. आराम से कुछ जल्दी नहीं. Normal people, in you and me, AC is better than BC because AC is the normal way of hearing. Conductive loss में there is wax in the ear. Ear conduction cannot be heard properly. But you moment to keep it in the bone, it's heard very properly. Why? Because BC directly goes to cochlea. So in conductive hearing loss, BC is better than AC. Rene negative. Rene negative is a feature of conductive hearing loss. Okay, what to find? Yes. SNHL is always the reverse of this beta. Rene positive. Please see these two together. Rene negative, Rene positive beta. SNHL, Rene is positive. AC better than BC. Weber test beta. Please see. Weber. You keep the tuning fork on the center of the forehead like this. And you ask the patient which side you are hearing it beta. Okay? Please understand beta. Everybody, in conductive hearing loss, the Weber sound is heard in the poor ear. Remember in the class also we did that. All of you keep on finger on the tragus, close the ear beta. Apna kaan band karo tragus daba ke beta. Okay, close the ear with that, by putting a finger on the tragus beta. Kaan band ho gaya. Close your ear by pressing your tragus beta. Okay. Now this is the poor ear. This ear has got conductive hearing loss. Now I will do this beta. You remember in the exam also. Press this one ear beta, one ear, and now say 1, 2, 3. फिर go 1, 2, 3. एक बार फिर से बेटा 1, 2, 3. Did you notice you are hearing your own sound on that side beta? Did you notice you are hearing your own sound on that side? This ear is poor ear. This ear you created what beta? Conductive hearing loss. So I'll recall the exam. In conductive hearing loss, sound is heard in the poor ear. Weber sound is heard in the poor ear in conductive hearing loss. And this is the reverse of this. Is better ear beta. Better ear. And ABC beta. Absolute bone conduction beta. ABC. Absolute bone conduction is bone conduction will be poor in SNHL beta. Why? Bone conduction directly goes to what beta? Cochlea. BC is the test of cochlea. In SNHL, it will be decreased beta. In conductive will be normal. Bone conduction is a test of cochlea. In conductive hearing loss, cochlea is normal. So ABC is normal beta, equal to example normal. And bone conduction is a test of cochlea. So bone conduction will be poor in SNHL beta. Sensory neural hearing loss beta. 3 points to remember beta. Rene negative is conductive hearing loss. Weber heard in the poor ear means conductive hearing loss. इससे याद आ जाएगा बेटा. Weber heard in the poor ear means conductive hearing loss, and BC is a test of cochlea. So ABC poor means SNHL. There's 3 point याद रखने बेटा. Audiometry 3 point beta. If both lines are above 25, it's normal. If both are below 25, it's SNHL. If AB gap is there, conductive hearing loss. 3 point about tuning fork beta. Rene negative is a feature of conductive hearing loss. Matlab BC is better than AC. Weber heard in the poor ear means conductive hearing loss. And ABC poor means SNHL. Okay. And just to supplement, in SNHL, if it is unilateral severe SNHL, severe, too much of SNHL, you get false negative Rene. In SNHL, Rene should be positive, but if it is unilateral severe SNHL, we get false negative Rene beta because the sound gets transferred to other side. Okay, false negative Rene is a feature of unilateral severe SNHL. False negative Rene is a feature of unilateral severe SNHL. Okay, what fine? Okay, what fine? Now, and lastly, Gillies test beta and Bing test. These are historical tests. Gillies and Bing, B-I-N-G, B-I-N-G, Bing test are special tests used to diagnose otosclerosis. Are special tests used to diagnose otosclerosis. Are special tests used to diagnose otosclerosis. Now, right. Am I visible, everyone? Am I visible, everyone? Yes, please comment. Am I visible? Because I've switched the screen now. The last conversation with you. Am I visible, audible, everyone? All of you, please comment. Who's visible, audible also? Chalo. Perfecto. Chalo. Chalo. Great. Now hear me carefully now. एक बार फिर से रिवाइज करते हैं. Brainstem evoked response audiometry, BARA, also called ABR nowadays. Auditory brainstem response. It's objective test of hearing. You give sound to ear, you record current from the brain, and the most abundant wave of BARA is wave 5, produced by lateral lemniscus. OAE, oto-acoustic emission, are produced by outer hair cells of cochlea. They're echoes of the cochlea produced by outer hair cells of cochlea. O for outer, O for otoacoustic. Tympanometry, type B curve or flat curve is in blue ear. AS, as for otosclerosis. AD, D1 is dislocation curve, and A is normal curve. Then comes the audiometry, pure tone audiometry. 25 is normal line beta. If both line are above, ACBC line are above 25, it's normal hearing. If both line come below 25, it's SNHL. If there's AB gap, it's conductive hearing loss. Carhart's notch is a feature of otosclerosis. It's a dip at 2000 Hertz in bone conduction curve. It's a feature of otosclerosis. Acoustic dip, also called Boiler's notch. It's a dip at 4000 Hertz in AC/BC both. It's a feature of noise-induced hearing loss. Noise-induced hearing loss. Okay. Now, tuning fork test. Rene negative is a feature of conductive hearing loss. AC, or Rene negative is a feature of conductive hearing loss. BC is better than AC. Number 2, इसे याद आएगा. Weber heard in the poor ear means conductive hearing loss. And ABC poor means SNHL. Once again, Rene negative means conductive hearing loss. But the BC is better than AC. Weber heard in the poor ear means conductive hearing loss. And ABC poor means SNHL. But false negative Rene is a feature of unilateral severe SNHL. Bing test and Gillies test are special tuning fork tests for otosclerosis. Regarding the implants, bone anchored hearing aid, 3 indications to remember: EAC atresia, anosmia, and the chronic discharging over wet ear. Cochlear implant does direct electrical stimulation of the cochlear nerve, so the MRI must show normal 8 nerve. Indication of cochlear implant is bilateral profound SNHL, but 8 nerve should be normal. Age is 1 year. Totally deaf child. Then there are external part, internal part. External part of the cochlear implant is got 4 components: microphone, transmitter, speech processor, battery. Internal component is called electrode, which is put in the body. Its electrode is placed in scala tympani of the cochlea through round window. Okay. Then there is another device called auditory brainstem implant, ABI. It's placed in neurofibroma type 2. Neurofibroma type 2 has got bilateral vestibular schwannoma, also called bilateral acoustic neuroma. Both 8 nerve are faulty, so a cochlear implant is not of use. ABI is used better. And ABI is placed in lateral recess of 4th ventricle. Mind you, beta, cochlear implant का डालते हैं scala tympani of cochlea. The brainstem implant is placed in lateral recess of 4th ventricle. Beta. Okay, beta, fine. Now what to do after the class? Beta? 4 topics to do quickly. Beta. जैसे class fresh हो गए, ईयर के 4 टॉपिक पढ़ लेने पहले. Otosclerosis, लिख लो बेटा. Otosclerosis, acoustic neuroma, glomus jugulare, mean ears. In the evening, later night, tonight, I'll put 4 videos or one minute video for these 4 topics. So that when you are revised, एक बार फिर से वो 1 minute video सुनेंगे, main points सब revise हो जाएंगे. Okay, and please don't forget to revise facial nerve beta. Everybody write down facial nerve, add in that list beta. Add in that list or facial nerve, Bell's palsy, Ramsay syndrome must be revised beta. Everybody write down facial palsy, Bell's palsy. Let me tell you quickly Bell's palsy beta. Look at me. In Bell's palsy, there is sudden paralysis of one half of the nerve, one half of the face beta. Complete half of face paralyzed beta due to edema of the nerve. And which is the forehead involved or not? Yes, it is involved. The angle of mouth is divided to normal side beta, normal side. So the MCQ of the last time was Bell's palsy is idiopathic sudden onset lower motor neuron facial palsy. The edema of the nerve which is compressing the nerve. Is forehead involved in Bell's palsy? Yes. Angle of mouth is divided to normal side. Okay. So the answer was one complete half of face paralyzed with angle of mouth going to the normal side. Okay, but fine. And I hope you remember drug of choices, steroids. Steroids for the Bell's palsy. And in the Ramsay-Hunt syndrome, chicken pox reactivation, varicella zoster virus, Ramsay-Hunt syndrome, you know, the herpes zoster oticus, it's given the notes also. The virus gets reactivated in the facial nerve, in which ganglion? Geniculate ganglion. And the differentiating feature is in Bell's palsy, there's only facial palsy. There are no vesicles in the ear. But in Ramsay syndrome, there is facial nerve palsy. Along with that, there are some painful vesicle, herpes zoster vesicle in the external ear also. You give acyclovir and steroids over there. Okay. Now, guys, right after the class over, 4 topics: otosclerosis, acousyndroma, glomus and Meniere's, and the facial palsy, Bell's palsy, and herpes zoster oticus Ramsay syndrome to be revised. Rest we have done, you know, whatever is the main thing we have covered in the class only. And for these topics also, I'll be putting one minute video in the Telegram group of mine little later. Okay, fine. And that's all for a day. This is what I tried. I had in my mind actually what to touch upon this day. And I think we have gone through the major point of the ENT one more time. But till the time you appear in the exam, please revise the remaining part of the ENT, go through the things again, so that you're able to really, you know, crack the exam in a proper way. Now, before we finish the class, number one, my humble request to all of you, no one should skip the test of ENT tomorrow. Please don't skip any test, by the way. Number 2, take the test seriously. Number 3, follow the timeline. Don't be too hurried up. Don't finish it faster. There's no prize of finishing it faster. Number 4, tomorrow, kal sirf aisa nahi karna, ENT mein number lena. Tomorrow, let's practice of settling down now. Let us practice how to attempt the real paper. Read all the 4 choices carefully. After reading the full statement, till the because last letter is accept. And then you miss the word accept, then you lose the marks over there. Don't be in a hurry, beta. Some question will be twisted question. Try to see how you should not do silly mistake in that. My idea is not to see how many marks you score, beta. Honestly, I don't have any problem how many marks you score, beta. I don't really have that thing. But my idea is you should look into how we can convert this much knowledge into better marks, beta. Because if you reduce silly mistake now, your marks are going to get much better. Okay, last time like 148, 149, 141, 143, so many people were there. And you know, they think they've done 10 mistakes, 5 mistakes, 9. No, they've done 20, 30, 35 mistakes also better. Because the recall which comes the market later on is not the exact recall better. If we work on our silly mistakes, tomorrow let's make a target. ENT to chalo jitna aata ho karenge, silly mistake pe bhi kaam. Let us work on silly mistake also tomorrow. Okay. My heartfelt best wish, my heartfelt prayer for all of you is, may you all pass the exam. May you all parents feel proud of you. May all your parents should be really so happy with the decision they had taken. One day they sent you back to another country to study. They should be feeling pride in you. If you're a repeater, relate to me. I'm also a repeater. No problem. Let's not repeat the same mistakes. Do not have the burden of predicting the bad outcome every day. ये गलत बात हो जाती, ऐसे नहीं करना. Be neutral at least यार. पूरा positive नहीं सोचा था. At least be neutral, be prayerful. हमने क्लास शुरू करी थी एक ही बात साथ, with the prayer in the heart. May I pass. May my friends also pass. May I keep the hope of passing alive within me till the last second of exam is over. In Hindi, मैं भगवान करे मैं पास हो जाऊं, मेरे यार दोस्त पास हो जाए और मेरे अंदर से ये उम्मीद हमेशा बनी रहे कि मैं पास हो जाऊंगा जब तक कि आखिरी सेकंड खत्म हो जाए पेपर का. Let us finish the class once again with the same prayer. May I pass the exam. May my friends also pass the exam. May the hope of passing within me stay alive within me till the last second of exam is your behalf, Beta. I know that you do not know many things. It's okay. I know that you do not know many things, but I know that you know sufficient enough to pass the exam. Beta. I already know that you do not know many things in medical science. It's a vast science, Beta. Agreed. But I also know that you know sufficient enough to pass the exam. Only thing is, you should play 200% in these remaining 6 weeks now, 44 days. That's very, very humble request to all my younger brothers and sisters. Don't be lax, beta. Don't be negative. Don't be, like, mera padhai nahi ho raha. Be strict with yourself. Be disciplined. Tick ke padhna hai. Kal paper, tomorrow paper, ENT paper. Wear the shoes. Sit down the table chair. Do it properly, beta. Be strict with yourself, beta. Because I know you know sufficient enough to pass exam. Only thing is, let's revise as much as we can. Don't compare your preparation with your friend's preparation, beta. Everybody has a different journey. May you all pass the examination. Thank you very much for being, so much committed since morning. We are here right now. Thank you very much. And please revise one more time. And please do the 5 topics of ear, otosclerosis, carcinoma, glomus, meninus, and facial now. And after that, you revise the remaining part of the ENT. Thank you very much, guys. Thank you. Thanks a lot. I'll take your lead now. Any question anyone has, you can scribble. Any question anyone? Any question? Okay, good. No, I'm not leaking the paper. Thank you very much, guys. Thanks a lot. Oh yes, I'll take your leave. Please have your lunch, then relax, then start studying. Sure.